Section 30 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. Abducent nerve, facial nerve. 1F. The abducent nerve, nervus abducens. Sixth nerve. The abducent nerve supplies the rectus lateralis oculi. Its fibres arise from a small nucleus situated in the upper part of the rhomboid fossa, close to the middle line and beneath the colliculus facialis. They pass downward and forward through the pons and emerge in the furrow between the lower border of the pons and the upper end of the pyramid of the medulla oblongata. From the nucleus of the sixth nerve, fibres are said to pass through the medial longitudinal fasciculus to the oculomotor nerve of the opposite side, along which they are carried to the rectus medialis. The rectus lateralis of one eye and the rectus medialis of the other may therefore be said to receive their nerves from the same nucleus. The nerve pierces the dura mater on the dorsum sellae of the sphenoid, runs through a notch in the bone below the posterior clinoid process, and passes forward through the cavernous sinus on the lateral side of the internal carotid artery. It enters the orbit through the superior orbital fissure above the ophthalmic vein, from which it is separated by a lamina of dura mater. It then passes between the two heads of the rectus lateralis and enters the ocular surface of that muscle. The abducent nerve is joined by several filaments from the carotid and cavernous plexuses, and by one from the ophthalmic nerve. The oculomotor, trochlear, ophthalmic, and abducent nerves bear certain relations to each other in the cavernous sinus at the superior orbital fissure, and in the cavity of the orbit, as follows. In the cavernous sinus, the oculomotor, trochlear, and ophthalmic nerves are placed in the lateral wall of the sinus, in the order given from above downward. The abducent nerve lies at the lateral side of the internal carotid artery. As these nerves pass forward to the superior orbital fissure, the oculomotor and ophthalmic divide into branches, and the abducent nerve approaches the others, so that their relative positions are considerably changed. In the superior orbital fissure, the trochlear nerve and the frontal and lacrimal divisions of the ophthalmic lie in this order from the medial to the lateral side upon the same plane. They enter the cavity of the orbit above the muscles. The remaining nerves enter the orbit between the two heads of the rectus lateralis. The superior division of the oculomotor is the highest of these. Beneath this lies the nasociliary branch of the ophthalmic, then the inferior division of the oculomotor, and the abducent lowest of all. In the orbit, the trochlear, frontal, and lacrimal nerves lie immediately beneath the periosteum, the trochlear nerve resting on the obliquus superior, the frontal on the levator palpebrae superioris, and the lacrimal on the rectus lateralis. The superior division of the oculomotor nerve lies immediately beneath the rectus superior, while the nasociliary nerve crosses the optic nerve to reach the medial wall of the orbit. Beneath these is the optic nerve, surrounded in front by the ciliary nerves, and having the ciliary ganglion on its lateral side, between it and the rectus lateralis. Below the optic nerve are the inferior division of the oculomotor, and the abducent, the lateral lying on the medial surface of the rectus lateralis. 5G. The facial nerve, nervus facialis, seventh nerve. The facial nerve consists of a motor and a sensory part, the latter being frequently described under the name of the nervus intermedius, pars intermedii of Brisberg. The two parts emerge at the lower border of the pons in the recess between the olive and the inferior peduncle, the motor part being the more medial. Immediately to the lateral side of the sensory part is the acoustic nerve. The motor part supplies somatic motor fibres to the muscles of the face, scalp, and auricle, the buccinator and the platysma, the stapedius, the stylohyoideus, and posterior belly of the digastricus. It also contains some sympathetic motor fibres which constitute the vasodilator nerves of the submaxillary and sublingual glands, and are conveyed through the chorda tympani nerve. These are preganglionic fibres of the sympathetic system, and terminate in the submaxillary ganglion and small ganglia in the hilus of the submaxillary gland. From these ganglia, postganglionic fibres are conveyed to these glands. The sensory part contains the fibres of taste for the anterior 2/3 of the tongue, and a few somatic sensory fibres from the middle ear region. A few splanchnic sensory fibres are also present. The motor root arises from a nucleus which lies deeply in the reticular formation of the lower part of the pons. The nucleus is situated above the nucleus ambiguus, behind the superior olivary nucleus, and medial to the spinal tract of the trigeminal nerve. From this origin the fibres pursue a curved course in the substance of the pons. They first pass backward and medialward toward the rhomboid fossa, and, reaching the posterior end of the nucleus of the abducent nerve, run upward close to the middle line beneath the colliculus fasciculus. At the anterior end of the nucleus of the abducent nerve they make a second bend, and run downward and forward through the pons to their point of emergence between the olive and the inferior peduncle. The sensory root arises from the genicular ganglion, which is situated on the geniculum of the facial nerve in the facial canal, behind the hiatus of the canal. The cells of this ganglion are unipolar, and the single process divides in a T-shaped manner into central and peripheral branches. The central branches leave the trunk of the facial nerve in the internal acoustic meatus, and form the sensory root. The peripheral branches are continued into the chorda tympani and greater superficial petrosal nerves. Entering the brain at the lower border of the pons between the motor root and the acoustic nerve, the fibres of the sensory root pass into the substance of the medulla oblongata and end in the upper part of the terminal nucleus of the glossopharyngeal nerve and the fasciculus solitarius. From the superficial attachments to the brain, the two roots of the facial nerve pass lateralward and forward with the acoustic nerve to the internal acoustic meatus. In the meatus the motor root lies in the groove on the upper and anterior surface of the acoustic nerve, the sensory root being placed between them. At the bottom of the meatus the facial nerve enters the facial canal, which it traverses to its termination at the stylomastoid foramen. It is at first directed lateralward between the cochlea and vestibule toward the medial wall of the tympanic cavity. It then bends suddenly backward and arches downward behind the tympanic cavity to the stylomastoid foramen. The point where it changes its direction is named the geniculum. It presents a reddish gangliform swelling, the genicular ganglion, ganglion geniculi, geniculate ganglion, nucleus of the sensory root of the nerve. On emerging from the stylomastoid foramen, the facial nerve runs forward to the substance of the parotid gland, crosses the external carotid artery, and divides behind the ramus of the mandible into branches, from which numerous offsets are distributed over the side of the head, face, and upper part of the neck, supplying the superficial muscles in these regions. The branches and their offsets unite to form the parotid plexus. Branches of communication. The branches of communication of the facial nerve may be arranged as follows: in the internal meatus, with the acoustic nerve; at the genicular ganglion, with the sphenopalatine ganglion by the greater superficial petrosal nerve; with the otic ganglion by a branch which joins the lesser superficial petrosal nerve; with the sympathetic on the middle meningeal artery; in the facial canal, with the auricular branch of the vagus; at its exit from the stylomastoid foramen, with the glossopharyngeal, with the vagus, with the great auricular, with the auriculotemporal; behind the ear, with the lesser occipital; on the face, with the trigeminal; in the neck, with the cutaneous cervical. In the internal acoustic meatus some minute filaments pass from the facial to the acoustic nerve. The greater superficial petrosal nerve, large superficial petrosal nerve, arises from the genicular ganglion and consists chiefly of sensory branches which are distributed to the mucous membrane of the soft palate, but it probably contains a few motor fibres which form the motor root of the sphenopalatine ganglion. It passes forward through the hiatus of the facial canal and runs in a sulcus on the anterior surface of the petrous portion of the temporal bone beneath the semilunar ganglion to the foramen lacerum. It receives a twig from the tympanic plexus, and in the foramen is joined by the deep petrosal from the sympathetic plexus on the internal carotid artery to form the nerve of the pterygoid canal, which passes forward through the pterygoid canal and ends in the sphenopalatine ganglion. The genicular ganglion is connected with the otic ganglion by a branch which joins the lesser superficial petrosal nerve, and also with the sympathetic filaments accompanying the middle meningeal artery. According to Arnold, a twig passes back from the ganglion to the acoustic nerve. Just before the facial nerve emerges from the stylomastoid foramen, it generally receives a twig from the auricular branch of the vagus. After its exit from the stylomastoid foramen, the facial nerve sends a twig to the glossopharyngeal, and communicates with the auricular branch of the vagus, with the great auricular nerve of the cervical plexus, with the auricular temporal nerve in the parotid gland, and with the lesser occipital behind the ear, on the face with the terminal branches of the trigeminal, and in the neck with the cutaneous cervical nerve. Branches of distribution. The branches of distribution of the facial nerve may be thus arranged: with the facial canal, nerve to the stapedius muscle, chorda tympani; at its exit from the stylomastoid foramen, posterior auricular, digastric, stylohyoid; on the face, temporal, zygomatic, buccal, mandibular, cervical. The nerve to the stapedius, nervus stapedius, tympanic branch, arises opposite the pyramidal eminence. It passes through a small canal in this eminence to reach the muscle. The chorda tympani nerve is given off from the facial as it passes downward behind the tympanic cavity, about 6 mm from the stylomastoid foramen. It runs upward and forward in a canal, and enters the tympanic cavity, through an aperture, iter chordae posterius, on its posterior wall, close to the medial surface of the posterior border of the tympanic membrane, and on a level with the upper end of the manubrium of the malleus. It traverses this tympanic cavity, between the fibrous and mucous layers of the tympanic membrane, crosses the manubrium of the malleus, and emerges from the cavity through a foramen situated at the inner end of the petrotympanic fissure, and named the iter chordae anterius, canal of Hugier. It then descends between the pterygodeus externus and internus on the medial surface of the spina angularis of the sphenoid, which it sometimes grooves and joins at an acute angle the posterior border of the lingual nerve. It receives a few efferent fibres from the motor root. These enter the submaxillary ganglion, and through it are distributed to the submaxillary and sublingual glands. The majority of its fibres are afferent, and are continued onward through the muscular substance of the tongue to the mucous membrane covering its anterior 2/3. They constitute the nerve of taste for this portion of the tongue. Before uniting with the lingual nerve, the chorda tympani is joined by a small branch from the otic ganglion. The posterior auricular nerve, nervus auricularis posterior, arises close to the stylomastoid foramen, and runs upward in front of the mastoid process. Here it is joined by a filament from the auricular branch of the vagus, and communicates with the posterior branch of the great auricular and with the lesser occipital. As it ascends between the external acoustic meatus and mastoid process, it divides into auricular and occipital branches. The auricular branch supplies the auricularis posterior, and the intrinsic muscles on the cranial surface of the auricula. The occipital branch, the larger, passes backward along the superior nuchal line of the occipital bone, and supplies the occipitalis. The digastric branch, ramus digastricus, arises close to the stylomastoid foramen, and divides into several filaments, which supply the posterior belly of the digastricus. One of these filaments joins the glossopharyngeal nerve. The stylohyoid branch, ramus stylohyoideus, frequently arises in conjunction with the digastric branch. It is long and slender, and enters the stylohyoideus about its middle. The temporal branches, rami temporalis, cross the zygomatic arch to the temporal region, supplying the auricularis anterior and superior, and joining with the zygomatico-temporal branch of the maxillary, and with the auricular-temporal branch of the mandibular. The more anterior branches supply the frontalis, the orbicularis oculi, and the corrugator, and join the supraorbital and lacrimal branches of the ophthalmic. The zygomatic branches, rami zygomatici, malar branches, run across the zygomatic bone to the lateral angle of the orbit, where they supply the orbicularis oculi, and join with filaments from the lacrimal nerve and the zygomatico-facial branch of the maxillary nerve. The buccal branches, rami buccales, infraorbital branches, of larger size than the rest, pass horizontally forward to be distributed below the orbit and around the mouth. The superficial branches run beneath the skin and above the superficial muscles of the face, which they supply. Some are distributed to the procerus, joining at the medial angle of the orbit with the infratrochlear and nasociliary branches of the ophthalmic. The deep branches pass beneath the zygomaticus and the quadratus labii superioris, supplying them and forming an infraorbital plexus with the infraorbital branch of the maxillary nerve. These branches also supply the small muscles of the nose. The lower deep branches supply the buccinator and orbicularis oris, and join with filaments of the buccinator branch of the mandibular nerve. The mandibular branch, ramus marginalis mandibulae, passes forward beneath the platysma and the triangularis, supplying the muscles of the lower lip and chin, and communicating with the mental branch of the inferior alveolar nerve. The cervical branch, ramus colli, runs forward beneath the platysma, and forms a series of arches across the side of the neck over the suprahyoid region. One branch descends to join the cervical cutaneous nerve from the cervical plexus. Others supply the platysma. End of section 30. Section 31 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4 by Henry Gray. The acoustic nerve, the glossopharyngeal nerve. 5H. The acoustic nerve. 8th nerve. The acoustic nerve consists of two distinct sets of fibres which differ in their peripheral endings, central connections, functions, and time of medullation. It is soft in texture and devoid of neurolemma. Cochlear nerve. The cochlear nerve or root, the nerve of hearing, arises from bipolar cells in the spiral ganglion of the cochlea, situated near the inner edge of the osseous spiral lamina. The peripheral fibres pass to the organ of Corti. The central ones pass down the modiolus and then through the foramina of the tractus spiralis foraminosus, or through the foramen centrale into the lateral or outer end of the internal auditory meatus. The nerve passes along the internal auditory meatus with the vestibular nerve and across the subarachnoid space, just above the flocculus, almost directly medialward toward the inferior peduncle, to terminate in the cochlear nucleus. The cochlear nerve is placed laterally to the vestibular root. Its fibres end in two nuclei. One, the accessory nucleus, lies immediately in front of the inferior peduncle. The other, the tuberculum acousticum, somewhat lateral to it. The stria medullaris, stria acousticae, are the axons of the cells of the tuberculum acousticum. They pass over the inferior peduncle and across the rhomboid fossa to the median sulcus. Here they dip into the substance of the pons, to end around the cells of the superior olivary nuclei of both sides. There are, however, other fibres, and these are both direct and crossed, which passed into the lateral lemniscus. The cells of the accessory nucleus give origin to fibres which run transversely in the pons and constitute the trapezium. Of the trapezoid fibres, some end around the cells of the superior olivary nucleus or of the trapezoid nucleus of the same or opposite side, while others, crossed or uncrossed, pass directly into the lateral lemniscus. If the further connections of the cochlear nerve of one side, say the left, be considered, it is found that they lie lateral to the main sensory tract, the lemniscus, and are therefore termed the lateral lemniscus. The fibres comprising the left lateral lemniscus arise in the superior olivary and trapezoid nuclei of the same or opposite side, while others are the uninterrupted fibres already alluded to, and these are either crossed or uncrossed, the former being the axons of the cells of the right accessory nucleus or of the cells of the right tuberculum acousticum, while the latter are derived from the cells of the left nuclei. In the upper part of the lateral lemniscus there is a collection of nerve cells, the nucleus of the lateral lemniscus, around the cells of which some of the fibres arborize, and from the cells of which axons originate to continue upward this tract of the lateral lemniscus. The ultimate ending of the left lateral lemniscus is partly in the opposite medial geniculate body and partly in the inferior colliculi. From the cells of these bodies new fibres arise and ascend in the occipital part of the internal capsule to reach the posterior 3/5 of the left superior temporal gyrus and the transverse temporal gyri. Vestibular nerve. The vestibular nerve or root, the nerve of equilibration, arises from bipolar cells in the vestibular ganglion, ganglion of Scarpa, which is situated in the upper part of the outer end of the internal auditory meatus. The peripheral fibres divide into 3 branches. The superior branch passes through the foramina in the area vestibularis superior, and ends in the utricle and in the ampullae of the superior and lateral semicircular ducts. The fibres of the inferior branch traverse the foramina in the area vestibularis inferior and end in the saccule. The posterior branch runs through the foramen cingulare and supplies the ampulla of the posterior semicircular duct. 5I. The glossopharyngeal nerve. Nervus glossopharyngeus. 9th nerve. The glossopharyngeal nerve contains both motor and sensory fibres, and is distributed, as its name implies, to the tongue and pharynx. It is the nerve of ordinary sensation to the mucous membrane of the pharynx, fauces, and palatine tonsil, and the nerve of taste to the posterior part of the tongue. It is attached by 3 or 4 filaments to the upper part of the medulla oblongata, in the groove between the olive and the inferior peduncle. The sensory fibres arise from the cells of the superior and petrous ganglia, which are situated on the trunk of the nerve and will be presently described. When traced into the medulla, some of the sensory fibres, probably sympathetic afferent, end by arborizing around the cells of the upper part of the nucleus, which lies between the ala cinerea in the lower part of the rhomboid fossa. Many of the fibres, probably the taste fibres, contribute to form a strand, named the fasciculus solitarius, which descends in the medulla oblongata. Associated with this strand are numerous nerve cells, and around these the fibres of the fasciculus end. The somatic sensory fibres, few in number, are said to join the spinal tract of the trigeminal nerve. The somatic motor fibres spring from the cells of the nucleus ambiguus, which lies some distance from the surface of the rhomboid fossa in the lateral part of the medulla, and is continuous below with the anterior grey column of the medulla spinalis. From this nucleus the fibres are first directed backward, and then they bend forward and lateralward to join the fibres of the sensory root. The nucleus ambiguus gives origin to the motor branches of the glossopharyngeal and vagus nerves, and to the cranial part of the accessory nerve. The sympathetic efferent fibres from the nucleus beneath the ala cinerea, the dorsal nucleus, are probably both preganglionic motor fibres and preganglionic secretory fibres of the sympathetic system. The secretory fibres pass to the otic ganglion, and from it secondary neurons are distributed to the parotid gland. Some authors describe these fibres as arising from a distinct nucleus, the inferior salivatory nucleus, which lies near the dorsal nucleus. From the medulla oblongata, the glossopharyngeal nerve passes lateralward across the flocculus and leaves the skull through the central part of the jugular foramen in a separate sheath of the dura mater, lateral to and in front of the vagus and accessory nerves. In its passage through the jugular foramen, it grooves the lower border of the petrous part of the temporal bone and, at its exit from the skull, passes forward between the internal jugular vein and internal carotid artery. It descends in front of the latter vessel, and beneath the styloid process and the muscles connected with it, to the lower border of the stylopharyngeus. It then curves forward, forming an arch on the side of the neck and lying upon the stylopharyngeus and constrictor pharyngeus medius. Thence it passes under cover of the hyoglossus, and is finally distributed to the palatine tonsil, the mucous membrane of the fauces and base of the tongue, and the mucous glands of the mouth. In passing through the jugular foramen, the nerve presents 2 ganglia, the superior and the petrous. The superior ganglion, ganglion superius, jugular ganglion, is situated in the upper part of the groove, in which the nerve is lodged during its passage through the jugular foramen. It is very small, and is usually regarded as a detached portion of the petrous ganglion. The petrous ganglion, ganglion petrosum, inferior ganglion, is larger than the superior, and is situated in a depression in the lower border of the petrous portion of the temporal bone. Branches of communication. The glossopharyngeal nerve communicates with the vagus, sympathetic, and facial. The branches to the vagus are 2 filaments which arise from the petrous ganglion, one passing to the auricular branch, and the other to the jugular ganglion of the vagus. The petrous ganglion is connected by a filament with the superior cervical ganglion of the sympathetic. The branch of communication with the facial perforates the posterior belly of the digastricus. It arises from the trunk of the glossopharyngeal below the petrous ganglion, and joins the facial just after the exit of that nerve from the stylomastoid foramen. Branches of distribution. The branches of distribution of the glossopharyngeal are the tympanic, carotid, pharyngeal, muscular, tonsillar, and lingual. The tympanic nerve, nervus tympanicus, nerve of Jacobson, arises from the petrous ganglion, and ascends to the tympanic cavity through a small canal on the under surface of the petrous portion of the temporal bone on the ridge which separates the carotid canal from the jugular fossa. In the tympanic cavity it divides into branches which form the tympanic plexus and are contained in grooves upon the surface of the promontory. This plexus gives off 1. The lesser superficial petrosal nerve, 2. A branch to join the greater superficial petrosal nerve, and 3. Branches to the tympanic cavity, all of which will be described in connection with the anatomy of the middle ear. The carotid branches, nervus carotico-tympanicus superior and nervus carotico-tympanicus inferior, descend along the trunk of the internal carotid artery as far as its origin, communicating with the pharyngeal branch of the vagus, and with the branches of the sympathetic. The pharyngeal branches, rami pharyngei, are 3 or 4 filaments which unite opposite the constrictor pharyngeus medius with the pharyngeal branches of the vagus and sympathetic to form the pharyngeal plexus. Branches from this plexus perforate the muscular coat of the pharynx and supply its muscles and mucous membrane. The muscular branch, ramus stylopharyngeus, is distributed to the stylopharyngeus. The tonsillar branches, rami tonsillaris, supply the palatine tonsil, forming around it a plexus from which filaments are distributed to the soft palatine fauces, where they communicate with the palatine nerves. The lingual branches, rami lingualis, are 2 in number. One supplies the papillae velatae and the mucous membrane covering the base of the tongue. The other supplies the mucous membrane and follicular glands of the posterior part of the tongue, and communicates with the lingual nerve. End of section number 31. Section 32 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. The vagus nerve. 5J. The vagus nerve. Nervus vagus, 10th nerve, pneumogastric nerve. The vagus nerve is composed of both motor and sensory fibres, and has a more extensive course and distribution than any of the other cranial nerves, since it passes through the neck and thorax to the abdomen. The vagus is attached by 8 or 10 filaments to the medulla oblongata, in the groove between the olive and the inferior peduncle, below the glossopharyngeal. The sensory fibres arise from the cells of the jugular ganglion and ganglion nodosum of the nerve, and, when traced into the medulla oblongata, mostly end by arborizing around the cells of the inferior part of a nucleus which lies beneath the ala cinerea in the lower part of the rhomboid fossa. These are the sympathetic afferent fibres. Some of the sensory fibres of the glossopharyngeal nerve have been seen to end in the upper part of this nucleus. A few of the sensory fibres of the vagus, probably taste fibres, descend in the fasciculus solitarius and end around its cells. The somatic sensory fibres, few in number, from the posterior part of the external auditory meatus and the back of the ear, probably join the spinal tract of the trigeminal as it descends in the medulla. The somatic motor fibres arise from the cells of the nucleus ambiguus, already referred to in connection with the motor route of the glossopharyngeal nerve. The sympathetic efferent fibres, distributed probably as preganglionic fibres to the thoracic and abdominal viscera, i.e. as motor fibres to the bronchial tree, inhibitory fibres to the heart, motor fibres to the esophagus, stomach, small intestine and gall passages, and as secretory fibres to the stomach and pancreas, arise from the dorsal nucleus of the vagus. The filaments of the nerve unite and form a flat cord, which passes beneath the flocculus to the jugular foramen, through which it leaves the cranium. In emerging through this opening, the vagus is accompanied by and contained in the same sheath of dura mater with the accessory nerve, a septum separating them from the glossopharyngeal which lies in front. In this situation the vagus presents a well-marked ganglionic enlargement, which is called the jugular ganglion (ganglion of the root). To it the accessory nerve is connected by one or two filaments. After its exit from the jugular foramen, the vagus is joined by the cranial portion of the accessory nerve, and enlarges into a second gangliform swelling, called the ganglion nodosum (ganglion of the trunk). Through this the fibres of the cranial portion of the accessory pass without interruption, being principally distributed to the pharyngeal and superior laryngeal branches of the vagus. But some of its fibres descend in the trunk of the vagus, to be distributed with the recurrent nerve and probably also with the cardiac nerves. The vagus nerve passes vertically down the neck within the carotid sheath, lying between the internal jugular vein and internal carotid artery, as far as the upper border of the thyroid cartilage, and then between the same vein and the common carotid artery to the root of the neck. The further course of the nerve differs on the two sides of the body. On the right side, the nerve passes across the subclavian artery between it and the right innominate vein, and descends by the side of the trachea to the back of the root of the lung, where it spreads out in the posterior pulmonary plexus. From the lower part of this plexus two cords descend on the esophagus, and divide to form, with branches from the opposite nerve, the esophageal plexus. Below, these branches are collected into a single cord, which runs along the back of the esophagus, enters the abdomen, and is distributed to the postero-inferior surface of the stomach, joining the left side of the celiac plexus, and sending filaments to the lienal plexus. On the left side, the vagus enters the thorax between the left carotid and subclavian arteries, behind the innominate vein. It crosses the left side of the arch of the aorta, and descends behind the root of the left lung, forming there the posterior pulmonary plexus. From this it runs along the anterior surface of the esophagus, where it unites with the nerve of the right side in the esophageal plexus, and is continued to the stomach, distributing branches over its anterosuperior surface. Some of these extend over the fundus and others along the lesser curvature. Filaments from these branches enter the lesser omentum and join the hepatic plexus. The jugular ganglion, ganglion jugulare, ganglion of the root, is of a greyish colour, spherical in form, about 4 mm in diameter. Branches of communication. This ganglion is connected by several delicate filaments to the cranial portion of the accessory nerve. It also communicates by a twig with the petrous ganglion of the glossopharyngeal, with the facial nerve by means of its auricular branch, and with the sympathetic by means of an ascending filament from the superior cervical ganglion. The ganglion nodosum, ganglion of the trunk, inferior ganglion, is cylindrical in form, of a reddish colour, and 2.5 cm in length. Passing through it is the cranial portion of the accessory nerve, which blends with the vagus below the ganglion. Branches of communication. This ganglion is connected with the hypoglossal, the superior cervical ganglion of the sympathetic, and the loop between the first and second cervical nerves. Branches of distribution. The branches of distribution of the vagus are: in the jugular fossa, meningeal, auricular; in the neck, pharyngeal, superior laryngeal, recurrent, superior cardiac; in the thorax, inferior cardiac, anterior bronchial, posterior bronchial, esophageal; in the abdomen, gastric, celiac, hepatic. The meningeal branch, ramus meningeus, dural branch, is a recurrent filament given off from the jugular ganglion. It is distributed to the dura mater in the posterior fossa of the base of the skull. The auricular branch, ramus auricularis, nerve of Arnold, arises from the jugular ganglion and is joined soon after its origin by a filament from the petrous ganglion of the glossopharyngeal. It passes behind the internal jugular vein and enters the mastoid canaliculus on the lateral wall of the jugular fossa. Traversing the substance of the temporal bone, it crosses the facial canal about 4 mm above the stylomastoid foramen, and here it gives off an ascending branch which joins the facial nerve. The nerve reaches the surface by passing through the tympanomastoid fissure between the mastoid process and the tympanic part of the temporal bone, and divides into two branches. One joins the posterior auricular nerve, The other is distributed to the skin of the back of the auricula, and to the posterior part of the external acoustic meatus. The pharyngeal branch, ramus pharyngeus, the principal motor nerve of the pharynx, arises from the upper part of the ganglion nodosum, and consists principally of filaments from the cranial portion of the accessory nerve. It passes across the internal carotid artery to the upper border of the constrictor pharyngis medius, where it divides into numerous filaments, which join with branches from the glossopharyngeal, sympathetic, and external laryngeal to form the pharyngeal plexus. From the plexus, branches are distributed to the muscles and mucous membrane of the pharynx and the muscles of the soft palate, except the tensor veli palatini. A minute filament descends and joins the hypoglossal nerve as it winds around the occipital artery. The superior laryngeal nerve, nervus laryngeus superior, larger than the preceding, arises from the middle of the ganglion nodosum, and in its course receives a branch from the superior cervical ganglion of the sympathetic. It descends by the side of the pharynx behind the internal carotid artery, and divides into two branches, external and internal. The external branch, ramus externus, the smaller, descends on the larynx beneath the sternothyreoideus to supply the cricothyreoideus. It gives branches to the pharyngeal plexus and the constrictor pharyngis inferior, and communicates with the superior cardiac nerve behind the common carotid artery. The internal branch, ramus internus, descends to the hyothyroid membrane, pierces it in company with the superior laryngeal artery, and is distributed to the mucous membrane of the larynx. Of these branches some are distributed to the epiglottis, the base of the tongue, and the epiglottic glands. Others pass backward in the aryepiglottic fold to supply the mucous membrane surrounding the entrance of the larynx, and that lining the cavity of the larynx as low down as the vocal folds. A filament descends beneath the mucous membrane on the inner surface of the thyroid cartilage and joins the recurrent nerve. The recurrent nerve, nervus recurrens, inferior or recurrent laryngeal nerve, arises on the right side in front of the subclavian artery, winds from before backward around that vessel, and ascends obliquely to the side of the trachea behind the common carotid artery, and either in front of or behind the inferior thyroid artery. On the left side it arises on the left of the arch of the aorta, and winds below the aorta at the point where the ligamentum arteriosum is attached, and then ascends to the side of the trachea. The nerve on either side ascends in the groove between the trachea and the esophagus, passes under the lower border of the constrictor pharyngis inferior, and enters the larynx behind the articulation of the inferior cornu of the thyroid cartilage, with the cricoid. It is distributed to all the muscles of the larynx, excepting the cricothyreoideus. It communicates with the internal branch of the superior laryngeal nerve, and gives off a few filaments to the mucous membrane of the lower part of the larynx. As the recurrent nerve hooks around the subclavian artery or aorta, it gives off several cardiac filaments to the deep part of the cardiac plexus. As it ascends in the neck it gives off branches, more numerous on the left than on the right side, to the mucous membrane and muscular coat of the esophagus, branches to the mucous membrane and muscular fibres of the trachea, and some pharyngeal filaments to the constrictor pharyngis inferior. The superior cardiac branches, rami cardiaci superiores, cervical cardiac branches, 2 or 3 in number, arise from the vagus at the upper and lower parts of the neck. The upper branches are small, and communicate with the cardiac branches of the sympathetic. They can be traced to the deep part of the cardiac plexus. The lower branch arises at the root of the neck, just above the first rib. That from the right vagus passes in front of, or by the side of the innominate artery, and proceeds to the deep part of the cardiac plexus. That from the left runs down the left side of the arch of the aorta, and joins the superficial part of the cardiac plexus. The inferior cardiac branches, rami cardiaci inferiores, thoracic cardiac branches, on the right side, arise from the trunk of the vagus as it lies by the side of the trachea, and from its recurrent nerve. On the left side from the recurrent nerve only. Passing inward, they end in the deep part of the cardiac plexus. The anterior bronchial branches, rami bronchialis anteriores, anterior or ventral pulmonary branches, 2 or 3 in number, and of small size, are distributed on the anterior surface of the root of the lung. They join with filaments from the sympathetic and form the anterior pulmonary plexus. The posterior bronchial branches, rami bronchialis posteriores, posterior or dorsal pulmonary branches, more numerous and larger than the anterior, are distributed on the posterior surface of the root of the lung. They are joined by filaments from the third and fourth, sometimes also from the first and second, thoracic ganglia of the sympathetic trunk, and form the posterior pulmonary plexus. Branches from this plexus accompany the ramifications of the bronchi through the substance of the lung. The esophageal branches, rami esophagei, are given off both above and below the bronchial branches. The lower are numerous and larger than the upper. They form, together with the branches from the opposite nerve, the esophageal plexus. From this plexus filaments are distributed to the back of the pericardium. The gastric branches, rami gastrici, are distributed to the stomach. The right vagus forms the posterior gastric plexus on the postero-inferior surface of the stomach, and the left the anterior gastric plexus on the antero-superior surface. The coeliac branches, rami coeliaci, are mainly derived from the right vagus. They join the coeliac plexus and through it supply branches to the pancreas, spleen, kidneys, suprarenal bodies, and intestine. The hepatic branches, rami hepatici, arise from the left vagus. They join the hepatic plexus and through it are conveyed to the liver. End of Part 32. Section 33 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information, or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. Accessory nerve, hypoglossal nerve. 5K, the accessory nerve. Nervus accessorius. 11th nerve, spinal accessory nerve. The accessory nerve consists of two parts, a cranial and a spinal. The cranial part, ramus internus, accessory portion, is the smaller of the two. Its fibres arise from the cells of the nucleus ambiguus and emerge as 4 or 5 delicate rootlets from the side of the medulla oblongata, below the roots of the vagus. It runs lateralward to the jugular foramen, where it interchanges fibres with the spinal portion, or becomes united to it for a short distance. Here it is also connected by 1 or 2 filaments with the jugular ganglion of the vagus. It then passes through the jugular foramen, separates from the spinal portion, and is continued over the surface of the ganglion nodosum of the vagus, to the surface of which it is adherent, and is distributed principally to the pharyngeal and superior laryngeal branches of the vagus. Through the pharyngeal branch it probably supplies the musculus uvulae and levator vellae palatini. Some few filaments from it are continued into the trunk of the vagus below the ganglion, to be distributed with the recurrent nerve and probably also with the cardiac nerves. The spinal part, ramus externus, spinal portion, is firm in texture, and its fibres arise from the motor cells in the lateral part of the anterior column of the grey substance of the medulla spinalis as low as the 5th cervical nerve. Passing through the lateral funiculars of the medulla spinalis, they emerge on its surface and unite to form a single trunk, which ascends between the ligamentum denticulatum and the posterior roots of the spinal nerves, enters the skull through the foramen magnum, and is then directed to the jugular foramen, through which it passes, lying in the same sheath of dura mater as the vagus, but separated from it by a fold of the arachnoid. In the jugular foramen it receives 1 or 2 filaments from the cranial part of the nerve, or else joins it for a short distance and then separates from it again. At its exit from the jugular foramen, it runs backward in front of the internal jugular vein in 66.6% of cases, and behind it in 33.3%. Tandler. The nerve then descends obliquely behind the digastricus and stylohyoideus to the upper part of the sternocleidomastoideus. It pierces this muscle and courses obliquely across the posterior triangle of the neck to end in the deep surface of the trapezius. As it traverses the sternocleidomastoideus, it gives several filaments to the muscle, and joins with branches from the 2nd cervical nerve. In the posterior triangle it unites with the 2nd and 3rd cervical nerve, while beneath the trapezius it forms a plexus with the third and fourth cervical nerves, and from this plexus fibres are distributed to the muscle. 5L. The hypoglossal nerve. Nervus hypoglossus, 12th nerve. The hypoglossal nerve is the motor nerve of the tongue. Its fibres arise from the cells of the hypoglossal nucleus, which is an upward prolongation of the base of the anterior column of grey substance of the medulla spinalis. This nucleus is about 2 cm in length, and its upper part corresponds with the trigonum hypoglossae, or lower portion of the medial eminence of the rhomboid fossa. The lower part of the nucleus extends downward into the closed part of the medulla oblongata, and there lies in relation to the ventrolateral aspect of the central canal. The fibres run forward through the medulla oblongata and emerge in the anterolateral sulcus between the pyramid and the olive. The rootlets of this nerve are collected into 2 bundles, which perforate the dura mater separately, opposite the hypoglossal canal in the occipital bone, and unite together after their passage through it. In some cases the canal is divided into 2 by a small bony spicule. The nerve descends almost vertically to a point corresponding with the angle of the mandible. It is at first deeply seated beneath the internal carotid artery and internal jugular vein, and intimately connected with the vagus nerve. It then passes forward between the vein and artery, and lower down in the neck becomes superficial below the digastricus. The nerve then loops around the occipital artery, and crosses the external carotid and lingual arteries below the tendon of the digastricus. It passes beneath the tendon of the digastricus, the stylohyoideus, and the mylohyoideus, lying between the last named muscle and the hyoglossus, and communicates at the anterior border of the hyoglossus with the lingual nerve. It is then continued forward in the fibres of the genioglossus as far as the tip of the tongue, distributing branches to its muscular substance. Branches of communication. Its branches of communication are with the vagus, first and second cervical nerves, sympathetic, lingual. The communications with the vagus take place close to the skull, numerous filaments passing between the hypoglossal and the ganglion nodosum of the vagus through the mass of connective tissue which unites the 2 nerves. As the nerve winds round the occipital artery, it gives off a filament to the pharyngeal plexus. The communication with the sympathetic takes place opposite the atlas by branches derived from the superior cervical ganglion, and in the same situation the nerve is joined by a filament derived from the loop connecting the first and second cervical nerves. The communications with the lingual take place near the anterior border of the hyoglossus by numerous filaments which extend upon the muscle. Branches of distribution. The branches of distribution of the hypoglossal nerve are meningeal, thyrohyoid, descending, muscular. Of these branches, the meningeal, descending, thyrohyoid, and the muscular twig to the geniohyoideus are probably derived mainly from the branch which passes from the loop between the first and second cervical to join the hypoglossal. Meningeal branches, dural branches. As the hypoglossal nerve passes through the hypoglossal canal, it gives off, according to Luschka, several filaments to the dura mater in the posterior fossa of the skull. The descending ramus, ramus descendens, descendens hypoglossae, long and slender, quits the hypoglossal where it turns around the occipital artery and descends in front of, or in the sheath of, the carotid vessels. It gives a branch to the superior belly of the omohyoideus, and then joins the communicantes cervicalis from the second and third cervical nerves, just below the middle of the neck, to form a loop, the ansa hypoglossae. From the convexity of this loop, branches pass to supply the sternohyoideus, the sternothyreoideus, and the inferior belly of the omohyoideus. According to Arnold, another filament descends in front of the vessels into the thorax and joins the cardiac and phrenic nerves. The thyrohyoid branch, ramus thyrohyoideus, arises from the hypoglossal near the posterior border of the hyoglossus. It runs obliquely across the greater conure of the hyoid bone and supplies the thyrohyoideus muscle. The muscular branches are distributed to the styloglossus, hyoglossus, geniohyoideus, and genioglossus. At the undersurface of the tongue, numerous slender branches pass upward into the substance of the organ to supply its intrinsic muscles. End of Part 33.
Section 34 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 4, by Henry Gray. The spinal nerves. Nervi spinalis. The spinal nerves spring from the medulla spinalis and are transmitted through the intervertebral foramina. They number 31 pairs, which are grouped as follows: cervical 8, thoracic 12, lumbar 5, sacral 5, coccygeal 1. The first cervical nerve emerges from the vertebral canal between the occipital bone and the atlas, and is therefore called the suboccipital nerve. The eighth issues between the seventh cervical and first thoracic vertebrae. Nerve roots. Each nerve is attached to the medulla spinalis by two roots, an anterior or ventral and a posterior or dorsal, the latter being characterized by the presence of a ganglion, the spinal ganglion. The anterior root, radix anterior, ventral root, emerges from the anterior surface of the medulla spinalis as a number of rootlets or filaments, phyla radicularia, which coalesce to form two bundles near the intervertebral foramen. The posterior root, radix posterior, dorsal root, is larger than the anterior, owing to the greater size and number of its rootlets. These are attached along the posterior lateral furrow of the medulla spinalis and unite to form two bundles which join the spinal ganglion. The posterior root of the first cervical nerve is exceptional in that it is smaller than the anterior. It is occasionally wanting. The spinal ganglia, ganglion spinali, are connections of nerve cells on the posterior roots of the spinal nerves. Each ganglion is oval in shape, reddish in color, and its size bears a proportion to that of the nerve root on which it is situated. It is bifid medially, where it is joined by the two bundles of the posterior nerve root. The ganglia are usually placed in the intervertebral foramina, immediately outside the points where the nerve roots perforate the dura mater, but there are exceptions to this rule. Thus the ganglia of the first and second cervical nerves lie on the vertebral arches of the atlas and axis, respectively. Those of the sacral nerves are inside the vertebral canal, while that on the posterior root of the coccygeal nerve is placed within the sheath of the dura mater. Structure. The ganglia consist chiefly of unipolar nerve cells, and from these the fibers of the posterior root take origin, the single process of each cell dividing after a short course into a central fiber which enters the medulla spinalis and a peripheral fiber which runs into the spinal nerve. Two other forms of cells are, however, present, namely, a. the cells of Dog-Yale, whose axons ramify close to the cell, type 2 of Golgi, and are distributed entirely within the ganglion, and b. multipolar cells similar to those found in the sympathetic ganglia. The ganglia of the first cervical nerve may be absent, while small aberrant ganglia consisting of groups of nerve cells are sometimes found on the posterior roots between the spinal ganglia and the medulla spinalis. Each nerve root receives a covering from the pia mater and is loosely invested by the arachnoid, the latter being prolonged as far as the points where the roots pierce the dura mater. The two roots pierce the dura mater separately, each receiving a sheath from this membrane, where the roots join to form the spinal nerve. This sheath is continuous with the epineurium of the nerve. Size and direction. The roots of the upper four cervical nerves are small, those of the lower four are large. The posterior roots of the cervical nerves bear a proportion to the anterior of 3:1, which is greater than in the other regions. Their individual filaments are also larger than those of the anterior roots. The posterior root of the first cervical is an exception to this rule, being smaller than the anterior root. In 8% of cases it is wanting. The roots of the first and second cervical nerves are short, and run nearly horizontally to their points of exit from the vertebral canal. From the second to the eighth cervical they are directed obliquely downward, the obliquity and length of the roots successively increasing. The distance, however, between the level of attachment of any of these roots to the medulla spinalis and the points of exit of the corresponding nerves never exceeds the depth of one vertebra. The roots of the thoracic nerves, with the exception of the first, are of small size, and the posterior only slightly exceed the anterior in thickness. They increase successively in length, from above downward, and in the lower part of the thoracic region descend in contact with the medulla spinalis for a distance equal to the height of at least two vertebrae before they emerge from the vertebral canal. The roots of the lower lumbar and upper sacral nerves are the largest, and their individual filaments the most numerous of all the spinal nerves, while the roots of the coccygeal nerve are the smallest. The roots of the lumbar, sacral, and coccygeal nerves run vertically downward to their respective exits, and as the medulla spinalis ends near the lower border of the first lumbar vertebra, it follows that the length of the successive roots must rapidly increase. As already mentioned, the term cauda equina is applied to this collection of nerve roots. From the description given, it will be seen that the largest nerve roots, and consequently the largest spinal nerves, are attached to the cervical and lumbar swellings of the medulla spinalis. These nerves are distributed to the upper and lower limbs. Connections with the sympathetic. Immediately beyond the spinal ganglion, the anterior and posterior nerve roots unite to form the spinal nerve, which emerges through the intervertebral foramen. Each spinal nerve receives a branch, gray ramus communicans, from the adjacent ganglion of the sympathetic trunk, while the thoracic and the first and second lumbar nerves each contribute a branch, white ramus communicans, to the adjoining sympathetic ganglion. The second, third, and fourth sacral nerves also supply white rami. These, however, are not connected with the ganglia of the sympathetic trunk, but run directly into the pelvic plexuses of the sympathetic. Structure. Each typical spinal nerve contains fibers belonging to two systems, namely the somatic and the sympathetic or splanchnic, as well as fibers connecting these systems with each other. 1. The somatic fibers are efferent and afferent. The efferent fibers originate in the cells of the anterior column of the medulla spinalis and run outward through the anterior nerve roots to the spinal nerve. They convey impulses to the voluntary muscles and are continuous from their origin to their peripheral distribution. The afferent fibers convey impressions inward from the skin, etc., and originate in the unipolar nerve cells of the spinal ganglia. The single processes of these cells divide into peripheral and central fibers, and the latter enter the medulla spinalis through the posterior nerve roots. 2. The sympathetic fibers are also efferent and afferent. The efferent fibers, preganglionic fibers, originate in the lateral column of the medulla spinalis and are conveyed through the anterior nerve root in the white ramus communicans to the corresponding ganglion of the sympathetic trunk. Here they may end by forming synapses around its cells, or may run through the ganglion to end in another of the ganglia of the sympathetic trunk, or in a more distally placed ganglion in one of the sympathetic plexuses. In all cases they end by forming synapses around other nerve cells. From the cells of the ganglia of the sympathetic trunk, other fibers, postganglionic fibers, take origin. Some of these run through the gray rami communicantes to join the spinal nerves, along which they are carried to the blood vessels of the trunk and the limbs, while others pass to the viscera, either directly or after interruption in one of the distal ganglia. The afferent fibers are derived partly from the unipolar cells and partly from the multipolar cells of the spinal ganglia. Their peripheral processes are carried through the white rami communicantes, and after passing through one or more sympathetic ganglia, but always without interruption in them, finally end in the tissues of the viscera. The central processes of the unipolar cells enter the medulla spinalis through the posterior nerve root and form synapses around either somatic or sympathetic efferent neurons, thus completing reflex arcs. The dendrites of the multipolar nerve cells form synapses around the cells of type 2, cells of Dogiel, in the spinal ganglia, and by this path the original impulse is transferred from the sympathetic to the somatic system, through which it is conveyed to the sensorium. Divisions. After emerging from the intervertebral foramen, each spinal nerve gives off a small meningeal branch, which re-enters the vertebral canal through the intervertebral foramen and supplies the vertebrae and their ligaments, and the blood vessels of the medulla spinalis and its membranes. The spinal nerve then splits into a posterior or dorsal and an anterior or ventral division, each receiving fibers from both nerve roots. End of section 34.
Section 35 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by Leanne Howlett. Anatomy of the Human Body, Part 4 by Henry Gray. Posterior Divisions. 6a. The posterior divisions. Rami posterioris. The posterior divisions are as a rule smaller than the anterior. They are directed backward, and with the exceptions of those of the first cervical, the fourth and fifth sacral, and the coccygeal, divide into medial and lateral branches for the supply of the muscles and skin of the posterior part of the trunk. The cervical nerves, nervi cervicalis. The posterior division of the first cervical or sub-occipital nerve is larger than the anterior division, and emerges above the posterior arch of the atlas and beneath the vertebral artery. It enters the sub-occipital triangle and supplies the muscles which bound this triangle, viz., the rectus capitis posterior major and the obliqui superior and inferior. It gives branches also to the rectus capitis posterior minor and the semispinalis capitis. A filament from the branch to the obliquus inferior joins the posterior division of the second cervical nerve. The nerve occasionally gives off a cutaneous branch, which accompanies the occipital artery to the scalp and communicates with the greater and lesser occipital nerves. The posterior division of the second cervical nerve is much larger than the anterior division, and is the greatest of all the cervical posterior divisions. It emerges between the posterior arch of the atlas and the lamina of the axis, below the obliquus inferior. It supplies a twig to this muscle, receives a communicating filament from the posterior division of the first cervical, and then divides into a large medial and a small lateral branch. The medial branch, ramus medialis, internal branch, called from its size and distribution the greater occipital nerve, nervus occipitalis major, great occipital nerve, ascends obliquely between the obliquus inferior and the semispinalis capitis, and pierces the latter muscle and the trapezius near their attachments to the occipital bone. It is then joined by a filament from the medial branch of the posterior division of the third cervical, and, ascending on the back of the head with the occipital artery, divides into branches which communicate with the lesser occipital nerve and supply the skin of the scalp as far forward as the vertex of the skull. It gives off muscular branches to the semispinalis capitis, and occasionally a twig to the back of the auricula. The lateral branch, ramus lateralis, external branch, supplies filaments to the splenius, longus capitis, and semispinalis capitis, and is often joined by the corresponding branch of the third cervical. The posterior division of the third cervical is intermediate in size between those of the second and fourth. Its medial branch runs between the semispinalis capitis and cervices, and piercing the splenius and trapezius, ends in the skin. While under the trapezius it gives off a branch called the third occipital nerve, which pierces the trapezius and ends in the skin of the lower part of the back of the head. It lies medial to the greater occipital and communicates with it. The lateral branch often joins that of the second cervical. The posterior division of the suboccipital and the medial branches of the posterior division of the second and third cervical nerves are sometimes joined by communicating loops to form the posterior cervical plexus, Cuvier. The posterior divisions of the lower 5 cervical nerves divide into medial and lateral branches. The medial branches of the fourth and fifth run between the semispinalis cervices and capitis, and having reached the spinous processes, pierce the splenius and trapezius to end in the skin. Sometimes the branch of the fifth fails to reach the skin. Those of the lower 3 nerves are small, and end in the semispinalis cervicis and capitis, multifidus and interspinales. The lateral branches of the lower 5 nerves supply the iliocostalis cervicus, longissimus cervicis, and longissimus capitis. The thoracic nerves, nervi thoracalis. The medial branches, ramus medialis, internal branch, of the posterior divisions of the upper 6 thoracic nerves run between the semispinalis dorsi and multifidus, which they supply. They then pierce the rhomboidii and trapezius, and reach the skin by the sides of the spinous processes. The medial branches of the lower 6 are distributed chiefly to the multifidus and longissimus dorsi. Occasionally they give off filaments to the skin near the middle line. The lateral branches, ramus lateralis, external branch, increase in size from above downward. They run through or beneath the longissimus dorsi to the interval between it and the iliocostellas, and supply these muscles. The lower 5 or 6 also give off cutaneous branches which pierce the serratus posterior inferior and latimus dorsi and align with the angles of the ribs. The lateral branches of a variable number of the upper thoracic nerves also give filaments to the skin. The lateral branch of the 12th thoracic, after sending a filament medialward along the iliac crest, passes downward to the skin of the buttock. The medial cutaneous branches of the posterior divisions of the thoracic nerves descend for some distance close to the spinous processes before reaching the skin, while the lateral branches travel downward for a considerable distance, it may be as much as the breadth of 4 ribs, before they become superficial. The branch from the 12th thoracic, for instance, reaches the skin only a little way above the iliac crest. The lumbar nerves, nervi lumbalis. The medial branches of the posterior divisions of the lumbar nerves run close to the articular processes of the vertebrae and end in the multifidus. The lateral branches supply the sacrospinalis. The upper 3 give off cutaneous nerves which pierce the aponeurosis of the latissimus dorsi at the lateral border of the sacrospinalis and descend across the posterior part of the iliac crest to the skin of the buttock, some of their twigs running as far as the level of the greater trochanter. The sacral nerves, nervi sacralis. The posterior divisions of the sacral nerves, rami posterioris, are small, and diminish in size from above downward. They emerge, except the last, through the posterior sacral foramina. The upper 3 are covered at their points of exit by the multifidus, and divide into medial and lateral branches. The medial branches are small, and end in the multifidus. The lateral branches join with one another and with the lateral branches of the posterior divisions of the last lumbar and 4th sacral to form loops on the dorsal surface of the sacrum. From these loops branches run to the dorsal surface of the sacrotuberous ligament, and form a second series of loops under the gluteus maximus. From this second series cutaneous branches, 2 or 3 in number, pierce the gluteus maximus along a line drawn from the posterior superior iliac spine to the tip of the coccyx. They supply the skin over the posterior part of the buttock. The posterior divisions of the lower 2 sacral nerves are small and lie below the multifidus. They do not divide into medial and lateral branches, but unite with each other and with the posterior division of the coccygeal nerve to form loops on the back of the sacrum. Filaments from these loops supply the skin over the coccyx. The coccygeal nerve, nervus coccygeus. The posterior division of the coccygeal nerve, ramus posterior, does not divide into a medial and a lateral branch, but receives, as already stated, a communicating branch from the last sacral. It is distributed to the skin over the back of the coccyx. End of section 35. Recording by Leanne Howlett.
Section 36 of Gray's Anatomy. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Read by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. Anterior Divisions, Part 1. 6b. The anterior divisions. Rami anteriores. The anterior divisions of the spinal nerves supply the anterolateral parts of the trunk and the limbs. They are for the most part larger than the posterior divisions. In the thoracic region they run independently of one another, but in the cervical, lumbar, and sacral regions they unite near their origins to form plexuses. The cervical nerves. Nervus cervicalis. The anterior divisions of the cervical nerves, rami anteriores, with the exception of the first, pass outward between the intertransversarii anterior and posterior, lying on the grooved upper surfaces of the transverse processes of the vertebrae. The anterior division of the first or suboccipital nerve issues from the vertebral canal above the posterior arch of the atlas, and runs forward round the lateral aspect of its superior articular process, medial to the vertebral artery. In most cases it descends medial to and in front of the rectus capitis lateralis, but occasionally it pierces the muscle. The anterior divisions of the upper four cervical nerves unite to form the cervical plexus, and each receives a grey ramus communicans from the superior cervical ganglion of the sympathetic trunk. Those of the lower four cervical, together with the greater part of the first thoracic, form the brachial plexus. They each receive a grey ramus communicans, those for the fifth and sixth being derived from the middle, and those for the seventh and eighth from the lowest cervical ganglion of the sympathetic trunk. The cervical plexus. Plexus cervicalis. The cervical plexus is formed by the anterior divisions of the upper four cervical nerves. Each nerve, except the first, divides into an upper and a lower branch, and the branches unite to form 3 loops. The plexus is situated opposite the upper four cervical vertebrae, in front of the levator scapulae and scalenus medius, and covered by the sternocleidomastoideus. Its branches are divided into 2 groups, superficial and deep, and are here given in tabular form. The figures following the names indicate the nerves from which the different branches take origin. Superficial. Smaller occipital, 2c. Greater auricular, 2-3c. Cutaneous cervical, 2-3c. Supraclavicular, 3-4c. Deep. Internal, communicating, with hypoglossal 1-2c, with vagus 1-2c, with sympathetic 1-2-3-4c. Muscular. Rectus capitis lateralis 1c. Rectus capitis anterior 1-2c. Longus capitis 1-2-3c. Communicantes cervicalis 2-3c. Phrenic 3-4-5c. Communicating with accessory 2-3-4c. External. Muscular. Sternocleidomastoideus 2c. Trapezius 3-4c. Levator scapulae 3-4c. Scalenus medius 3-4c. Superficial branches of the cervical plexus. The smaller occipital nerve, nervus occipitalis minor, small occipital nerve, arises from the second cervical nerve, sometimes also from the third. It curves around and ascends along the posterior border of the sternocleidomastoideus. Near the cranium it perforates the deep fascia, and is continued upward along the side of the head behind the auricular, supplying the skin and communicating with the greater occipital, the greater auricular, and posterior auricular branch of the facial. The smaller occipital varies in size and is sometimes duplicated. It gives off an auricular branch, which supplies the skin of the upper and back part of the auricular, communicating with the mastoid branch of the great auricular. This branch is occasionally derived from the greater occipital nerve. The great auricular nerve, nervus auricularis magnus, is the largest of the ascending branches. It arises from the second and third cervical nerves, winds around the posterior border of the sternocleidomastoideus, and, after perforating the deep fascia, ascends upon that muscle beneath the platysma to the parotid gland, where it divides into an anterior and a posterior branch. The anterior branch, ramus anterior, facial branch, is distributed to the skin of the face over the parotid gland, and communicates in the substance of the gland with the facial nerve. The posterior branch, ramus posterior, mastoid branch, supplies the skin over the mastoid process and on the back of the auricula, except at its upper part. A filament pierces the auricula to reach its lateral surface, where it is distributed to the lobule and lower part of the concha. The posterior branch communicates with the smaller occipital, the auricular branch of the vagus, and the posterior auricular branch of the facial. The cutaneous cervical, nervus cutaneus colli, superficial or transverse cervical nerve, arises from the second and third cervical nerves, turns around the posterior border of the sternocleidomastoideus about its middle, and, passing obliquely forward beneath the external jugular vein to the anterior border of the muscle, it perforates the deep cervical fascia, and divides beneath the platysma into ascending and descending branches, which are distributed to the anterolateral parts of the neck. The ascending branches, rami superiores, pass upward to the submaxillary region, and form a plexus with the cervical branch of the facial nerve beneath the platysma. Others pierce that muscle, and are distributed to the skin of the upper and front part of the neck. The descending branches, rami inferiores, pierce the platysma, and are distributed to the skin of the side and front of the neck, as low as the sternum. The supraclavicular nerves, nervus supraclaviculares, descending branches, arise from the third and fourth cervical nerves. They emerge beneath the posterior border of the sternocleidomastoideus and descend in the posterior triangle of the neck beneath the platysma and deep cervical fascia. Near the clavicle they perforate the fascia and platysma to become cutaneous, and are arranged, according to their position, into three groups: anterior, middle, and posterior. The anterior supraclavicular nerves, nervus supraclaviculares anteriores, suprasternal nerves, cross obliquely over the external jugular vein and the clavicular and sternal heads of the sternocleidomastoideus, and supply the skin as far as the middle line. They furnish one or two filaments to the sternoclavicular joint. The middle supraclavicular nerves, nervus supraclaviculares medii, supraclavicular nerves, cross the clavicle and supply the skin over the pectoralis major and deltoideus, communicating with the cutaneous branches of the upper intercostal nerves. The posterior supraclavicular nerves, nervus supraclaviculares posteriores, supraacromial nerves, pass obliquely across the outer surface of the trapezius and the acromion, and supply the skin of the upper and posterior parts of the shoulder. Deep branches of the cervical plexus, internal series. The communicating branches consist of several filaments, which pass from the loop between the first and second cervical nerves to the vagus, hypoglossal, and sympathetic. The branch to the hypoglossal ultimately leaves that nerve as a series of branches, viz., the descending ramus, the nerve to the thyreohyoideus, and the nerve to the geniohyoideus. A communicating branch also passes from the fourth to fifth cervical, while each of the first four cervical nerves receives a grey ramus communicans from the superior cervical ganglion of the sympathetic. Muscular branches supply the longus capitis, rectus capitis anterior, and rectus capitis lateralis. The communicantes cervicalis, communicantes hypoglossae, consist usually of two filaments, one derived from the second and the other from the third cervical. These filaments join to form the descendens cervicalis, which passes downward on the lateral side of the internal jugular vein, crosses in front of the vein a little below the middle of the neck, and forms a loop, ansa hypoglossae, with the descending ramus of the hypoglossal in front of the sheath of the carotid vessels. Occasionally the loop is formed within the sheath. The phrenic nerve, nervus phrenicus, internal respiratory nerve of Bell, contains motor and sensory fibres in the proportion of about 2 to 1. It arises chiefly from the fourth cervical nerve, but receives a branch from the third and another from the fifth. The fibres from the fifth occasionally come through the nerve to the subclavius. It descends to the root of the neck, running obliquely across the front of the scalenus anterior, and beneath the sternocleidomastoideus, the inferior belly of the omohyoideus, and the transverse cervical and transverse scapular vessels. It next passes in front of the first part of the subclavian artery, between it and the subclavian vein, and, as it enters the thorax, crosses the internal mammary artery near its origin. Within the thorax it descends nearly vertically in front of the root of the lung, and then between the pericardium and the mediastinal pleura to the diaphragm, where it divides into branches, which pierce that muscle, and are distributed to its under surface. In the thorax it is accompanied by the pericardiacophrenic branch of the internal mammary artery. The two phrenic nerves differ in their length, and also in their relations at the upper part of the thorax. The right nerve is situated more deeply, and is shorter and more vertical in direction than the left. It lies lateral to the right innominate vein and superior vena cava. The left nerve is rather longer than the right, from the inclination of the heart to the left side, and from the diaphragm being lower on this than on the right side. At the root of the neck it is crossed by the thoracic duct. In the superior mediastinal cavity it lies between the left common carotid and left subclavian arteries, and crosses superficial to the vagus on the left side of the arch of the aorta. Each nerve supplies filaments to the pericardium and pleura, and at the root of the neck is joined by a filament from the sympathetic and, occasionally, by one from the ansa hypoglossae. Branches have been described as passing to the peritoneum. From the right nerve, one or two filaments pass to join in a small phrenic ganglion with phrenic branches of the celiac plexus, and branches from this ganglion are distributed to the falciform and coronary ligaments of the liver, the suprarenal gland, inferior vena cava, and right atrium. From the left nerve, filaments pass to join the phrenic branches of the celiac plexus, but without any ganglionic enlargement, and a twig is distributed to the left suprarenal gland. Deep branches of the cervical plexus, external series, communicating branches. The external series of deep branches of the cervical plexus communicates with the accessory nerve, in the substance of the sternocleidomastoideus, in the posterior triangle, and beneath the trapezius. Muscular branches are distributed to the sternocleidomastoideus, trapezius, levatus scalpuli, and scalenus medius. The branch for the sternocleidomastoideus is derived from the second cervical. The trapezius and levatus scapulae receive branches from the third and fourth. The scalenus medius receive twigs either from the third or fourth, or occasionally from both. The brachial plexus, plexus brachialis. The brachial plexus is formed by the union of the anterior divisions of the lower four cervical nerves and the greater part of the anterior division of the first thoracic nerve. The fourth cervical usually gives a branch to the fifth cervical, and the first thoracic frequently receives one from the second thoracic. The plexus extends from the lower part of the side of the neck to the axilla. The nerves which form it are nearly equal in size, but their mode of communication is subject to some variation. The following is, however, the most constant arrangement. The fifth and sixth cervical unite soon after their exit from the intervertebral foramina to form a trunk. The eighth cervical and first thoracic also unite to form one trunk, while the seventh cervical runs out alone. Three trunks, upper, middle, and lower, are thus formed, and, as they pass beneath the clavicle, each splits into an anterior and a posterior division. Footnote: the posterior division of the lower trunk is very much smaller than the others, and is frequently derived entirely from the eighth cervical nerve. End of footnote. The anterior divisions of the upper and middle trunks unite to form a cord, which is situated on the lateral side of the second part of the axillary artery, and is called the lateral cord, or fasciculus of the plexus. The anterior division of the lower trunk passes down on the medial side of the axillary artery, and forms the medial cord or fasciculus of the brachial plexus. The posterior divisions of all three trunks unite to form the posterior cord or fasciculus of the plexus, which is situated behind the second portion of the axillary artery. Relations. In the neck, the brachial plexus lies in the posterior triangle, being covered by the skin, platysma, and deep fascia. It is crossed by the supraclavicular nerves, the inferior belly of the omohyoideus, the external jugular vein, and the transverse cervical artery. It emerges between the scaleni anterior and medius. Its upper part lies above the third part of the subclavian artery, while the trunk formed by the union of the eighth cervical and first thoracic is placed behind the artery. The plexus next passes behind the clavicle, the subclavius, and the transverse scapular vessels, and lies upon the first digitation of the serratus anterior and the subscapularis. In the axilla it is placed lateral to the first portion of the axillary artery. It surrounds the second part of the artery, one cord lying medial to it, one lateral to it, and one behind it. At the lower part of the axilla it gives off its terminal branches to the upper limb. Branches of communication. Close to their exit from the intervertebral foramina, the 5th and 6th cervical nerves each receive a grey ramus communicans from the middle cervical ganglion of the sympathetic trunk, and the 7th and 8th cervical similar twigs from the inferior ganglion. The 1st thoracic nerve receives a grey ramus from, and contributes a white ramus to, the 1st thoracic ganglion. On the scalenus anterior, the phrenic nerve is joined by branches from the 5th cervical. Branches of distribution. The branches of distribution of the brachial plexus may be arranged into two groups, viz., those given off above and those below the clavicle. Supraclavicular branches. Dorsal scapula 5C, suprascapular 5-6C, nerve to subclavius 5-6C, long thoracic 5-6-7C, to longus colli and scaleni 5-6-7-8C. End of section 36.
Section 37 of Gray's Anatomy Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by M.L. Cohen. Anatomy of the Human Body Part 4 by Henry Gray. Anterior divisions of the spinal nerves, Part 2. The dorsal scapular nerve, nervus dorsalis scapulae, nerve to the rhomboideae, posterior scapular nerve, arises from the 5th cervical, pierces the scalenus medius, passes beneath the levator scapulae, to which it occasionally gives a twig, and ends in the rhomboideae. The suprascapular, nervus suprascapularis, arises from the trunk formed by the union of the 5th and 6th cervical nerves. It runs lateralward beneath the trapezius and omohyoideus, and enters the supraspinatus fossa through the suprascapular notch, below the superior transverse scapular ligament. It then passes beneath the supraspinatus and curves around the lateral border of the spine of the scapula to the infraspinatus fossa. In the supraspinatus fossa, it gives off two branches to the supraspinatus muscle and an articular filament to the shoulder joint, and in infraspinatus fossa, it gives off two branches to the infraspinatus muscle, besides some filaments to the shoulder joint and scapula. The nerve to the subclavius, nervus subclavius, is a small filament which arises from the point of junction of the 5th and 6th cervical nerves. It descends to the muscle in front of the third part of the subclavian artery and the lower trunk of the plexus, and is usually connected by a filament with the phrenic nerve. The long thoracic nerve, nervus thoracalis longus, external respiratory nerve of Bell, posterior thoracic nerve, supplies the serratus anterior. It usually arises by three roots from the 5th, 6th, and 7th cervical nerves, but the root from the 7th nerve may be absent. The roots from the 5th and 6th nerves pierce the scalenus medius, while that from the 7th passes in front of the muscle. The nerve descends beneath the brachial plexus and the axillary vessels, resting on the outer surface of the serratus anterior. It extends along the side of the thorax to the lower border of that muscle, supplying filaments to each of its digitations. The branches for the longus colli and scaleni arise from the lower 4 cervical nerves at their exit from the intervertebral foramina. Infraclavicular branches. The infraclavicular branches are derived from the 3 cords of the brachial plexus, but the fasciculi of the nerves may be traced through the plexus to the spinal nerves from which they originate. They are as follows: musculocutaneous, 5th, 6th, and 7th cervical, lateral cord, lateral anterior thoracic, 5th, 6th, and 7th, lateral head of the median, 6th and 7th, medial anterior thoracic, medial antebrachiocutaneous, 6th and 7th, medial cord, medial brachiocutaneous, 8th cervical, 1st thoracic, ulnar, medial head of median, also 8th cervical, 1st thoracic, upper subscapular, 5th and 6th cervical, lower subscapular, 5th and 6th cervical, posterior cord, thoracodorsal, 5th, 6th, and 7th cervical, axillary, 5th and 6th cervical, radial, 6th, 7th, 8th cervical, 1st thoracic. The anterior thoracic nerves, nervus thoracalis anteriores, supply the pectoralis major and minor. The lateral anterior thoracic, fasciculus lateralis, the larger of the two, arises from the lateral cord of the brachial plexus, and through it from the 5th, 6th, and 7th cervical nerves. It passes around the axillary artery and vein, pierces the coracoclavicular fascia, and is distributed to the deep surface of the pectoralis major. It sends a filament to join the medial anterior thoracic and form with it a loop in front of the first part of the axillary artery. The medial anterior thoracic, fasciculus medialis, arises from the medial cord of the plexus and through it from the 8th cervical and 1st thoracic. It passes behind the first part of the axillary artery, curves forward between the axillary artery and vein, and unites in front of the artery with a filament from the lateral nerve. It then enters the deep surface of the pectoralis minor, where it divides into a number of branches which supply the muscle. 2 or 3 branches pierce the muscle and end in the pectoralis major. The subscapular nerves, nervus subscapularis, 2 in number, spring from the posterior cord of the plexus and through it from the 5th and 6th cervical nerves. The upper subscapular, short subscapular, the smaller enters the upper part of the subscapularis and is frequently represented by 2 branches. The lower subscapular supplies the lower part of the subscapularis and ends in the teres major. The latter muscle is sometimes supplied by a separate branch. The thoracodorsal nerve, nervus thoracolodorsalis, middle or long subscapular nerve. A branch of the posterior cord of the plexus derives its fibers from the 5th, 6th, and 7th cervical nerves. It follows the course of the subscapular artery along the posterior wall of the axilla to the latissimus dorsi, in which it may be traced as far as the lower border of that muscle. The axillary nerve, nervus axillaris, circumflex nerve, arises from the posterior cord of the brachial plexus, and its fibers are derived from the 5th and 6th cervical nerves. It lies at first behind the axillary artery and in front of the subscapularis, and passes downward to the lower border of that muscle. It then winds backwards in company with the posterior humeral circumflex artery through a quadrilateral space bounded above by the subscapularis, below by the teres major, medially by the long head of the triceps brachii, and laterally by the surgical neck of the humerus, and divides into an anterior and a posterior branch. The anterior branch, upper branch, lies around the cervical neck of the humerus beneath the deltoideus, with the posterior humeral circumflex vessels as far as the anterior border of that muscle, supplying it and giving off a few small cutaneous branches which pierce the muscle and ramify in the skin covering its lower part. The posterior branch, lower branch, supplies the teres minor and the posterior part of the deltoideus. Upon the branch to the teres minor, an oval enlargement, pseudoganglion, usually exists. The posterior branch then pierces the deep fascia and is continued as the lateral brachial cutaneous nerve, which sweeps around the posterior border of the deltoideus and supplies the skin over the lower 2/3 of the posterior part of this muscle, as well as that covering the long head of the triceps brachii. The trunk of the axillary nerve gives off an articular filament which enters the shoulder joint below the subscapularis. The musculocutaneous nerve, nervus musculocutaneus, arises from the lateral cord of the brachial plexus opposite the lower border of the pectoralis minor, its fibers being derived from the 5th, 6th, and 7th cervical nerves. It pierces the coracobrachialis muscle and passes obliquely between the biceps brachii and the brachialis to the lateral side of the arm. A little above the elbow, it pierces the deep fascia lateral to the tendon of the biceps brachii and is continued into the forearm as the lateral antebrachial cutaneous nerve. In its course through the arm, it supplies the coracobrachialis, biceps brachii, and the greater part of the brachialis. The branch to the coracobrachialis is given off from the nerve close to its origin, and in some instances as a separate filament from the lateral cord of the plexus. It is derived from the 7th cervical nerve. The branches to the biceps brachii and brachialis are given off after the musculocutaneous has pierced the coracobrachialis. That supplying the brachialis gives a filament to the elbow joint. The nerve also sends a small branch to the bone, which enters the nutrient foramen with the accompanying artery. The lateral antebrachial cutaneous nerve, nervus cutaneus antebrachii, cutaneus lateralis, branch of the musculocutaneous nerve, passes behind the cephalic vein and divides opposite the elbow joint into a volar and a dorsal branch. The volar branch, ramus volaris anterior branch, descends along the radial border of the forearm to the wrist and supplies the skin over the lateral half of its volar surface. At the wrist joint, it is placed in front of the radial artery and some filaments piercing the deep fascia accompanying that vessel to the dorsal surface of the carpus. The nerve then passes downward to the ball of the thumb, where it ends in cutaneous filaments. It communicates with the superficial branch of the radial nerve and with the palmar cutaneous branch of the median nerve. The dorsal branch, ramus dorsalis posterior branch, descends along the dorsal surface of the radial side of the forearm to the wrist. It supplies the skin of the lower two-thirds of the dorsolateral surface of the forearm, communicating with the superficial branch of the radial nerve and the dorsal antebrachial cutaneous branch of the radial. The musculocutaneous nerve presents frequent irregularities. It may adhere for some distance to the median and then pass outward beneath the biceps brachii instead of through the coracobrachialis. Some of the fibers of the median may run for some distance in the musculocutaneous and then leave it to join their proper trunk. Less frequently, the reverse is the case, and the median sends a branch to join the musculocutaneous. The nerve may pass under the coracobrachialis or through the biceps brachii. Occasionally, it gives a filament to the pronator teres, and it supplies the dorsal surface of the thumb when the superficial branch of the radial nerve is absent. The medial antebrachial cutaneous nerve. Nervus cutaneous antebrachial medialis, internal cutaneous nerve, arises from the medial cord of the brachial plexus. It derives its fibers from the 8th cervical and 1st thoracic nerves and, at its commencement, is placed medial to the axillary artery. It gives off near the axilla a filament which pierces the fascia and supplies the integument covering the biceps brachii, nearly as far as the elbow. The nerve then runs down the ulnar side of the arm medial to the brachial artery, pierces the deep fascia with the basilic vein about the medial of the arm, and divides into a volar and an ulnar branch. The volar branch, ramus volaris anterior branch, the larger, passes usually in front of but occasionally behind the vena mediana cubiti, median basilic vein. It then descends on the front of the ulnar side of the forearm, distributing filaments to the skin as far as the wrist and communicating with the palmar cutaneous branch of the ulnar nerve. The ulnar branch, ramus ulnaris posterior branch, passes obliquely downward on the medial side of the basilic vein, in front of the medial epicondyle of the humerus, to the back of the forearm, and then descends on its ulnar side as far as the wrist, distributing filaments to the skin. It communicates with the medial brachial cutaneous, the dorsal antebrachial cutaneous branch of the radial, and the dorsal branch of the ulnar. The medial brachial cutaneous nerve, nervus cutaneous brachii medialis, lesser internal cutaneous nerve, nerve of Risberg, is distributed to the skin on the ulnar side of the arm. It is the smallest branch of the brachial plexus, and arising from the medial cord receives its fibers from the 8th cervical and 1st thoracic nerves. It passes through the axilla, at first lying behind and then medial to the axillary vein, and communicates with the intercostobrachial nerve. It descends along the medial side of the brachial artery to the middle of the arm, where it pierces the deep fascia and is distributed to the skin of the back of the lower third of the arm, extending as far as the elbow, where some filaments are lost in the skin in front of the medial epicondyle and others over the olecranon. It communicates with the ulnar branch of the medial antebrachial cutaneous nerve. In some cases, the medial brachiocutaneous and intercostobrachial are connected by 2 or 3 filaments, which form a plexus in the axilla. In other cases, the intercostobrachial is of large size and takes the place of the medial brachiocutaneous, receiving merely a filament of communication from the brachial plexus, which represents the latter nerve. In a few cases, this filament is lacking. End of section 37. Section 38 of Gray's Anatomy Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by M.L. Cohen. Anatomy of the Human Body Part 4 by Henry Gray. Anterior divisions of the spinal nerves Part 3. The median nerve, nervus medianus, extends along the middle of the arm and forearm to the hand. It arises by 2 roots, one from the lateral and one from the medial cord of the brachial plexus. These embrace the lower part of the axillary artery, uniting either in front of or lateral to that vessel. Its fibers are derived from the 6th, 7th, and 8th cervical and 1st thoracic nerves. As it descends through the arm, it lies at first lateral to the brachial artery, About the level of the insertion of the coracobrachialis, it crosses the artery, usually in front of but occasionally behind it, and lies on the medial side at the bend of the elbow, where it is situated behind the laceratus fibrosus, bicipital fascia, and is separated from the elbow joint by the brachialis. In the forearm, it passes between the two heads of the pronator teres and crosses the ulnar artery but is separated from this vessel by the deep head of the pronator teres. It descends beneath the flexor digitorum sublimis, lying on the flexor digitorum profundus to within 5 centimeters of the transverse carpal ligament. Here it becomes more superficial and is situated between the tendons of the flexor digitorum sublimis and flexor carpal radialis. In this situation, it lies behind, and rather to the radial side of, the tendon of the palmaris longus, and is covered by the skin and fascia. It then passes behind the transverse carpal ligament into the palm of the hand. In its course, through the forearm, it is accompanied by the median artery, a branch of the volar interosseous artery. With the exception of the nerve to the pronator teres, which sometimes arises above the elbow joint, the median nerve gives off no branches in the arm. As it passes in front of the elbow, it supplies 1 or 2 twigs to the joint. In the forearm, its branches are muscular, volar interosseous, and palmar. The muscular branches, rami musculares, are derived from the nerve near the elbow and supply all of the superficial muscles on front of the forearm except the flexor carpi ulnaris. The volar interosseous nerve, nervus interosseous antebrachiovolaris, anterior interosseous nerve, supplies the deep muscles on the front of the forearm except the ulnar half of the flexor digitorum profundus. It accompanies the volar interosseous artery along the front of the interosseous membrane in the interval between the flexor pollicis longus and flexor digitorum profundus, supplying the whole of the former and the radial half of the latter, and ending below in the pronator quadratus and wrist joint. The palmar branch, ramus cutaneus palmaris, nervus mediani, of the median nerve arises at the lower part of the forearm. It pierces the volar carpal ligament and divides into a lateral and a medial branch. The lateral branch supplies the skin over the ball of the thumb and communicates with the volar branch of the lateral antebrachial cutaneous nerve. The median branch supplies the skin of the palm and communicates with the palmar cutaneous branch of the ulnar. In the palm of the hand, the median nerve is covered by the skin and the palmar aponeuroses, and rests on the tendons of the flexor muscles. Immediately after emerging from under the transverse carpal ligament, the nerve becomes enlarged and flattened and splits into a smaller lateral and larger medial portion. The lateral portion supplies a short, stout branch to certain of the muscles of the ball of the thumb, that is, the abductor brevis, the opponens, and the superhead of the flexor brevis, and then divides into 3 proper volar digital nerves. 2 of these supply the sides of the thumb, while the third gives a twig to the third lumbricalis and is distributed to the radial side of the index finger. The medial portion of the nerve divides into 2 common volar digital nerves. The first of these gives a twig to the second lumbricalis and runs toward the cleft between the index and middle fingers, where it divides into 2 proper digital nerves for the adjoining side of these digits. The second runs towards the cleft between the middle and ring fingers and splits into 2 proper digital nerves for the adjoining sides of these digits. It communicates with a branch from the ulnar nerve and sometimes sends a twig to the third lumbricalis. Each proper digital nerve, opposite the base of the first phalanx, gives off a dorsal branch which joins the dorsal digital nerve from the superficial branch of the radial nerve and supplies the integument on the dorsal aspect of the last phalanx. At the end of the digit, the proper digital nerve divides into 2 branches, one of which supplies the pulp of the finger, the other ramifies around and beneath the nail. The proper digital nerves, as they run along the fingers, are placed superficial to the corresponding arteries. The ulnar nerve, nervus ulnaris, is placed along the medial side of the limb and is distributed to the muscles and skin of the forearm and hand. It arises from the medial cord of the brachial plexus and derives its fibers from the 8th cervical and 1st thoracic nerves. It is smaller than the median and lies at first behind it but diverges from it in its course down the arm. At its origin, it lies medial to the axillary artery and bears the same relation to the brachial artery as far as the middle of the arm. Here, it pierces the medial intramuscular septum, runs obliquely across the medial head of the triceps brachii, and descends to the groove between the medial epicondyle and the olecranon, accompanied by the superior ulnar collateral artery. At the elbow, it rests upon the back of the medial epicondyle and enters the forearm between the 2 heads of the flexor carpi ulnaris. In the forearm, it descends along the ulnar side lying upon the flexor digitorum profundus. Its upper half is covered by the flexor carpi ulnaris. Its lower half lies on the lateral side of the muscle, covered by the integument and fascia. In the upper third of the forearm, it is separated from the ulnar artery by a considerable interval, but in the rest of its extent lies close to the medial side of the artery. About 5 centimeters above the wrist, it ends by dividing into a dorsal and a volar branch. The branches of the ulnar nerve are articular to the elbow joint, muscular, palmar cutaneous, dorsal, and volar. The articular branches to the elbow joint are several small filaments which arise from the nerve as it lies in the groove between the medial epicondyle and the olecranon. The muscular branches, rami musculares, 2 in number, arise near the elbow. One supplies the flexor carpial naris, the other the ulnar half of the flexor digitorum profundus. The palmar cutaneous branch, ramus cutaneous palmaris, arises about the middle of the forearm and descends on the ulnar artery, giving off some filaments to the vessel. It perforates the volar carpal ligament and ends in the skin of the palm, communicating with the palmar branch of the median nerve. The dorsal branch, ramus dorsalis manus, arises about 5 centimeters above the wrist. It passes backward beneath the flexor carpial naris, perforates the deep fascia, and, running along the ulnar side of the back of the wrist and hand, divides into 2 dorsal digital branches. One supplies the ulnar side of the little finger, the other the adjacent sides of the little and ring fingers. It also sends a twig to join that given by the superficial branch of the radial nerve for adjoining sides of the middle and ring fingers, and assists in supplying them. A branch is distributed to the metacarpal region of the hand, communicating with the twig of the superficial branch of the radial nerve. On the little finger, the dorsal digital branches extend only as far as the base of the terminal phalanx, and on the ring finger as far as the base of the second phalanx. The more distal parts of these digits are supplied by dorsal branches derived from the proper volar digital branches of the ulnar nerve. The volar branch, ramus volaris manus, crosses the transverse carpal ligament on the lateral side of the pisiform bone, medial and a little behind the ulnar artery. It ends by dividing into a superficial and a deep branch. The superficial branch, ramus superficialis, nerve ulnaris, supplies the palmaris brevis and the skin on the ulnar side of the hand, and divides into a proper volar digital branch for the ulnar side of the little finger, and the common volar digital branch which gives a communicating twig to the median nerve and divides into 2 proper digital nerves for the adjoining sides of the little and ring fingers. The proper digital branches are distributed to the fingers in the same manner as those of the median. The deep branch, ramus profundus, accompanied by the deep branch of the ulnar artery, passes between the abductor digiti quinti and flexor digiti quinti brevis. It then perforates the opponens digitis quinti and follows the course of the deep volar arch beneath the flexor tendons. At its origin, it supplies the 3 short muscles of the little finger. As it crosses the deep part of the hand, it supplies all the interossei and the 3rd and 4th lumbricales. It ends by supplying the adductores pollicis and the medial head of the flexor pollicis brevis. It also sends articular filaments to the wrist joint. It has been pointed out that the ulnar part of the flexor digitorum profundus is supplied by the ulnar nerve. The 3rd and 4th lumbricales, which are connected with the tendons of this part of the muscle, are supplied by the same nerve. In a like manner, the lateral part of the flexor digitorum profundus and the 1st and 2nd lumbricales are supplied by the median nerve. The 3rd lumbricalis frequently receives an additional twig from the median nerve. The radial nerve, nervus radialis musculospiral nerve, the largest branch of the brachial plexus, is the continuation of the posterior cord of the plexus. Its fibers are derived from the 5th, 6th, 7th, and 8th cervical and 1st thoracic nerves. It descends behind the first part of the axillary artery and the upper part of the brachial artery, and in front of the tendons of the latissimus dorsi and teres major. It then winds around from the medial to lateral side of the humerus in a groove with the arteriae profundae brachii, between the medial and lateral heads of the triceps brachii. It pierces the lateral intermuscular septum and passes between the brachialis and brachioradialis to the front of the lateral epicondyle, where it divides into a superficial and deep branch. The branches of the musculospiral nerve are muscular, superficial, cutaneous, deep. The muscular branches, ramus musculares, supply the triceps brachii, anconeus, brachioradialis, extensor carpi radialis longus, and brachialis, and are grouped as medial, posterior, and lateral. The medial muscular branches supply the medial and long heads of the triceps brachii. That to the medial head is a long, slender filament, which lies close to the ulnar nerve as far as the lower third of the arm, and is therefore frequently spoken of as the ulnar collateral nerve. The posterior muscular branch, of large size, arises from the nerve in the groove between the triceps brachii and the humerus. It divides into filaments which supply the medial and lateral heads of the triceps brachii and the anconeus muscles. The branch for the lateral muscle is a long, slender filament which descends in the substance of the medial head of the triceps brachii. The lateral muscular branches supply the brachioradialis, extensor carpi radialis longus, and the lateral part of the brachialis. The cutaneous branches are two in number, the posterior brachiocutaneous and the dorsal antibrachial cutaneous. The posterior brachiocutaneous nerve, nervus cutaneous brachii posterior, internal cutaneous branch of musculospiral, arises in the axilla with the medial muscular branch. It is of small size and passes through the axilla to the medial side of the area, supplying the skin on its dorsal surface nearly as far as the olecranon. In its course, it crosses behind and communicates with the intercostobrachial. The dorsal antibrachiocutaneous nerve, nervus cutaneous antibrachial dorsalis, external cutaneous branch of the musculospiral, perforates the lateral head of the triceps brachii at its attachment to the humerus. The upper and smaller branch of the nerve passes to the front of the elbow, lying close to the cephalic vein, and supplies the skin of the lower half of the arm. The lower branch pierces the deep fascia below the insertion of the deltoideus, and descends along the lateral side of the arm and elbow, and then along the back of the forearm to the wrist, supplying the skin in its course and joining near its termination with the dorsal branch of the lateral antibrachial cutaneous nerve. The superficial branch of the radial nerve, ramus superficialis radial nerve, passes along the front of the radial side of the forearm to the commencement of its lower third. It lies at first slightly lateral to the radial artery, concealed beneath the brachioradialis. In the middle third of the forearm, it lies behind the same muscle, close to the lateral side of the artery. It quits the artery about 7 centimeters above the wrist, passes beneath the tendon of the brachioradialis, and, piercing the deep fascia, divides into two branches. The lateral branch, the smaller, supplies the skin of the radial side and ball of the thumb, joining with the volar branch of the lateral antibrachial cutaneous nerve. The medial branch communicates above the wrist with the dorsal branch of the lateral antibrachial cutaneous and, on the back of the hand, with the dorsal branch of the ulnar nerve. It then divides into 4 digital nerves, which are distributed as follows. The first supplies the ulnar side of the thumb, the second, the radial side of the index finger, the third, the adjoining sides of the index and middle fingers, the fourth communicates with the filament from the dorsal branch of the ulnar nerve and supplies the adjacent sides of the middle and ring fingers. See footnote. According to Hutchison, the digital nerve to the thumb reaches only as high as the root of the nail, the one to the forefinger as high as the middle of the second phalanx, and the one to the middle and ring fingers not higher than the first phalangeal joint. End footnote. The deep branch of the radial nerve, nervus interosseus dorsalis, dorsal or posterior interosseous nerve, winds to the back of the forearm around the lateral side of the radius between the two planes of fibers of the supinator, and is prolonged downward between the superficial and deep layers of the muscles to the middle of the forearm. Considerably diminished in size, it descends as the dorsal interosseous nerve on the interosseous membrane in front of the extensor pollicis longus to the back of the carpus, where it presents a gangliform enlargement from which filaments are distributed to the ligaments and articulations of the carpus. It supplies all the muscles on the radial side and dorsal surface of the forearm, excepting the anconeus, brachioradialis, and extensor carpi radialis longus. End of section 38.
Section 39 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by Leanne Howlett. Anatomy of the Human Body, Part 4, by Henry Gray. The Thoracic Nerves. 6C. The thoracic nerves, nervi thoracalis. The anterior divisions of the thoracic nerves, rami anterioris, ventral divisions, are 12 in number on either side. 11 of them are situated between the ribs and are therefore termed intercostal. The 12th lies below the last rib. Each nerve is connected with the adjoining ganglion of the sympathetic trunk by a gray and a white ramus communicans. The intercostal nerves are distributed chiefly to the parietes of the thorax and abdomen, and differ from the anterior divisions of the other spinal nerves in that each pursues an independent course, i.e., there is no plexus formation. The first two nerves supply fibers to the upper limb in addition to their thoracic branches. The next four are limited in their distribution to the parietes of the thorax. The lower five supply the parietes of the thorax and abdomen. The 12th thoracic is distributed to the abdominal wall and the skin of the buttock. The first thoracic nerve. The anterior division of the first thoracic nerve divides into two branches. One, the larger, leaves the thorax in front of the neck of the first rib and enters the brachial plexus. The other and smaller branch, the first intercostal nerve, runs along the first intercostal space, and ends on the front of the chest as the first anterior cutaneous branch of the thorax. Occasionally this anterior cutaneous branch is wanting. The first intercostal nerve, as a rule, gives off no lateral cutaneous branch, but sometimes it sends a small branch to communicate with the intercostobrachial. From the second thoracic nerve it frequently receives a connecting twig, which ascends over the neck of the second rib. The upper thoracic nerves, nervi intercostalis. The anterior divisions of the second, third, fourth, fifth, and sixth thoracic nerves, and the small branch from the first thoracic, are confined to the parietes of the thorax, and are named thoracic intercostal nerves. They pass forward in the intercostal spaces below the intercostal vessels. At the back of the chest they lie between the pleura and the posterior intercostal membranes, but soon pierce the latter and run between the two planes of intercostal muscles as far as the middle of the rib. They then enter the substance of the intercostalis interni, and, running amidst their fibers as far as the costal cartilages, they gain the inner surfaces of the muscles and lie between them and the pleura. Near the sternum they cross in front of the internal mammary artery and transversus thoracis muscle, pierce the intercostalis interni, the anterior intercostal membranes, and pectoralis major, and supply the integument of the front of the thorax and over the mamma, forming the anterior cutaneous branches of the thorax. The branch from the second nerve unites with the anterior supraclavicular nerves of the cervical plexus. Branches. Numerous slender muscular filaments supply the intercostalis, the subcostalis, the levator costarum, the serratus posterior superior, and the transversus thoracis. At the front of the thorax some of these branches cross the costal cartilages from one intercostal space to another. Lateral cutaneous branches, rami cutanei lateralis, are derived from the intercostal nerves about midway between the vertebrae and sternum. They pierce the intercostalis externi and serratus anterior, and divide into anterior and posterior branches. The anterior branches run forward to the side and the forepart of the chest, supplying the skin and the mamma. Those of the fifth and sixth nerves supply the upper digitations of the obliquus externus abdominis. The posterior branches run backward, and supply the skin over the scapula and latissimus dorsi. The lateral cutaneous branch of the second intercostal nerve does not divide, like the others, into an anterior and a posterior branch. It is named the intercostobrachial nerve. It pierces the intercostalis externus and the serratus anterior, crosses the axilla to the medial side of the arm, and joins with a filament from the medial brachial cutaneous nerve. It then pierces the fascia and supplies the skin of the upper half of the medial and posterior part of the arm, communicating with the posterior brachial cutaneous branch of the radial nerve. The size of the intercostobrachial nerve is in inverse proportion to that of the medial brachial cutaneous nerve. A second intercostobrachial nerve is frequently given off from the lateral cutaneous branch of the third intercostal. It supplies filaments to the axilla and medial side of the arm. The lower thoracic nerves. The anterior divisions of the 7th, 8th, 9th, 10th, and 11th thoracic nerves are continued anteriorly from the intercostal spaces into the abdominal wall. Hence they are named thoracico-abdominal intercostal nerves. They have the same arrangement as the upper ones as far as the anterior ends of the intercostal spaces, where they pass behind the costal cartilages and between the obliquus internus and transversus abdominis to the sheath of the rectus abdominis, which they perforate. They supply the rectus abdominis and end as the anterior cutaneous branches of the abdomen. They supply the skin of the front of the abdomen. The lower intercostal nerves supply their intercostalis and abdominal muscles. The last three send branches to the serratus posterior inferior. About the middle of their course they give off lateral cutaneous branches. These pierce the intercostalis externi and the obliquus externus abdominis in the same line as the lateral cutaneous branches of the upper thoracic nerves, and divide into anterior and posterior branches, which are distributed to the skin of the abdomen and back. The anterior branches supply the digitations of the obliquus externus abdominis, and extend downward and forward nearly as far as the margin of the rectus abdominis. The posterior branches pass backward to supply the skin over the latissimus dorsi. The anterior division of the 12th thoracic nerve is larger than the others. It runs along the lower border of the 12th rib, often gives a communicating branch to the first lumbar nerve, and passes under the lateral lumbocostal arch. It then runs in front of the quadratus lumborum, perforates the transversus, and passes forward between it and the obliquus internus, to be distributed in the same manner as the lower intercostal nerves. It communicates with the ilio-hypogastric nerve of the lumbar plexus, and gives a branch to the pyramidalis. The lateral cutaneous branch of the last thoracic nerve is large, and does not divide into an anterior and a posterior branch. It perforates the obliqui internus and externus, descends over the iliac crest in front of the lateral cutaneous branch of the ilio-hypogastric, and is distributed to the skin of the front part of the gluteal region, some of its filaments extending as low as the greater trochanter. End of section 39. Recording by Leanne Howlett.
Section 40 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Reading by Bologna Times. Anatomy of the Human Body, Part 4, by Henry Gray. The lumbosacral plexus. The lumbosacral plexus, plexus lumbosacralis. The anterior divisions of the lumbar, sacral, and coccygeal nerves form the lumbosacral plexus, the first lumbar nerve being frequently joined by a branch from the 12th thoracic. For descriptive purposes, this plexus is usually divided into three parts, the lumbar, sacral, and pudendal plexuses. The lumbar nerves, nervus lumbalis. The anterior divisions of the lumbar nerves, rami anterioris, increase in size from above downward. They are joined near the origins by gray rami communicantes from the lumbar ganglia of the sympathetic trunk. These rami consist of long, slender branches which accompany the lumbar arteries around the sides of the vertebral bodies, beneath the psoas major. Their arrangement is somewhat irregular. One ganglion may give rami to two lumbar nerves, or one lumbar nerve may receive rami from two ganglia. The first and second, and sometimes the third and fourth lumbar nerves are each connected with the lumbar part of the sympathetic trunk by a white ramus communicans. The nerves pass obliquely outward, behind the psoas major, or between its fasciculi, distributing filaments to it and the quadratus lumborum. The first three and the greater part of the fourth are connected together in this situation by anastomotic loops, and form the lumbar plexus. The smaller part of the fourth joins with the fifth to form the lumbosacral trunk, which assists in the formation of the sacral plexus. The fourth nerve is named the nervus furcalis from the fact that it is subdivided between the two plexuses. The lumbar plexus, plexus lumbalis. The lumbar plexus is formed by the loops of communication between the anterior divisions of the first three and the greater part of the fourth lumbar nerves. The first lumbar often receives a branch from the last thoracic nerve. It is situated in the posterior part of the psoas major, in front of the transverse processes of the lumbar vertebrae. The mode in which the plexus is arranged varies in different subjects. It differs from the brachial plexus in not forming an intricate interlacement, but the several nerves of distribution arise from one or more of the spinal nerves, in the following manner. The first lumbar nerve, frequently supplemented by a twig from the last thoracic, splits into an upper and lower branch. The upper and larger branch divides into the iliohypogastric and ilioinguinal nerves. The lower and smaller branch unites with a branch of the second lumbar to form the genitofemoral nerve. The remainder of the second nerve and the third and fourth nerves divide into ventral and dorsal divisions. The ventral division of the second unites with the ventral divisions of the third and fourth nerves to form the obturator nerve. The dorsal divisions of the second and third nerves divide into two branches, a smaller branch from each uniting to form the lateral femoral cutaneous nerve, and a larger branch from each joining with the dorsal division of the fourth nerve to form the femoral nerve. The accessory obturator, when it exists, is formed by the union of two small branches given off from the third and fourth nerves. The branches of the lumbar plexus may therefore be arranged as follows: iliohypogastric, first lumbar; ilioinguinal, first lumbar; genitofemoral, first, second lumbar. Dorsal divisions: lateral femoral cutaneous, second and third lumbar; femoral, second, third, fourth lumbar. Ventral divisions: obturator, second, third, and fourth lumbar; accessory obturator, third and fourth lumbar. The iliohypogastric nerve, nervus iliohypogastricus, arrives from the first lumbar nerve. It emerges from the upper part of the lateral border of the psoas major, and crosses obliquely in front of the quadratus lumborum to the iliac crest. It then perforates the posterior part of the transversus abdominis, near the crest of the ilium, and divides between that muscle and the obliquus internus abdominis into a lateral and an anterior cutaneous branch. The lateral cutaneous branch, ramus cutaneus lateralis, iliac branch, pierces the oblique internus and externus immediately above the iliac crest, and is distributed to the skin of the gluteal region, behind the lateral cutaneous branch of the last thoracic nerve. The size of this branch bears an inverse proportion to that of the lateral cutaneous branch of the last thoracic nerve. The anterior cutaneous branch, ramus cutaneous anterior, hypogastric branch, continues onward between the obliquus internus and transversus. It then pierces the obliquus internus, becomes cutaneous by perforating the aponeurosis of the obliquus externus about 2.5 cm above the subcutaneous inguinal ring, and is distributed to the skin of the hypogastric region. The iliohypogastric nerve communicates with the last thoracic and ilioinguinal nerves. The ilioinguinal nerve, nervus ilioinguinalis, smaller than the preceding, arises with it from the first lumbar nerve. It emerges from the lateral border of the psoas major, just below the iliohypogastric, and, passing obliquely across the quadratus lumborum and iliacus, it perforates the transversus abdominis near the anterior part of the iliac crest, and communicates with the iliohypogastric nerve between the transversus and the obliquus internus. The nerve then pierces the obliquus internus, distributing filaments to it, and, accompanying the spermatic cord through the subcutaneous inguinal ring, is distributed to the skin of the upper and medial part of the thigh, to the skin over the root of the penis and upper part of the scrotum in the male, and to the skin covering the mons pubis and labium majus in the female. The size of this nerve is in inverse proportion to that of the iliohypogastric. Occasionally it is very small, and ends by joining the iliohypogastric. In such cases, a branch from the iliohypogastric takes the place of the ilioinguinal, or the latter nerve may be altogether absent. The genitofemoral nerve, nervus genitofemoralis, genitocrural nerve, arises from the first and second lumbar nerves. It passes obliquely through the substance of the psoas major, and emerges from its medial border, close to the vertebral column, opposite the fibrocartilage between the third and fourth lumbar vertebrae. It then descends on the surface of the psoas major under cover of the peritoneum, and divides into the external spermatic and lumboinguinal nerves. Occasionally these two nerves emerge separately through the substance of the psoas. The external spermatic nerve, nervus spermaticus externus, genital branch of genitofemoral, passes outward on the psoas major, and pierces the fascia transversalis, or passes through the abdominal inguinal ring. It then descends behind the spermatic cord to the scrotum, supplies the cremaster, and gives a few filaments to the skin of the scrotum. In the female, it accompanies the round ligament of the uterus, and is lost upon it. The lumboinguinal nerve, nervus lumboinguinalis, femoral or crural branch of genitofemoral, descends on the external iliac artery, sending a few filaments around it, and, passing beneath the inguinal ligament, enters the sheath of the femoral vessels, lying superficial and lateral to the femoral artery. It pierces the anterior layer of the sheath of the vessels and the fascia lata, and supplies the skin of the anterior surface of the upper part of the thigh. On the front of the thigh it communicates with the anterior cutaneous branches of the femoral nerve. A few filaments from the lumboinguinal nerve may be traced to the femoral artery. The lateral femoral cutaneous nerve, nervus cutaneous femoralis lateralis, external cutaneous nerve, arises from the dorsal divisions of the second and third lumbar nerves. It emerges from the lateral border of the psoas major about its middle, and crosses the iliacus obliquely toward the anterior superior iliac spine. It then passes under the inguinal ligament and over the sartorius muscle into the thigh, where it divides into two branches, an anterior and a posterior. The anterior branch becomes superficial about 10 centimeters below the inguinal ligament, and divides into branches which are distributed to the skin of the anterior and lateral parts of the thigh, as far as the knee. The terminal filaments of this nerve frequently communicate with the anterior cutaneous branches of the femoral nerve, and with the infrapatellar branch of the saphenous nerve, forming with them the patellar plexus. The posterior branch pierces the fascia lata and subdivides into filaments which pass backward across the lateral and posterior surfaces of the thigh, supplying the skin from the level of the greatest trochanter to the middle of the thigh. The obturator nerve, nervus obturatoris, arises from the ventral divisions of the second, third, and fourth lumbar nerves. The branch from the third is the largest, while that from the second is often very small. It descends through the fibers of the psoas major, and emerges from its medial border near the brim of the pelvis. It then passes behind the common iliac vessels, and on the lateral side of the hypogastric vessels and ureter, which separate it from the ureter, and runs along the lateral wall of the lesser pelvis, above and in front of the obturator vessels, to the upper part of the obturator foramen. Here it enters the thigh, and divides into an anterior and a posterior branch, which are separated at first by some of the fibers of the obturator externus, and lower down by the abductor brevis. The anterior branch, ramus anterior, leaves the pelvis in front of the obturator externus, and descends in front of the adductor brevis, and behind the pectineus and adductor longus. At the lower border of the latter muscle it communicates with the anterior cutaneous and saphenous branches of the femoral nerve, forming a kind of plexus. It then descends upon the femoral artery, to which it is finally distributed. Near the obturator foramen the nerve gives off an articular branch to the hip joint. Behind the pectineus it distributes branches to the adductor longus and gracilis, and usually to the adductor brevis, and in rare cases to the pectineus. It receives a communicating branch from the accessory obturator nerve when that nerve is present. Occasionally the communicating branch to the anterior cutaneous and saphenous branches of the femoral is continued down, as a cutaneous branch, to the thigh and leg. When this is so, it emerges from beneath the lower border of the adductor longus, descends along the posterior margin of the sartorius to the medial side of the knee, where it pierces the deep fascia, communicates with the saphenous nerve, and is distributed to the skin of the tibial side of the leg as low down as its middle. The posterior branch, ramus posterior, pierces the anterior part of the obturator externus, and supplies this muscle. It then passes behind the adductor brevis on the front of the adductor magnus, where it divides into numerous muscular branches which are distributed to the adductor magnus and the adductor brevis when the latter does not receive a branch from the anterior division of the nerve. It usually gives off an articular filament to the knee joint. The articular branch for the knee joint is sometimes absent. It either perforates the lower part of the adductor magnus, or passes through the opening which transmits the femoral artery, and enters the popliteal fossa. It then descends upon the popliteal artery as far as the back part of the knee joint, where it perforates the oblique popliteal ligament, and is distributed to the synovial membrane. It gives filaments to the popliteal artery. The accessory obturator nerve, nervus obturatorius accessorius, is present in about 29% of cases. It is of small size and arises from the ventral divisions of the third and fourth lumbar nerves. It descends along the medial border of the psoas major, crosses the superior ramus of the pubis, and passes under the pectineus, where it divides into numerous branches. One of these supplies the pectineus, penetrating its deep surface, Another is distributed to the hip joint, while a third communicates with the anterior branch of the obturator nerve. Occasionally the accessory obturator nerve is very small and is lost in the capsule of the hip joint. When it is absent, the hip joint receives two branches from the obturator nerve. The femoral nerve, Nervus femoralis, anterior crural nerve. The largest branch of the lumbar plexus arises from the dorsal divisions of the second, third, and fourth lumbar nerves. It descends through the fibers of the psoas major, emerging from the muscle at the lower part of its lateral border, and passes down between it and the iliacus, behind the iliac fascia. It then runs beneath the inguinal ligament into the thigh, and splits into an anterior and a posterior division. Under the inguinal ligament it is separated from the femoral artery by a portion of the psoas major. Within the abdomen the femoral nerve gives off small branches to the iliacus, and a branch which is distributed upon the upper part of the femoral artery. The latter branch may arise in the thigh. In the thigh, the anterior division of the femoral nerve gives off anterior cutaneous and muscular branches. The anterior cutaneous branches comprise the intermediate and medial cutaneous nerves. The intermediate cutaneous nerve, ramus cutaneous anterior, middle cutaneous nerve, pierces the fascia lata, and generally the sartorius, about 7.5 centimeters below the inguinal ligament, and divides into two branches which descend in immediate proximity along the forepart of the thigh, to supply the skin as low as the front of the knee. Here they communicate with the medial cutaneous nerve and the infrapatellar branch of the saphenous to form the patellar plexus. In the upper part of the thigh, the lateral branch of the intermediate cutaneous communicates with the lumboinguinal branch of the genitofemoral nerve. The medial cutaneous nerve, ramus cutaneous anterior, internal cutaneous nerve, passes obliquely across the upper part of the sheath of the femoral artery and divides in front, or at the medial side of that vessel, into two branches, an anterior and a posterior. The anterior branch runs downward on the sartorius, perforates the fascia lata at the lower third of the thigh, and divides into two branches. One supplies the integument as low down as the medial side of the knee. The other crosses to the lateral side of the patella, communicating in its course with the infrapatellar branch of the saphenous nerve. The posterior branch descends along the medial border of the sartorius muscle to the knee, where it pierces the fascia lata, communicates with the saphenous nerve, and gives off several cutaneous branches. It then passes down to supply the integument of the medial side of the leg. Beneath the fascia lata, at the lower border of the adductor longus, it joins to form a plexiform network, subsartorial plexus, with branches of the saphenous and obturator nerves. When the communicating branch from the obturator nerve is large and continued to the integument of the leg, the posterior branch of the medial cutaneous is small and terminates in the plexus, occasionally giving off a few cutaneous filaments. The medial cutaneous nerve, before dividing, gives off a few filaments, which pierce the fascia lata to supply the integument of the medial side of the thigh, accompanying the long saphenous vein. One of these filaments passes through the saphenous opening. A second becomes subcutaneous about the middle of the thigh. A third pierces the fascia at its lower third. Muscular branches, rami muscularis. The nerve to the pectineus arises immediately below the inguinal ligament, and passes behind the femoral sheath to enter the anterior surface of the muscle. It is often duplicated. The nerve to the sartorius arises in common with the intermediate cutaneous. The posterior division of the femoral nerve gives off the saphenous nerve and muscular and articular branches. The saphenous nerve. Nervus saphenous, long or internal saphenous nerve, is the largest cutaneous branch of the femoral nerve. It approaches the femoral artery where this vessel passes beneath the sartorius and lies in front of it, behind the aponeurotic covering of the adductor canal, as far as the opening in the lower part of the adductor magnus. Here it quits the artery, and emerges from behind the lower edge of the aponeurotic covering of the canal. It descends vertically along the medial side of the knee behind the sartorius, pierces the fascia lata between the tendons of the sartorius and gracilis, and becomes subcutaneous. The nerve then passes along the tibial side of the leg, accompanied by the great saphenous vein, descends behind the medial border of the tibia, and, at the lower third of the leg, divides into two branches. One continues its course along the margin of the tibia and ends at the ankle. The other passes in front of the ankle, and is distributed to the skin on the medial side of the foot, as far as the ball of the great toe, communicating with the medial branch of the superficial peroneal nerve. Branches. The saphenous nerve, about the middle of the thigh, gives off a branch which joins the subsartorial plexus. At the medial side of the knee it gives off a large infrapatellar branch, which pierces the sartorius and fascia lata, and is distributed to the skin in front of the patella. This nerve communicates above the knee with the anterior cutaneous branches of the femoral nerve below the knee, with other branches of the saphenous, and, on the lateral side of the joint, with branches of the lateral femoral cutaneous nerve, forming a plexiform network, the plexus patellae. The infrapatellar branch is occasionally small, and ends by joining the anterior cutaneous branches of the femoral, which supply its place in front of the knee. Below the knee, the branches of the saphenous nerve are distributed to the skin of the front and medial side of the leg, communicating with the cutaneous branches of the femoral, or with filaments from the obturator nerve. The muscular branches supply the fore parts of the quadriceps femoris. The branch to the rectus femoris enters the upper part of the deep surface of the muscle and supplies a filament to the hip joint. The branch to the vastus lateralis, of large size, accompanies the descending branch of the lateral femoral circumflex artery to the lower part of the muscle. It gives off an articular filament to the knee joint. The branch to the vastus medialis descends lateral to the femoral vessels in company with the saphenous nerve. It enters the muscle about its middle, and gives off a filament, which can usually be traced downward on the surface of the muscle to the knee joint. The branches to the vastus intermedius, 2 or 3 in number, enter the anterior surface of the muscle about the middle of the thigh. A filament from one of these descends through the muscle to the articularis genu and the knee joint. The articular branch to the hip joint is derived from the nerve to the rectus femoris. The articular branches to the knee joint are 3 in number. 1. A long, slender filament is derived from the nerve to the vastus lateralis. It penetrates the capsule of the joint on its anterior aspect. Another, derived from the nerve to the vastus medialis, can usually be traced downward on the surface of this muscle to near the joint. It then penetrates the muscular fibers, and accompanies the articular branch of the highest genicular artery, pierces the medial side of the articular capsule, and supplies the synovial membrane. The third branch is derived from the nerve to the vastus intermedius. Footnote: Note 135. In most cases the fourth lumbar is the nervus porcalis, but this arrangement is frequently departed from. The third is occasionally the lowest nerve which enters the lumbar plexus, giving at the same time some fibers to the sacral plexus, and thus forming the nervus porcalis. or both the third and fourth may be furcal nerves. When this occurs, the plexus is termed high or prefixed. More frequently, the fifth nerve is divided between the lumbar and sacral plexuses, and constitutes the nervus furcalis, and when this takes place, the plexus is distinguished as a low or postfixed plexus. These variations necessarily produce corresponding modifications in the sacral plexus. End footnote. End of section 40.
Section 41 of Anatomy of the Human Body, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Anatomy of the Human Body by Henry Gray, Part 4. The Sacral and Coccygeal Nerves. Nervi sacralis and coccygeus. The anterior divisions of the sacral and coccygeal nerves, rami anteriores, form the sacral and pudendal plexuses. The anterior divisions of the upper four sacral nerves enter the pelvis through the anterior sacral foramina, that of the fifth between the sacrum and coccyx, while that of the coccygeal nerve curves forward below the rudimentary transverse process of the first piece of the coccyx. The first and second sacral nerves are large. The third, fourth, and fifth diminish progressively from above downward. Each receives a gray ramus communicans from the corresponding ganglion of the sympathetic trunk, while from the third and frequently from the second and the fourth sacral nerves, a white ramus communicans is given to the pelvic plexuses of the sympathetic. The sacral plexus, plexus sacralis. The sacral plexus is formed by the lumbosacral trunk, the anterior division of the first, and portions of the anterior divisions of the second and third sacral nerves. The lumbosacral trunk comprises the whole of the anterior division of the fifth and a part of that of the fourth lumbar nerve. It appears at the medial margin of the psoas major and runs downward over the pelvic brim to form the first sacral nerve. The anterior division of the third sacral nerve divides into an upper and a lower branch, the former entering the sacral and the latter the pudendal plexus. The nerves forming the sacral plexus converge toward the lower part of the greater sciatic foramen and unite to form a flattened band, from the anterior and posterior surfaces of which several branches arise. The band itself is continued as the sciatic nerve, which splits on the back of the thigh into the tibial and common peroneal nerves. These two nerves sometimes arise separately from the plexus, and in all cases their independence can be shown by dissection. Relation. The sacral plexus lies on the back of the pelvis between the piriformis and the pelvic fascia. In front of it are the hypogastric vessels, the ureter, and the sigmoid colon. The superior gluteal vessels run between the lumbosacral trunk and the first sacral nerve, and the inferior gluteal vessels between the second and third sacral nerves. All the nerves entering the plexus, with the exception of the third sacral, split into ventral and dorsal divisions, and the nerves arising from these are as follows. Nerve to quadratus femoris and gemellus inferior, ventral divisions, fourth and fifth lumbar, first sacral. Nerve to obturator internus and gemellus superior, ventral divisions, fifth lumbar, first and second sacral. Nerve to piriformis, dorsal divisions, first, second sacral. Superior gluteal, dorsal divisions, fourth and fifth lumbar, first sacral. Inferior gluteal, dorsal divisions, fifth lumbar, first and second sacral. Posterior femoral cutaneous, ventral divisions, second and third sacral, dorsal divisions, first and second sacral. Sciatic, tibial, ventral divisions, fourth and fifth lumbar, first, second, and third sacral. Common peroneal, dorsal divisions, fourth and fifth lumbar, first and second sacral. The nerve to the quadratus femoris and gemellus inferior arises from the ventral divisions of the fourth and fifth lumbar and first sacral nerves. It leaves the pelvis through the greater sciatic foramen, below the piriformis, and runs down in front of the sciatic nerve, the gemelli, and the tendon of the obturator internus, and enters the anterior surfaces of the muscles. It gives an articular branch to the hip joint. The nerve to the obturator internus and gemellus superior arises from the ventral divisions of the fifth lumbar and first and second sacral nerves. It leaves the pelvis through the greater sciatic foramen below the piriformis, and gives off the branch to the gemellus superior, which enters the upper part of the posterior surface of the muscle. It then crosses the ischial spine, re-enters the pelvis through the lesser sciatic foramen, and pierces the pelvic surface of the obturator internus. The nerve to the piriformis arises from the dorsal division of the second sacral nerve, or the dorsal divisions of the first and second sacral nerves, and enters the anterior surface of the muscle. This nerve may be double. The superior gluteal nerve, nervus gluteus superior, arises from the dorsal divisions of the fourth and fifth lumbar and first sacral nerves. It leaves the pelvis through the greater sciatic foramen above the piriformis, accompanied by the superior gluteal vessels, and divides into a superior and an inferior branch. The superior branch accompanies the upper branch of the deep division of the superior gluteal artery and ends in the gluteus minimus. The inferior branch runs with the lower branch of the deep division of the superior gluteal artery across the gluteus minimus. It gives filaments to the gluteae medius and minimus, and ends in the tensor fasciae lati. The inferior gluteal nerve, nervus gluteus inferior, arises from the dorsal divisions of the fifth lumbar and first and second sacral nerves. It leaves the pelvis through the greater sciatic foramen, below the piriformis, and divides into branches which enter the deep surface of the gluteus maximus. The posterior femoral cutaneous nerve, nervus cutaneus femoralis posterior, small sciatic nerve, is distributed to the skin of the perineum and the posterior surface of the thigh and leg. It arises partly from the dorsal divisions of the first and second, and from the ventral divisions of the second and third sacral nerves, and issues from the pelvis through the greater sciatic foramen, below the piriformis. It then descends beneath the gluteus maximus with the inferior gluteal artery, and runs down the back of the thigh beneath the fascia lata, and over the long head of the biceps femoris to the back of the knee. Here it pierces the deep fascia, and accompanies the small saphenous vein to about the middle of the back of the leg, its terminal twigs communicating with the sural nerve. Its branches are all cutaneous, and are distributed to the gluteal region, the perineum, and the back of the thigh and leg. The gluteal branches, nervi cluneum inferioris, 3 or 4 in number, turn upward around the lower border of the gluteus maximus, and supply the skin covering the lower and lateral part of that muscle. The perineal branches, rami perinealis, are distributed to the skin at the upper and medial side of the thigh. One long perineal branch, inferior pudental, long scrotal nerve, curves forward below and in front of the ischial tuberosity, pierces the fascia lata, and runs forward beneath the superficial fascia of the perineum to the skin of the scrotum in the male, and of the labium majus in the female. It communicates with the inferior hemorrhoidal and posterior scrotal nerves. The branches to the back of the thigh and leg consist of numerous filaments derived from both sides of the nerve, and distributed to the skin covering the back and medial side of the thigh, the popliteal fossa, and the upper part of the back of the leg. The sciatic, nervus ischiadicus, great sciatic nerve, supplies nearly the whole of the skin of the leg, the muscles of the back of the thigh, and those of the leg and foot. It is the largest nerve in the body, measuring 2 centimeters in breadth, and is the continuation of the flattened band of the sacral plexus. It passes out of the pelvis through the greater sciatic foramen, below the piriformis muscle. It descends between the greater trochanter of the femur and the tuberosity of the ischium, and along the back of the thigh to about its lower third, where it divides into 2 large branches, the tibial and common perineal nerves. This division may take place at any point between the sacral plexus and the lower third of the thigh. When it occurs at the plexus, the common perineal nerve usually pierces the piriformis. In the upper part of its course, The nerve rests upon the posterior surface of the ischium, the nerve to the quadratus femoris, the obturator internus and gemelli, and the quadratus femoris. It is accompanied by the posterior femoral cutaneous nerve and the inferior gluteal artery, and is covered by the gluteus maximus. Lower down it lies upon the adductor magnus and is crossed obliquely by the long head of the biceps femoris. The nerve gives off articular and muscular branches. The articular branches, rami articulares, arise from the upper part of the nerve and supply the hip joint, perforating the posterior part of its capsule. They are sometimes derived from the sacral plexus. The muscular branches, rami musculares, are distributed to the biceps femoris, semitendinosus, semimembranosus, and adductor magnus. The nerve to the short head of the biceps femoris comes from the common peroneal part of the sciatic, while the other muscular branches arise from the tibial portion, as may be seen in those cases where there is a high division of the sciatic nerve. The tibial nerve, N. tibialis, internal popliteal nerve, the larger of the two terminal branches of the sciatic, arises from the anterior branches of the fourth and fifth lumbar and first, second, and third sacral nerves. It descends along the back of the thigh and through the middle of the popliteal fossa to the lower part of the popliteus muscle, where it passes with the popliteal artery beneath the arch of the soleus. It then runs along the back of the leg with the posterior tibial vessels to the interval between the medial malleolus and the heel, where it divides between the laciniate ligament into the medial and lateral plantar nerves. In the thigh it is overlapped by the hamstring muscles above, and then becomes more superficial, and lies lateral to and some distance from the popliteal vessels. Opposite the knee joint, it is in close relation with these vessels, and crosses to the medial side of the artery. In the leg it is covered in the upper part of its course by the muscles of the calf, lower down by the skin, the superficial and deep fascia. It is placed on the deep muscles, and lies at first to the medial side of the posterior tibial artery, but soon crosses that vessel and descends on its lateral side as far as the ankle. In the lower third of the leg, it runs parallel with the medial margin of the tendo calcaneus. The branches of this nerve are articular, muscular, medial sural cutaneous, medial calcaneal, medial, and lateral plantar. Articular branches, rami articulares, usually 3 in number, supply the knee joint. 2 of these accompany the superior and inferior medial genicular arteries, and a third the middle genicular artery. Just above the bifurcation of the nerve, an articular branch is given off to the ankle joint. Muscular branches, rami musculares, 4 or 5 in number, arise from the nerve as it lies between the 2 heads of the gastrocnemius muscle. They supply that muscle and the plantaris, soleus, and popliteus. The branch for the popliteus turns around the lower border and is distributed to the deep surface of the muscle. Lower down, muscular branches arise separately or by a common trunk and supply the soleus, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. The branch to the last muscle accompanies the peroneal artery. That to the soleus enters the deep surface of the muscle. The medial sural cutaneous nerve, nervus cutaneus suri medialis, nervus cumanicans tibialis, descends between the 2 heads of the gastrocnemius and about the middle of the back of the leg, pierces the deep fascia, and unites with the anastomotic ramus of the common peroneal to form the sural nerve. The sural nerve, nervus suralis, short saphenous nerve, formed by the junction of the medial sural cutaneous with the peroneal anastomotic branch, passes downward near the lateral margin of the tendo calcaneus, lying close to the small saphenous vein, to the interval between the lateral malleolus and the calcaneus. It runs forward below the lateral malleolus and is continued as the lateral dorsocutaneous nerve along the lateral side of the foot and little toe, communicating on the dorsum of the foot with the intermediate dorsal cutaneous nerve, a branch of the superficial peroneal. In the leg, its branches communicate with those of the posterior femoral cutaneous. The medial calcaneal branches, rami calcaneae medialis, internal calcaneal branches, perforate the laciniate ligament and supply the skin of the heel and medial side of the sole of the foot. The medial plantar nerve, nervus plantaris medialis, internal plantar nerve, the larger of the two terminal divisions of the tibial nerve, accompanies the medial plantar artery. From its origin under the laciniate ligament, it passes under the cover of the abductor hallucis, and appearing between this muscle and the flexor digitorum brevis, gives off a proper digital plantar nerve, and finally divides opposite the bases of the metatarsal bones into three common digital plantar nerves. Branches. The branches of the medial plantar nerve are 1. Cutaneous, 2. Muscular, 3. Articular, 4. A proper digital nerve to the medial side of the great toe, and 5. 3 common digital nerves. The cutaneous branches pierce the plantar aponeurosis between the abductor hallucis and the flexor digitorum brevis, and are distributed to the skin of the sole of the foot. The muscular branches supply the abductor hallucis, the flexor digitorum brevis, the flexor hallucis brevis, and the first lumbriculus. Those for the abductor hallucis and flexor digitorum brevis arise from the trunk of the nerve near its origin and enter the deep surfaces of the muscles. The branch of the flexor hallucis brevis springs from the proper digital nerve to the medial side of the great toe, and that for the first lumbriculus from the first common digital nerve. The articular branches supply the articulations of the tarsus and metatarsus. The proper digital nerve of the great toe, nervi digitalis plantaris proprii, plantar digital branches, supplies the flexor hallucis brevis and the skin on the medial side of the great toe. The three common digital nerves, nervi digitalis plantaris communes, pass between the divisions of the plantar aponeurosis, and each splits into two proper digital nerves. Those of the first common digital nerve supply the adjacent sides of the great and second toes, those of the second the adjacent sides of the second and third toes, and those of the third the adjacent sides of the third and fourth toes. The third common digital nerve receives a communicating branch from the lateral plantar nerve. The first gives a twig to the first lumbriculus. Each proper digital nerve gives off cutaneous and articular filaments, and opposite the last phalanx sends upward a dorsal branch, which supplies the structures around the nail, the continuation of the nerve being distributed to the ball of the toe. It will be observed that these digital nerves are similar in their distribution to those of the median nerve in the hand. The lateral plantar nerve, nervus plantaris lateralis, external plantar nerve, supplies the skin of the fifth toe and lateral half of the fourth, as well as most of the deep muscles, its distribution being similar to that of the ulnar nerve in the hand. It passes obliquely forward with the lateral plantar artery to the lateral side of the foot, lying between the flexor digitorum brevis and the quadratus plantae, and in the interval between the former muscle and the abductor digiti quinti, divides into a superficial and a deep branch. Before its division it supplies the quadratus plantae and abductor digiti quinti. The superficial branch, ramus superficialis, splits into a proper and a common digital nerve. The proper digital nerve supplies the lateral side of the little toe, the flexor digiti quinti brevis, and the two interosii of the fourth intermetatarsal space. The common digital nerve communicates with the third common digital branch of the medial plantar nerve and divides into two proper digital nerves which supply the adjoining sides of the fourth and fifth toes. The deep branch, ramus profundus, muscular branch, accompanies the lateral plantar artery on the deep surface of the tendons of the flexor muscles and the adductor hallucis, and supplies all the interosii except those in the fourth metatarsal space, the second, third, and fourth lumbricules, and the adductor hallucis. End of section 41.
Section 42 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by David Lawrence. Anatomy of the Human Body, Part 4, by Henry Gray. Sacral and coccygeal nerves, Part 2. The common peroneal nerve, nervus peroneus communis. External popliteal nerve, peroneal nerve. About 1/2 the size of the tibial, is derived from the dorsal branches of the 4th and 5th lumbar and the 1st and 2nd sacral nerves. It descends obliquely along the lateral side of the popliteal fossa to the head of the fibula, close to the medial margin of the biceps femoris muscle. It lies between the tendon of the biceps femoris and lateral head of the gastrocnemius muscle, winds around the neck of the fibula between the peroneus longus and the bone, and divides between the muscle into the superficial and deep peroneal nerves. Previous to its division, it gives off articular and lateral sural cutaneous nerves. The articular branches, rami articulares, are 3 in number. 2 of these accompany the superior and inferior lateral genicular arteries to the knee. The upper one occasionally arises from the trunk of the sciatic nerve. The third, recurrent, articular nerve is given off at the point of division of the common peroneal nerve. It ascends with the anterior recurrent tibial artery through the tibialis anterior to the front of the knee. The lateral sural cutaneous nerve, nervus cutaneus surae lateralis, lateral cutaneous branch, supplies the skin on the posterior and lateral surfaces of the leg. One branch, the peroneal anastomonic, nervus communicans fibularis, arises near the head of the fibula, crosses the lateral head of the gastrocnemius to the middle of the leg, and joins with the medial sural cutaneous to form the sural nerve. The peroneal anastomonic is occasionally continued down as a separate branch as far as the heel. The deep peroneal nerve, nervus peroneus profundus, anterior tibial nerve, begins at the bifurcation of the common peroneal nerve, between the fibula and the upper part of the peroneus longus, passes obliquely forward beneath the extensor digitorum longus to the front of the interosseous membrane, and comes into relation with the anterior tibular artery above the middle of the leg. It then descends with the artery to the front of the ankle joint, where it divides into a lateral and a medial terminal branch. It lies at first at the lateral side of the anterior tibial artery, then in front of it, and again on its lateral side at the ankle joint. In the leg, the deep peroneal nerve supplies muscular branches to the tibialis anterior, extensor digitorum longus, peroneus tertius, and extensor hallucis proprius, and an articular branch to the ankle joint. The lateral terminal branch, external or tarsal branch, passes across the tarsus beneath the extensor digitorum brevis, and having become enlarged like the dorsal interosseous nerve at the wrist, supplies the extensor digitorum brevis. From the enlargement 3 minute interosseous branches are given off, which supply the tarsal joints and the metatarsal phalangeal joints of the 2nd, 3rd, and 4th toes. The first of these sends a filament to the 2nd interosseous dorsalis muscle. The medial terminal branch, internal branch, accompanies the dorsalis pedis artery along the dorsum of the foot, and, at the first interosseous space, divides into 2 dorsal digital nerves, nervi digitalis dorsalis hallucis lateralis et digiti secundi medialis, which supply the adjacent sides of the great and 2nd toes, communicating with the medial dorsal cutaneous branch of the superficial peroneal nerve. Before it divides, it gives off to the first space an interosseous branch, which supplies the metatarsal phalangeal joint of the great toe, and sends a filament to the first interosseous dorsalis muscle. The superficial peroneal nerve, Nervus peroneus superficialis, musculocutaneous nerve, supplies the peroneus longus and brevis and the skin over the greater part of the dorsum of the foot. It passes forward between the peroneus and the extensor digitorum longus, pierces the deep fascia at the lower third of the leg, and divides into a medial and an intermediate dorsal cutaneous nerve. In its course between the muscles, the nerve gives off muscular branches to the peroneus longus and brevis, and cutaneous filaments to the integument of the lower part of the leg. The medial dorsal cutaneous nerve, Nervus cutaneus dorsalis medialis, internal dorsal cutaneous branch, passes in front of the ankle joint and divides into two dorsal digital branches, one of which supplies the medial side of the great toe, the other the adjacent side of the second and third toes. It also supplies the integument of the medial side of the foot and ankle, and communicates with the saphenous nerve and with the deep peroneal nerve. The intermediate dorsal cutaneous nerve, Nervus cutaneus dorsalis intermedius, external dorsal cutaneous branch, the smaller, passes along the lateral part of the dorsum of the foot and divides into the dorsal digital branches, which supply the contiguous sides of the third and fourth, and of the fourth and fifth toes. It also supplies the skin of the lateral side of the foot and ankle, and communicates with the sural nerve. The branches of the superficial peroneal nerve supply the skin of the dorsal surfaces of all the toes except the lateral side of the little toe, and the adjoining sides of the great and second toes, the former being supplied by the lateral dorsal cutaneous nerve from the sural nerve, and the latter by the medial branch of the deep peroneal nerve. Frequently some of the lateral branches of the superficial peroneal are absent, and their places are then taken by branches of the sural nerve. The pudental plexus, plexus pudentus. The pudental plexus is not sharply marked off from the sacral plexus, and, as a consequence, some of the branches which spring from it may arise in conjunction with those of the sacral plexus. It lies on the posterior wall of the pelvis, and is usually formed by branches from the anterior divisions of the second and third sacral nerves, the whole of the anterior divisions of the fourth and fifth sacral nerves, and the coccygeal nerve. It gives off the following branches: perforating cutaneous, second and third sacral; pudental, second, third, and fourth sacral; visceral, third and fourth sacral; muscular, fourth sacral; anococcygeal, fourth and fifth sacral and coccygeal. The perforating cutaneous nerve, Nervus cluneum inferior medialis, usually arises from the posterior surface of the second and third sacral nerves. It pierces the lower part of the sacrotuberous ligament, and winding around the inferior border of the gluteus maximus, supplies the skin covering the medial and lower parts of that muscle. The perforating cutaneous nerve may arise from the pudental, or it may be absent. In the latter case its place may be taken by a branch from the posterior femoral cutaneous nerve, or by a branch from the third and fourth, or fourth and fifth, sacral nerves. The pudental nerve, Nervus pudentus internal pudic nerve, derives its fibers from the ventral branches of the second, third, and fourth sacral nerves. It passes between the piriformis and coccygeus muscles, and leaves the pelvis through the lower part of the greater sciatic foramen. It then crosses the spine of the ischium and re-enters the pelvis through the lesser sciatic foramen. It accompanies the internal pudental vessels upward and forward along the lateral wall of the ichiorectal fossa, being contained in a sheath of the obturator fascia termed Alcock's canal, and divides into two terminal branches, viz., the peroneal nerve and the dorsal nerve of the penis or clitoris. Before its division it gives off the inferior hemorrhoidal nerve. The inferior hemorrhoidal nerve, Nervus hemorrhoidalis inferior, occasionally arises directly from the sacral plexus. It crosses the ichiorectal fossa with the inferior hemorrhoidal vessels toward the anal canal and the lower end of the rectum, and is distributed to the sphincter ani externus and to the integument around the anus. Branches of this nerve communicate with the perineal branch of the posterior femoral cutaneous and with the posterior scrotal nerves at the forepart of the perineum. The perineal nerve, nervus perinei, the inferior and larger of the two terminal branches of the pudental, is situated below the internal pudental artery. It accompanies the perineal artery and divides into posterior scrotal or labial and muscular branches. The posterior scrotal or labial branches, nervi scrotales or labiales posteriores, superficial peroneal nerves, are two in number, medial and lateral. They pierce the fascia of the urogenital diaphragm and run forward along the lateral part of the urethral triangle in company with the posterior scrotal branches of the perineal artery. They are distributed to the skin of the scrotum and communicate with the perineal branch of the posterior femoral cutaneous nerve. These nerves supply the labium majus in the female. The muscular branches are distributed to the transversus perinei superficialis, bulbocavernous, ichiocavernosus, and the constrictor urethra. A branch, the nerve to the bulb, given off from the nerve to the bulbocavernosus, pierces this muscle and supplies the corpus cavernosum urethrae, ending in the mucous membrane of the urethra. The dorsal nerve of the penis, nervus dorsalis penis, is the deepest division of the pudential nerve. It accompanies the internal pudental artery along the ramus of the ischium. It then runs forward along the margin of the inferior ramus of the pubis, between the superior and inferior layers of the fascia of the urogenital diaphragm. Piercing the inferior layer, it gives a branch to the corpus cavernosum penis, and passes forward in company with the dorsal artery of the penis, between the layers of the suspensory ligament, onto the dorsum of the penis, and ends on the glans penis. In the female this nerve is very small, and supplies the clitoris, nervus dorsalis clitoridis. The visceral branches arise from the third and fourth, and sometimes from the second sacral nerves, and are distributed to the bladder and rectum, and, in the female, to the vagina. They communicate with the pelvic plexuses of the sympathetic. The muscular branches are derived from the fourth sacral and supply the levator ani, coccygeus, and sphincter ani externus. The branches of the levator ani and coccygeus enter their pelvic surfaces. That to the sphincter ani externus, perineal branch, reaches the ischiorectal fossa by piercing the coccygeus or by passing between it and the levator ani. Cutaneous filaments from this branch supply the skin between the anus and the coccyge. Anococcygeal nerves, nervi anococcygeae. The fifth sacral nerve receives a communicating filament from the fourth, and unites with the coccygeal nerve to form the coccygeal plexus. From this plexus the anococcygeal nerves take origin. They consist of a few fine filaments which pierce the sacral tuberous ligament to supply the skin in the region of the coccyx. Recording by David Lawrence, in Brampton, Ontario, December 2009.
Section number 43 of Gray's Anatomy Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by M.L. Cohen, Anatomy of the Human Body Part 4 by Henry Gray, The Sympathetic Nerves. The sympathetic nervous system innervates all the smooth muscles and the various glands of the body, and the striated muscles of the heart. The efferent sympathetic fibers, which leave the central nervous system in connection with certain of the cranial and spinal nerves, all end in sympathetic ganglia and are known as preganglionic fibers. From these ganglia, postganglionic fibers arise and conduct impulses to the different organs. In addition, afferent or sensory fibers connect many of these structures with the central nervous system. The peripheral portion of the sympathetic nervous system is characterized by the presence of numerous ganglia and complicated plexuses. These ganglia are connected with the central nervous system by three groups of sympathetic efferent or preganglionic fibers, that is, the cranial, the thoracolumbar, and the sacral. These outflows of sympathetic fibers are separated by intervals where no connections exist. The cranial and sacral sympathetics are often grouped together owing to the resemblance between the reactions produced by stimulating them and by the effects of certain drugs. Acetylcholine, for example, when injected intravenously in very small doses, produces the same effect as the stimulation of the cranial or sacral sympathetics, while the introduction of adrenaline produces the same effect as the stimulation of the thoracolumbar sympathetics. Much of our present knowledge of the sympathetic nervous system has been acquired through the application of various drugs, especially nicotine, which paralyzes connections or synapses between the preganglionic and postganglionic fibers of the sympathetic nerves. When it is injected into the general circulation, all such synapses are paralyzed. When it is applied locally on a ganglion, only the synapses occurring in that particular ganglion are paralyzed. Langley, who has contributed greatly to our knowledge, adapted a terminology somewhat different from that used here and still different from that used by the pharmacologist. This has led to considerable confusion, as shown by the arrangement of the terms in the following columns. Gaskell has used the term involuntary nervous system. Gray, sympathetic nervous system. Langley, autonomic nervous system. Meyer and Gottlieb, vegetative nervous system. Gray, craniosacral sympathetics. Langley, parasympathetics. Meyer and Gottlieb, autonomic. Gray, oculomotor sympathetics. Langley, tectal autonomics. Meyer and Gottlieb, cranial autonomics. Gray, facial sympathetics, glossopharyngeal sympathetics, vagal sympathetics. Langley, bulbar autonomics. Gray, sacral sympathetics. Langley, sacral autonomics. Meyer and Gottlieb, sacral autonomics. Gray, thoracolumbar sympathetics. Langley, sympathetic. Meyer and Gottlieb, sympathetic. Gray, enteric. Langley, thoracic autonomic and enteric. Meyer and Gottlieb, enteric. The cranial sympathetics. The cranial sympathetics include sympathetic efferent fibers in the oculomotor, facial, glossopharyngeal, and vagus nerves, as well as sympathetic afferent in the last three nerves. The sympathetic efferent fibers of the oculomotor nerve probably arise from cells in the anterior part of the oculomotor nucleus, which is located in the tegmentum of the midbrain. These preganglionic fibers run with the third nerve into the orbit and pass to the ciliary ganglion, where they terminate by forming synapses with sympathetic motor neurons whose axons, postganglionic fibers, proceed as the short ciliary nerves to the eyeball. Here they supply motor fibers to the ciliaris muscle and the sphincter pupillae muscle. So far as known, there are no sympathetic afferent fibers connected with the nerve. The sympathetic efferent fibers of the facial nerve are supposed to arise from the small cells of the facial nucleus. According to some authors, the fibers to the salivary glands arise from a special nucleus, the superior salivatory nucleus, consisting of cells scattered in a reticular formation, dorsomedial to the facial nucleus. These preganglionic fibers are distributed partly through the chorda tympani and lingual nerves to the submaxillary ganglion, where they terminate about the cell bodies of neurons whose axons as postganglionic fibers conduct secretory and vasodilatory impulses to the submaxillary and sublingual glands. Other preganglionic fibers of the facial nerve pass via the great superficial petrosal nerve to the sphenopalatine ganglion, where they form synapses with neurons whose postganglionic fibers are distributed with the superior maxillary nerve as vasodilator and secretory fibers to the mucous membranes of the nose, soft palate, tongues, uveal, roof of the mouth, upper lips and gums, parotid, and orbital glands. There are supposed to be a few sympathetic afferent fibers connected with the facial nerve, whose cell bodies lie in the geniculate ganglion. but very little is known about them. The sympathetic afferent fibers of the glossopharyngeal nerve are supposed to arise either in the dorsal nucleus, nucleus ala cinerea, or in a distinct nucleus, the inferior salivatory nucleus situated near the dorsal nucleus. These preganglionic fibers pass into the tympanic branch of the glossopharyngeal and then with the small superficial petrosal nerve to the otic ganglion. Postganglionic fibers, vasodilator, and secretory fibers are distributed to the parotid gland, to the mucous membrane and its glands on the tongue, the floor of the mouth, and the lower gums. Sympathetic afferent fibers, whose cells of origin lie in the superior or inferior ganglion of the trunk, are supposed to terminate in the dorsal nucleus. Very little is known of the peripheral distribution of these fibers. The sympathetic efferent fibers of the vagus nerve are supposed to arise in the dorsal nucleus, nucleus ala cinerea. These preganglionic fibers are all supposed to end in sympathetic ganglia situated in or near the organs supplied by the vagus sympathetics. The inhibitory fibers to the heart probably terminate in the small ganglia of the heart wall, especially the atrium, from which inhibitory postganglionic fibers are distributed to the musculature. The preganglionic motor fibers to the esophagus, the stomach, the small intestine, and the greater part of the large intestine are supposed to terminate in the plexuses of Auerbach, from which postganglionic fibers are distributed to the smooth muscles of these organs. Other fibers pass to the smooth muscles of the bronchial tree and to the gallbladder and its ducts. In addition, the vagus is believed to contain secretory fibers to the stomach and pancreas. It probably contains many other efferent fibers than those enumerated above. Sympathetic afferent fibers of the vagus, whose cells of origin lie in the jugular ganglion or the ganglion nodosum, probably terminate in the dorsal nucleus of the medulla oblongata, or according to some authors, in the nucleus of the tractus solitarius. Peripherally, the fibers are supposed to be distributed to the various organs supplied by the sympathetic efferent nerves. The sacral sympathetics. The sacral sympathetic efferent fibers leave the spinal cord with the anterior roots of the second, third, and fourth sacral nerves. These small medullated preganglionic fibers are collected together in the pelvis into the nervus erigentes, or pelvic nerve, which proceeds to the hypogastric or pelvic plexuses, from which postganglionic fibers are distributed to the pelvic viscera. Motor fibers pass to the smooth muscle of the descending colon, rectum, anus, and bladder. Vasodilators are distributed to these organs and to the external genitalia, while inhibitory fibers probably pass to the smooth muscles of the external genitalia. Afferent sympathetic fibers conduct impulses from the pelvic viscera to the second, third, and fourth sacral nerves. Their cells of origin lie in the spinal ganglia. The thoracolumbar sympathetics. The thoracolumbar sympathetic fibers arise from the dorsolateral region of the anterior column of the gray matter of the spinal cord and pass with the anterior roots of all the thoracic and upper 2 or 3 lumbar spinal nerves. These preganglionic fibers enter the white rami communicantes and proceed to the sympathetic trunk, where many of them end in its ganglia. Others pass to the prevertebral plexuses and terminate in its collateral ganglia. The postganglionic fibers have a wide distribution. The vasoconstrictor fibers to the blood vessels of the skin of the trunk and limbs, for example, leave the spinal cord as preganglionic fibers in all the thoracic and upper 2 or 3 lumbar spinal nerves and terminate in the ganglia of the sympathetic trunk, either in the ganglion directly connected with its ramus or in neighboring ganglia. Postganglionic fibers arise in these ganglia, pass through the gray rami communicantes to all the spinal nerves, and are distributed with their cutaneous branches, ultimately leaving these branches to join the small arteries. The postganglionic fibers do not necessarily return to the same spinal nerves which contain the corresponding preganglionic fibers. The vasoconstrictor fibers to the head come from the upper thoracic nerves. The preganglionic fibers end in the superior cervical ganglion. The postganglionic fibers pass through the internal carotid nerve and branch from it to join the sensory branches of the various cranial nerves, especially the trigeminal nerve. Other fibers to the deep structures and the salivary glands probably accompany the arteries. The postganglionic vasoconstrictor fibers to the blood vessels of the abdominal viscera arise in the prevertebral or collateral ganglion, in which terminate many preganglionic fibers. Vasoconstrictor fibers to the pelvic viscera arise from the inferior mesenteric ganglia. The pilomotor fibers to the hairs and the motor fibers to the sweat glands apparently have a distribution similar to that of the vasoconstrictors of the skin. A vasoconstrictor center has been located by the physiologist in the neighborhood of the facial nucleus. Axons from its cells are supposed to descend in the spinal cord to terminate about cell bodies of the preganglionic fibers located in the dorsolateral portion of the anterior column of the thoracic and upper lumbar region. The motor supply to the dilator pupillae muscle of the eye comes from preganglionic sympathetic fibers, which leave the spinal cord with the anterior roots of the upper thoracic nerves. These fibers pass to the sympathetic trunk through the white rami communicantes and terminate in the superior cervical ganglion. Postganglionic fibers from the superior cervical ganglion pass through the internal carotid nerve and into the ophthalmic division of the trigeminal nerve to the orbit, where the long ciliary nerves conduct the impulses to the eyeball and dilator pupillae muscle. The cell bodies of these preganglionic fibers are connected with fibers which descend from the midbrain. Other postganglionic fibers from the superior cervical ganglion are distributed as secretory fibers to the salivary glands, the lacrimal glands, and to the small glands of the mucous membranes of the nose, mouth, and pharynx. The thoracic sympathetic supply accelerated nerves to the heart. They are supposed to emerge from the spinal cord in the anterior roots of the upper 4 or 5 thoracic nerves and pass with the white rami to the first thoracic ganglion. Here some terminate, others pass in the ansa subclavia to the inferior cervical ganglion. The postganglionic fibers pass from these ganglia partly through the ansa subclavia to the heart. On their way, they intermingle with sympathetic fibers from the vagus to form the cardiac plexus. Inhibitory fibers to the smooth musculature of the stomach, the small intestine, and most of the large intestine are supposed to emerge in the anterior roots of the lower thoracic and upper lumbar nerves. These fibers pass through the white rami and sympathetic trunk and are conveyed by the splanchnic nerves to the prevertebral plexus, where they terminate in the collateral ganglia. From the celiac and superior mesenteric ganglia, postganglionic fibers, inhibitory, are distributed to the stomach, the small intestine, and most of the large intestine. Inhibitory fibers to the descending colon, the rectum, and the internal sphincter ani are probably postganglionic fibers from the inferior mesenteric ganglion. The thoracolumbar sympathetics are characterized by the presence of numerous ganglia, which may be divided into two groups, central and collateral. The central ganglia are arranged in two vertical rows, one on either side of the midline, situated partly in front and partly at the sides of the vertebral column. Each ganglion is joined by intervening nervous cords to adjacent ganglia, so that two chains, the sympathetic trunks, are formed. The collateral ganglia are found in connection with the three great prevertebral plexuses placed within the thorax, abdomen, and pelvis, respectively. The sympathetic trunks, truncus sympatheticus, gangliated cord, extend from the base of the skull to the coccyx. The cephalic end of each is continued upward through the carotid canal into the skull and forms a plexus on the internal carotid artery. The caudal ends of the trunk converge and end in a single ganglion, the ganglion impar, placed in front of the coccyx. The ganglia of each trunk are distinguished as cervical, thoracic, lumbar, and sacral, and, except in the neck, they are closely correspond in number to the vertebrae. They are arranged thus: cervical portion, 3 ganglia; thoracic portion, 12 ganglia; lumbar portion, 4 ganglia; sacral portion, 4 or 5 ganglia. In the neck, the ganglia lie in front of the transverse processes of the vertebrae; in the thoracic region, in front of the heads of the ribs; in the lumbar region, on the sides of the vertebral bodies; and in the sacral region, in front of the sacrum. Connection with the spinal nerves. Communications are established between the sympathetic and spinal nerves through what are known as gray and white rami communicantes. The gray rami convey sympathetic fibers to the spinal nerves, and the white rami transmit spinal fibers to the sympathetic. Each spinal nerve receives a gray ramus communicans from the sympathetic trunk, but white rami are not supplied by all the spinal nerves. White rami are derived from the first thoracic to the first lumbar nerves inclusive, while the visceral branches which run from the second, third, and fourth sacral nerves directly to the pelvic plexus of the sympathetic belong to this category. The fibers which reach the sympathetic through the white rami communicantes are medullated. Those which spring from the cells of the sympathetic ganglia are almost entirely non-medullated. The sympathetic nerves consist of efferent and afferent fibers, the origin and course of which are described subsequently. The three great gangliated plexuses, collateral ganglia, are situated in front of the vertebral column in the thoracic, abdominal, and pelvic regions, and are named respectively the cardiac, the solar or epigastric, and the hypogastric plexuses. They consist of collection of nerves and ganglia, the nerve being derived from the sympathetic trunks and from the cerebrospinal nerves. They distribute branches to the viscera. Development. The ganglion cells of the sympathetic system are derived from the cells of the neural crests. As these crests move forward along the sides of the neural tube and become segmented off to form the spinal ganglia, certain cells detach themselves from the ventral margins of the crests and migrate towards the sides of the aorta. Some of them are grouped to form the ganglia of the sympathetic trunks, while others undergo a further migration and form the ganglia of the prevertebral and visceral plexuses. The ciliary, sphenopalatine, otic, and submaxillary ganglia, which are found on the branches of the trigeminal nerve, are formed by groups of cells which have migrated from part of the neural crest, which gives rise to the semilunar ganglion. Some of the cells of the ciliary ganglion are said to migrate from the neural tube along the oculomotor nerve. End of section 43. Section 44 of Gray's Anatomy Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording from M.L. Cohen, Anatomy of the Human Body Part 4 by Henry Gray, the cephalic and cervical portions of the sympathetic system. The cephalic portion of the sympathetic system. Pars cephalica, S. sympathesi. The cephalic portion of the sympathetic system begins as the internal carotid nerve, which appears to be a direct prolongation of the superior cervical ganglion. It is soft in texture and of a reddish color. It ascends by the side of the internal carotid artery, and entering the carotid canal in the temporal bone, divides into two branches, which lie one on the lateral and the other on the medial side of that vessel. The lateral branch, the larger of the two, distributes filaments to the internal carotid artery and forms the internal carotid plexus. The medial branch also distributes filaments to the internal carotid artery and, continuing onward, forms the cavernous plexus. The internal carotid plexus, plexus caroticus interneus, carotid plexus, is situated on the lateral side of the internal carotid artery, and in the plexus there occasionally exists a small ganglioniform swelling, the carotid ganglion, on the undersurface of the artery. The internal carotid plexus communicates with the semilunar ganglion, the abducent nerve, and the sphenopontine ganglion. It distributes filaments to the wall of the carotid artery and also communicates with the tympanic branch of the glossopharyngeal nerve. The communicating branches with the abducent nerve consist of one or two filaments which join that nerve as it lies upon the lateral side of the internal carotid artery. The communication with the sphenopalatine ganglion is effected by a branch, the deep petrosal, given off from the plexus on the lateral side of the artery. This branch passes through the cartilage, filling up the foramen lacerum, and joins the gradal superficial petrosal to form the nerve of the pterygoid canal, Vidian nerve, which passes through the pterygoid canal to the sphenopontine ganglion. Communication with the tympanic branch of the glossopharyngeal nerve is effected by the corticotympanic, which may consist of 2 or 3 delicate filaments. The cavernous plexus, plexus cavernosus, is situated below and medial to that part of the internal carotid artery which is placed by the side of the sella turcica in the cavernous sinus, and is formed chiefly by the medial division of the internal carotid nerve. It communicates with the oculomotor, the trochlear, the ophthalmic, and the abducent nerves, and with the ciliary ganglion, and distributes filaments to the wall of the internal carotid artery. The branch of communication with the oculomotor nerve joins that nerve at its point of division. The branch to the trochlear nerve joins it as it lies on the lateral wall of the cavernous sinus. Other filaments are connected with the undersurface of the ophthalmic nerve, and the second filament joins the abducent nerve. The filaments of connection with the ciliary ganglion arise from the anterior part of the cavernous plexus and enter the orbit through the superior orbital fissure. They may join the nasociliary branch of the ophthalmic nerve or be continued forward as a separate branch. The terminal filaments from the internal carotid and cavernous plexuses are prolonged as plexuses around the anterior and middle cerebral arteries and the ophthalmic artery. Along the formal vessels, they may be traced to the pia mater. Along the latter, into the orbit, where they accompany each of the branches of the vessel. The filaments prolonged on to the anterior communicating artery connect the sympathetic nerves of the right and left sides. The cervical portion of the sympathetic system. Pars cervicalis, S. sympathesi. The cervical portion of the sympathetic trunk consists of 3 ganglia, distinguished according to positions as the superior, middle, and inferior ganglia, connected by intervening cords. This portion receives no white rami communicantes from the cervical spinal nerves. Its spinal fibers are derived from the white rami of the upper thoracic nerves and enter the corresponding thoracic ganglia of the sympathetic trunk, through which they ascend into the neck. The superior cervical ganglion, ganglion cervicalis superioris, the largest of the 3, is placed opposite the second and third cervical vertebrae. It is of reddish-gray color and usually fusiform in shape, sometimes broad and flattened, and occasionally constricted at intervals. It is believed to be formed by the coalescence of 4 ganglia, corresponding to the upper 4 cervical nerves. It is in relation in front with the sheath of the internal carotid artery and internal jugular vein, behind with the longest capitis muscle. Its branches may be divided into inferior, lateral, medial, and anterior. The inferior branch communicates with the middle cervical ganglion. The lateral branches, external branches, consist of gray rami communicantes to the upper 4 cervical nerves and to certain of the cranial nerves. Sometimes the branch to the 4th cervical nerve may come from the trunk connecting the upper and middle cervical ganglia. The branches to the cranial nerves consist of delicate filaments which run to the ganglion nodosum of the vagus and to the hypoglossal nerve. A filament, the jugular nerve, passes upward to the base of the skull and divides to join the petrous ganglion of the glossopharyngeal and the jugular ganglion of the vagus. The medial branches, internal branches, are peripheral and are the laryngopharyngeal branches and the superior cardiac nerve. The laryngopharyngeal branches, rami laryngopharyngii, pass to the sides of the pharynx, where they join with branches from the glossopharyngeal vagus and external laryngeal nerves to form the pharyngeal plexus. The superior cardiac nerve, nervus cardiacus superior, arises by 2 or more branches from the superior cervical ganglion and occasionally receives a filament from the trunk between the 1st and 2nd cervical ganglia. It runs down the neck behind the common carotid artery and in front of the longus colli muscle, and crosses in front of the inferior thyroid artery and recurrent nerve. The course of the nerves on the 2 sides then differ. The right nerve, at the root of the neck, passes either in front of or behind the subclavian artery, and along the innominate artery to the back of the arch of the aorta, where it joins the deep part of the cardiac plexus. It is connected with other branches of the sympathetic. About the middle of the neck, it receives filaments from the external laryngeal nerve, lower down, 1 or 2 twigs from the vagus, and as it enters the thoracic, it is joined by a filament from the recurrent nerve. Filaments from the nerve communicate with the thyroid branches from the middle cervical ganglion. The left nerve, in the thorax, runs in front of the left common carotid artery and across the left side of the arch of the aorta to the superficial part of the cardiac plexus. The anterior branches, nervus carotici externi, ramify upon the common carotid artery and upon the external carotid artery and its branches, forming around each a delicate plexus, on the nerves composing which small ganglia are occasionally found. The plexuses accompanying some of these arteries have important communications with other nerves. That surrounding the external maxillary artery communicates with the submaxillary ganglion by a filament, and that accompanying the middle meningeal artery sends an offset to the otic ganglia, and a second, the external petrosal nerve, to the genicular ganglion of the facial nerve. The middle cervical ganglion, ganglion cervicali medium, is the smallest of the 3 cervical ganglia, and is occasionally wanting. It is placed opposite the 6th cervical vertebrae, usually in front of or close to the inferior thyroid artery. It is probably formed by the coalescence of 2 ganglia corresponding to the 5th and 6th cervical nerves. It sends gray rami communicantes to the 5th and 6th cervical nerves and gives off the middle cardiac nerve. The middle cardiac nerve, nerve cardiacus medius, great cardiac nerve, is the largest of the 3 cardiac nerves, arises from the middle cervical ganglion or from the trunk between the middle and inferior ganglia. On the right side, it descends behind the common carotid artery and at the root of the neck runs either in front of or behind the subclavian artery. It then descends on the trachea, receives a few filaments from the recurrent nerve, and joins the right half of the deep part of the cardiac plexus. In the neck, it communicates with the superior cardiac and recurrent nerves. On the left side, the middle cardiac nerve enters the chest between the left carotid and subclavian arteries and joins the left half of the deep part of the cardiac plexus. The inferior cervical ganglion, ganglion cervicalis inferius, is situated between the base of the transverse process of the last cervical vertebra and the neck of the first rib on the medial side of the costocervical artery. Its form is irregular. It is larger in size than the preceding and is frequently fused with the first thoracic ganglion. It is probably formed by the coalescence of two ganglia, which correspond to the 7th and 8th cervical nerves. It is connected to the middle cervical ganglion by two or more cords, one of which forms a loop around the subclavian artery and supplies offsets to it. This loop is named ansa subclavia, via sene. The ganglion sends gray rami communicantes to the 7th and 8th cervical nerves. It gives off the inferior cardiac nerve and offsets to blood vessels. The inferior cardiac nerve, nervus cardiacus inferior, arise from either the inferior cervical or the first thoracic ganglion. It descends behind the subclavian artery and along the front of the trachea to join the deep part of the cardiac plexus. It communicates freely behind the subclavian artery with the recurrent nerve and the middle cardiac nerve. The offsets to blood vessels form plexuses on the subclavian artery and its branches. The plexus on the vertebral artery is continued on to the basilar, posterior cerebral, and cerebellar arteries. The plexus on the inferior thyroid artery accompanies the artery to the thyroid gland and communicates with the recurrent and external laryngeal nerves, with the superior cardiac nerve, and with the plexus on the common carotid artery. End of section 44.
Section 45 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by David Lawrence. Anatomy of the Human Body, Part 4, by Henry Gray. 7c. The thoracic portion of the sympathetic system. Pars thoracalis est sympathesi. The thoracic portion of the sympathetic trunk consists of a series of ganglia, which usually correspond in number to that of the vertebrae, but, on account of the occasional coalescence of two ganglia, their number is uncertain. The thoracic ganglia rest against the heads of the ribs, and are covered by the costal pleura. The last two, however, are more anterior than the rest, and are placed on the sides of the bodies of the 11th and 12th thoracic vertebrae. The ganglia are small in size and of a grayish color. The first, larger than the others, is of an elongated form, and frequently blended with the inferior cervical ganglion. They are connected together by the intervening portions of the trunk. Two rami communicantes, a white and a gray, connect each ganglia with its corresponding spinal nerve. The branches from the upper 5 ganglia are very small. They supply filaments to the thoracic artery and its branches. Twigs from the 2nd, 3rd, and 4th ganglia enter the posterior pulmonary plexus. The branches from the lower 7 ganglia are large and white in color. They distribute filaments to the aorta and unite to form the greater, the lesser, and the lowest splanchnic nerves. The greater splanchnic nerve, N. splanchnicus major, great splanchnic nerve, is white in color, firm in texture, and of a considerable size. It is formed by branches from the 5th to the 9th or 10th thoracic ganglia, but the fibers in the higher roots may be traced upward in the sympathetic trunk as far as the 1st or 2nd thoracic ganglion. It descends obliquely on the bodies of the vertebrae, perforates the crust of the diaphragm, and ends in the celiac ganglion. A ganglion, ganglion splanchnicum, exists on this nerve opposite the 11th or 12th thoracic vertebra. The lesser splanchnic nerve, N. splanchnicus minor, is formed by filaments from the 9th and 10th, and sometimes the 11th thoracic ganglia, and from the cord between them. It pierces the diaphragm with the preceding nerve and joins the aorticorenal ganglion. The lower splanchnic nerve, splanchnicus imus, least splanchnic nerve, arises from the last thoracic ganglion, and, piercing the diaphragm, ends in the renal plexus. A striking analogy exists between the splanchnic and the cardiac nerves. The cardiac nerves are 3 in number. They arise from all 3 cervical ganglia, and are distributed to a large and important organ in the thoracic cavity. The splanchnic nerves, also 3 in number, are connected probably with all the thoracic ganglia, and are distributed to important organs in the abdominal cavity. 7d. The abdominal portion of the sympathetic system. Pars abdominalis est sympathesi, lumbar portion of ganglionated cord. The abdominal portion of the sympathetic trunk is situated in front of the vertebral column, along the medial margin of the psoas major. It consists usually of 4 lumbar ganglia, connected together by interganglionic cords. It is continuous above with the thoracic portion beneath the medial lumbocostal arch, and below with the pelvic portion behind the common iliac artery. The ganglia are of small size and placed much nearer the median line than are the thoracic ganglia. Gray rami communicantes pass from all the ganglia to the lumbar spinal nerves. The first and second, and sometimes the third, lumbar nerves send white rami communicantes to the corresponding ganglia. The rami communicantes are of considerable length and accompany the lumbar arteries around the sides of the bodies of the vertebrae, passing beneath the fibrous arches from which some of the fibers of the psoas major arise. Of the branches of distribution, some pass in front of the aorta and join the aortic plexus. Others descend in front of the common iliac arteries and assist in forming the hypogastric plexus. 7e. The pelvic portion of the sympathetic system. Pars pelvina est sympathesi. The pelvic portion of each sympathetic trunk is situated in front of the sacrum, medial to the anterior sacral foramina. It consists of 4 or 5 small sacral ganglia, connected together by interganglionic cords, and continuous above with the abdominal portion. Below, the 2 pelvic sympathetic trunks converge, and end on the front of the coccyx, in a small ganglion, the ganglion impar. Gray rami communicantes pass from the ganglia to the sacral and the coccygeal nerves. No white rami communicantes are given to this part of the ganglionated cord, but the visceral branches which arise from the 3rd and 4th, and sometimes from the 2nd, sacral, and run directly to the pelvic plexuses, are regarded as the white rami communicantes. The branches of distribution communicate on the front of the sacrum with the corresponding branches from the opposite side. Some, from the first 2 ganglia, pass to join the pelvic plexus, and others form a plexus which accompanies the middle sacral artery and sends filaments to the glomus coccygeum, coccygeal body. End of section 45. Recording by David Lawrence, October 2009, in Brampton, Ontario.
Section 46 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by Bologna Times. Anatomy of the Human Body, Part 4, by Henry Gray. The Great Plexuses of the Sympathetic System. The great plexuses of the sympathetic are aggregations of nerves and ganglia, situated in the thoracic, abdominal, and pelvic cavities, and named the cardiac, celiac, and hypogastric plexuses. They consist not only of sympathetic fibers derived from the ganglia, but of fibers from the medulla spinalis, which are conveyed through the white rami communicantes. From the plexuses branches are given to the thoracic, abdominal, and pelvic viscera. The cardiac plexus (Plexus cardiacus). The cardiac plexus is situated at the base of the heart, and is divided into a superficial part which lies in the concavity of the aortic arch, and a deep part between the aortic arch and the trachea. The two parts are, however, closely connected. The superficial part of the cardiac plexus lies beneath the arch of the aorta, in front of the right pulmonary artery. It is formed by the superior cardiac branch of the left sympathetic and the lower superior cervical cardiac branch of the left vagus. A small ganglion, the cardiac ganglion of Risberg, is occasionally found connected with these nerves at their point of junction. This ganglion, when present, is situated immediately beneath the arch of the aorta, on the right side of the ligamentum arteriosum. The superficial part of the cardiac plexus gives branches A to the deep part of the plexus, B to the anterior coronary plexus, and C to the left anterior pulmonary plexus. The deep part of the cardiac plexus is situated in front of the bifurcation of the trachea, above the point of division of the pulmonary artery, and behind the aortic arch. It is formed by the cardiac nerves derived from the cervical ganglia of the sympathetic and the cardiac branches of the vagus and recurrent nerves. The only cardiac nerves which do not enter into the formation of the deep part of the cardiac plexus are the superior cardiac nerve of the left sympathetic and the lower of the two superior cervical cardiac branches from the left vagus, which pass to the superficial part of the plexus. The branches from the right half of the deep part of the cardiac plexus pass, some in front of and others behind, the right pulmonary artery. The former, the more numerous, transmit a few filaments to the anterior pulmonary plexus, and are then continued onward to form part of the anterior coronary plexus. Those behind the pulmonary artery distribute a few filaments to the right atrium, and are then continued onward to form part of the posterior coronary plexus. The left half of the deep part of the plexus is connected with the superficial part of the cardiac plexus, and gives filaments to the left atrium, and to the anterior pulmonary plexus, and is then continued to form the greater part of the posterior coronary plexus. The posterior coronary plexus (Plexus coronarius posterior, left coronary plexus) is larger than the anterior, and accompanies the left coronary artery. It is chiefly formed by filaments prolonged from the left half of the deep part of the cardiac plexus, and by a few from the right half. It gives branches to the left atrium and ventricle. The anterior coronary plexus (Plexus coronarius anterior, right coronary plexus) is formed partly from the superficial and partly from the deep parts of the cardiac plexus. It accompanies the right coronary artery, and gives branches to the right atrium and ventricle. The celiac plexus (Plexus coeliacus, solar plexus). The celiac plexus, the largest of the three sympathetic plexuses, is situated at the level of the upper part of the first lumbar vertebra, and is composed of two large ganglia, the celiac ganglia, and a dense network of nerve fibers uniting them together. It surrounds the celiac artery and the root of the superior mesenteric artery. It lies behind the stomach and the omental bursa, in front of the crura of the diaphragm and the commencement of the abdominal aorta, and between the suprarenal glands. The plexus and the ganglia receive the greater and lesser splanchnic nerves of both sides, and some filaments from the right vagus, and give off numerous secondary plexuses along the neighboring arteries. The celiac ganglia, ganglia celiaca, semilunar ganglia, are two large, irregularly shaped masses having the appearance of lymph glands and placed one on either side of the middle line in front of the crura of the diaphragm, close to the suprarenal glands, that on the right side being placed behind the inferior vena cava. The upper part of each ganglion is joined by the greater splanchic nerve, while the lower part, which is segmented off and named the aortic-carinal ganglion, receives the lesser splanchnic nerve and gives off the greater part of the renal plexus. The secondary plexuses springing from or connected with the celiac plexus are the phrenic, renal, hepatic, spermatic, lenal, superior mesenteric, superior gastric, abdominal aortic, suprarenal, inferior mesenteric. The phrenic plexus, plexus phrenicus, accompanies the inferior phrenic artery to the diaphragm, some filaments passing to the suprarenal gland. It arises from the upper part of the celiac ganglion and is larger on the right than on the left side. It receives one or two branches from the phrenic nerve. At the point of junction of the right phrenic plexus with the phrenic nerve is a small ganglion, ganglion phrenicum. This plexus distributes branches to the inferior vena cava and to the suprarenal and hepatic plexuses. The hepatic plexus, plexus hepaticus, the largest offset from the celiac plexus, receives filaments from the left vagus and right phrenic nerves. It accompanies the hepatic artery, ramifying upon its branches and upon those of the portal vein in the substance of the liver. Branches from this plexus accompany all the divisions of the hepatic artery. A considerable plexus accompanies the gastroduodenal artery and is continued as the inferior gastric plexus on the right gastroepiploic artery along the greater curvature of the stomach, where it unites with offshoots from the lenal plexus. The lenal plexus, plexus lenalis, splenic plexus, is formed by branches from the celiac plexus, the left celiac ganglion, and from the right vagus nerve. It accompanies the lenal artery to the spleen, giving off, in its course, subsidiary plexuses along the various branches of the artery. The superior gastric plexus, plexus gastricus superior, gastric or coronary plexus, accompanies the left gastric artery along the lesser curvature of the stomach and joins with branches from the left vagus. The suprarenal plexus, plexus suprarenalis, is formed by branches from the celiac plexus, from the celiac ganglion, and from the phrenic and greater splanchic nerves, a ganglion being formed at the point of junction with the latter nerve. The plexus supplies the suprarenal gland, being distributed chiefly to its medullary portion. Its branches are remarkable for their large size in comparison with that of the organ they supply. The renal plexus, plexus renalis, is formed by filaments from the celiac plexus, the aortic-carinal ganglion, and the aortic plexus. It is joined also by the smallest splanchic nerve. The nerves from these sources, 15 or 20 in number, have a few ganglia developed upon them. They accompany the branches of the renal artery into the kidney. Some filaments are distributed to the spermatic plexus and, on the right side, to the inferior vena cava. The spermatic plexus, plexus spermaticus, is derived from the renal plexus, receiving branches from the aortic plexus. It accompanies the internal spermatic artery to the testes. In the female, the ovarian plexus, plexus arteriae ovaricae, arises from the renal plexus and is distributed to the ovary and fundus of the uterus. The superior mesenteric plexus, plexus mesentericus superior, is a continuation of the lower part of the celiac plexus, receiving a branch from the junction of the right vagus nerve with the plexus. It surrounds the superior mesenteric artery, accompanies it into the mesentery, and divides into a number of secondary plexuses, which are distributed to all parts supplied by the artery, viz., pancreatic branches to the pancreas, intestinal branches to the small intestine, and ileocolic, right colic, and middle colic branches, which supply the corresponding parts of the great intestine. The nerves composing this plexus are white in color and firm in texture. In the upper part of the plexus, close to the origin of the superior mesenteric artery, is a ganglion, ganglion mesentericum superius. The abdominal aortic plexus, plexus aorticus abdominalis, aortic plexus, is formed by branches derived on either side from the celiac plexus and ganglia, and receives filaments from some of the lumbar ganglia. It is situated upon the sides and front of the aorta, between the origins of the superior and inferior mesenteric arteries. From this plexus arise part of the spermatic, the inferior mesenteric, and the hypogastric plexuses. It also distributes filaments to the inferior vena cava. The inferior mesenteric plexus, plexus mesentericus inferior, is derived chiefly from the aortic plexus. It surrounds the inferior mesenteric artery and divides into a number of secondary plexuses which are distributed to all the parts supplied by the artery, viz., the left colic and sigmoid plexuses, which supply the descending and sigmoid parts of the colon, and the superior hemorrhoidal plexus, which supplies the rectum and joins in the pelvis with branches from the pelvic plexuses. The hypogastric plexus, plexus hypogastricus. The hypogastric plexus is situated in front of the last lumbar vertebra and the promontory of the sacrum, between the two common iliac arteries, and is formed by the union of numerous filaments which descend on either side from the aortic plexus and from the lumbar ganglia. It divides below into two lateral portions, which are named the pelvic plexuses. The pelvic plexuses. The pelvic plexuses supply the viscera of the pelvic cavity and are situated at the sides of the rectum in the male and at the sides of the rectum and vagina in the female. They are formed on either side by a continuation of the hypogastric plexus, by the sacral sympathetic efferent fibers from the second, third, and fourth sacral nerves, and by a few filaments from the first two sacral ganglia. At the points of junction of these nerves, small ganglia are found. From these plexuses numerous branches are distributed to the viscera of the pelvis. They accompany the branches of the hypogastric artery. The middle hemorrhoidal plexus, plexus hemorrhoidal medius, arises from the upper part of the pelvic plexus. It supplies the rectum and joins the branches of the superior hemorrhoidal plexus. The vesical plexus, plexus vesicalis, arises from the forepart of the pelvic plexus. The nerves composing it are numerous, and contain a large proportion of spinal nerve fibers. They accompany the vesical arteries, and are distributed to the sides and fundus of the bladder. Numerous filaments also pass to the vesiculae seminales and ductus deferens. Those accompanying the ductus deferens join on the spermatic cord with branches from the spermatic plexus. The prostatic plexus, plexus prostaticus, is continued from the lower part of the pelvic plexus. The nerves composing it are of large size. They are distributed to the prostate vesiculae and the corpora cavernosa of the penis and urethra. The nerves supplying the corpora cavernosa consist of two sets, the lesser and greater cavernous nerves, which arise from the forepart of the prostatic plexus and after joining with branches from the pudendal nerve, pass forward beneath the pubic arch. The lesser cavernous nerves, cavernosae penis minoris, small cavernous nerves, perforate the fibrous covering of the penis near its root. The greater cavernous nerve, cavernosus penis major, large cavernous plexus, passes forward along the dorsum of the penis, joins with the dorsal nerve of the penis, and is distributed to the corpora cavernosa. The vaginal plexus arises from the lower part of the pelvic plexus. It is distributed to the walls of the vagina, to the erectile tissue of the vestibule, and to the clitoris. The nerves composing this plexus contain, like the vesicle, a large proportion of spinal nerve fibers. The uterine plexus accompanies the uterine artery to the side of the uterus, between the layers of the broad ligament. It communicates with the ovarian plexus. End of section 46.
Section 47 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by David Lawrence. Anatomy of the Human Body, Part 4, by Henry Gray. The organs of the senses and the common integument. The organs of the senses may be divided into a. Those of the special senses of taste, smell, sight, and hearing, and b. Those associated with the general sensations of heat, cold, pain, pressure, etc. 1. The peripheral organs of the special senses. a. The organs of taste. Organon gustus. The peripheral gustatory or taste organs consist of certain modified epithelial cells arranged in flask-shaped groups termed gustatory caliculi, taste buds, which are found on the tongue and adjacent parts. They occupy nests in the stratified epithelium and are present in large numbers on the sides of the papillae velati, and to a less extent on their opposed walls. They are also found on the fungiform papillae over the back part and sides of the tongue, and in the general epithelial covering of the same areas. They are very plentiful over the fimbriae linguae, and are also present on the under surface of the soft palate, and on the posterior surface of the epiglottis. Structure. Each taste bud is flask-like in shape, its broad base resting on the corium, and its neck opening by an orifice, the gustatory pore, between the cells of the epithelium. The bud is formed by two kinds of cells, supporting cells and gustatory cells. The supporting cells are mostly arranged like the staves of a cask, and form an outer envelope for the bud. Some, however, are found in the interior of the bud between the gustatory cells. The gustatory cells occupy the central portion of the bud. They are spindle-shaped, and each possesses a large spherical nucleus near the middle of the cell. The peripheral end of the cell terminates at the gustatory pore in a fine hair-like filament, the gustatory hair. The central process passes toward the deep extremity of the bud, and there ends in single or bifurcated varicosities. The nerve fibrils, after losing their medullary sheaths, enter the taste bud and end in fine extremities between the gustatory cells. Other nerve fibrils ramify between the supporting cells and terminate in fine extremities. These, however, are believed to be the nerves of ordinary sensation and not gustatory. Nerves of taste. The chorda tympani nerve, derived from the sensory root of the facial, is the nerve of taste for the anterior 2/3 of the tongue. The nerve for the posterior third is the glossopharyngeal. End of section 47. Recording by David Lawrence in Brampton, Ontario, September 2009.
Section 48 of Gray's Anatomy, Part 4. This is a Librivox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Anatomy of the Human Body, Part 4, by Henry Gray. The organ of smell, organon olfactorius, the nose. The peripheral olfactory organ, or organ of smell, consists of two parts: an outer, the external nose, which projects from the center of the face, and an internal, the nasal cavity, which is divided by a septum into right and left nasal chambers. The external nose, nasus externus, outer nose. The external nose is pyramidal in form, and its upper angle or root is connected directly with the forehead. Its free angle is termed the apex. Its base is perforated by two elliptical orifices, the nares, separated from each other by an antero-posterior septum, the columna. The margins of the nares are provided with a number of stiff hairs, or vibrissae, which arrest the passage of foreign substances carried with the current of air intended for respiration. The lateral surfaces of the nose form, by their union in the middle line, the dorsum nasi, the direction of which varies considerably in different individuals. The upper part of the dorsum is supported by the nasal bones, and is named the bridge. The lateral surface ends below in a rounded eminence, the ala nasi. Structure. The framework of the external nose is composed of bones and cartilages. It is covered by the integument and lined by mucous membrane. The bony framework occupies the upper part of the organ. It consists of the nasal bones and the frontal processes of the maxillae. The cartilaginous framework, cartilaginous nasi, consists of 5 large pieces, namely the cartilage of the septum, the 2 lateral and the 2 greater alar cartilages, and several smaller pieces, the lesser alar cartilages. The various cartilages are connected to each other and to the bones by a tough fibrous membrane. The cartilage of the septum, cartilagio septi nasi, is somewhat quadrilateral in form, thicker at its margins than at its center, and completes the separation between the nasal cavities in front. Its anterior margin, thickest above, is connected with the nasal bones, and is continuous with the anterior margins of the lateral cartilages. Below it is connected to the medial crura of the greater alar cartilages by fibrous tissue. Its posterior margin is connected with the perpendicular plate of the ethmoid, its inferior margin with the vomer and the palatine processes of the maxillae. It may be prolonged backward, especially in children, as a narrow process, the sphenoidal process, for some distance between the vomer and the perpendicular plate of the ethmoid. The septal cartilage does not reach as far as the lowest part of the nasal septum. This is formed by the medial crura of the greater alar cartilages and by the skin. It is freely movable, and hence is termed the septum mobile nasi. The lateral cartilage, cartilagio nasi lateralis, upper lateral cartilage, is situated below the inferior margin of the nasal bone, and is flattened and triangular in shape. Its anterior margin is thicker than the posterior, and is continuous above with the cartilage of the septum, but separated from it below by a narrow fissure. Its superior margin is attached to the nasal bone and the frontal process of the maxilla. Its inferior margin is connected by fibrous tissue with the greater alar cartilage. The greater alar cartilage, cartilagio alaris major, lower lateral cartilage, is a thin, flexible plate, situated immediately below the preceding, and bent upon itself in such a manner as to form the medial and lateral walls of the nares of its own side. The portion which forms the medial wall, crus mediali, is loosely connected with the corresponding portion of the opposite cartilage, the two forming, together with the thickened integument and subadjacent tissue, the septum mobile nasi. The part which forms the lateral wall, crus laterali, is curved to correspond with the ala of the nose. It is oval and flattened, narrow behind, where it is connected with the frontal process of the maxilla by a tough fibrous membrane, in which are found 3 or 4 small cartilaginous plates, the lesser alar cartilages, cartilaginous alaris minoris, sesamoid cartilages. Above it is connected by fibrous tissue to the lateral cartilage and front part of the cartilage of the septum. Below it falls short of the margin of the nares, the ala being completed by fatty and fibrous tissue covered by skin. In front, the greater alar cartilages are separated by a notch, which corresponds with the apex of the nose. The muscles acting on the external nose have been described in the section on myology. The integument of the dorsum and sides of the nose is thin and loosely connected with the subadjacent parts, but over the tip and alae it is thicker and more firmly adherent, and is furnished with a larger number of sebaceous follicles, the orifices of which are usually very distinct. The arteries of the external nose are the alar and septal branches of the external maxillary, which supply the alae and septum, the dorsum and sides being supplied from the dorsal nasal branch of the ophthalmic and the infraorbital branch of the internal maxillary. The veins end in the anterior facial and ophthalmic veins. The nerves for the muscles of the nose are derived from the facial, while the skin receives branches from the infratrochlear and nasociliary branches of the ophthalmic and from the infraorbital of the maxillary. The nasal cavity, cavum nasi, nasal fossa. The nasal chambers are situated one on either side of the median plane. They open in front through the nares, and communicate behind through the choanae with the nasal part of the pharynx. The nares are somewhat pear-shaped apertures, each measuring about 2.5 centimeters antero-posteriorly and 1.25 centimeters transversely at its widest part. The choanae are two oval openings, each measuring 2.5 centimeters in the vertical and 1.25 centimeters in the transverse direction in a well-developed adult skull. For the description of the bony boundaries of the nasal cavity, see pages 194 and 195. Inside the aperture of the nostril is a slight dilation, the vestibule, bounded laterally by the ala and lateral crus of the greater alar cartilage, and medially by the medial crus of the same cartilage. It is lined by skin containing hairs and sebaceous glands, and extends as a small recess toward the apex of the nose. Each nasal cavity, above and behind the vestibule, is divided into two parts, an olfactory region consisting of the superior nasal concha and the opposed part of the septum, and a respiratory region which comprises the rest of the cavity. Lateral wall. On the lateral wall are the superior, middle, and inferior nasal conchae, and below and lateral to each concha is the corresponding nasal passage or meatus. Above the superior concha is a narrow recess, the sphenoethmoidal recess, into which the sphenoidal sinus opens. The superior meatus is a short oblique passage extending about halfway along the upper border of the middle concha. The posterior ethmoidal cells open into the front part of this meatus. The middle meatus is below and lateral to the middle concha, and is continued anteriorly into a shallow depression, situated above the vestibule and named the atrium of the middle meatus. On raising or removing the middle concha, the lateral wall of this meatus is fully displayed. On it is a rounded elevation, the bulla ethmoidalis, and below and in front of this a curved cleft, the hiatus semilinearis. The bulla ethmoidalis is caused by the bulging of the middle ethmoidal cells, which open on or immediately above it, and the size of the bulla varies with that of its contained cells. The hiatus semilinearis is bounded inferiorly by the sharp concave margin of the uncinate process of the ethmoid bone, and leads into a curved channel, the infundibulum, bounded above by the bulla ethmoidalis, and below by the lateral surface of the uncinate process of the ethmoid. The anterior ethmoidal cells open into the front part of the infundibulum, and this, in slightly over 50% of subjects, is directly continuous with the frontonasal duct or passage leading from the frontal air sinus. But when the anterior end of the uncinate process fuses with the front part of the bulla, this continuity is interrupted, and the frontonasal duct then opens directly into the anterior end of the middle meatus. Below the bulla ethmoidalis, and partly hidden by the inferior end of the uncinate process, is the ostium maxillaire, or opening from the maxillary sinus. In a frontal section, this opening is seen to be placed near the roof of the sinus. An accessory opening from the sinus is frequently present below the posterior end of the middle nasal concha. The inferior meatus is below and lateral to the inferior nasal concha. The nasolacrimal duct opens into this meatus under cover of the anterior part of the inferior concha. Medial wall. The medial wall or septum is frequently more or less deflected from the median plane, thus lessening the size of one nasal cavity and increasing that of the other. Ridges or spurs of bone growing into one or other cavity from the septum are also sometimes present. Immediately over the incisive canal at the lower edge of the cartilage of the septum, a depression, the nasopalatine recess, is seen. In the septum, close to this recess, a minute orifice may be discerned. It leads backward into a blind pouch, the rudimentary vomeronasal organ of Jacobson, which is supported by a strip of cartilage, the vomeronasal cartilage. This organ is well developed in many of the lower animals, where it apparently plays a part in the sense of smell, since it is supplied by twigs of the olfactory nerve and lined by epithelium similar to that in the olfactory region of the nose. The roof of the nasal cavity is narrow from side to side, except at its posterior part, and may be divided, from behind forward, into sphenoidal, ethmoidal, and frontonasal parts, after the bones which form it. The floor is concave from side to side, and almost horizontal antero-posteriorly. Its anterior 3/4 are formed by the palatine process of the maxilla, its posterior fourth by the horizontal process of the palatine bone. In its anteromedial part, directly over the incisive foramen, a small depression, the nasopalatine recess, is sometimes seen. It points downward and forward, and occupies the position of a canal which connected the nasal with the buccal cavity in early fetal life. The mucous membrane, membrana mucosa nasi. The nasal mucous membrane lines the nasal cavities, and is intimately adherent to the periosteum or perichondrium. It is continuous with the skin through the nares, and with the mucous membrane of the nasal part of the pharynx through the choanate. From the nasal cavity its continuity with the conjunctiva may be traced, through the nasolacrimal and lacrimal ducts, and with the frontal, ethmoidal, sphenoidal, and maxillary sinuses through the several openings in the meatuses. The mucous membrane is thickest and most vascular over the nasal conchae. It is also thick over the septum, but it is very thin in the meatuses on the floor of the nasal cavities and in the various sinuses. Owing to the thickness of the greater part of this membrane, the nasal cavities are much narrower, and the middle and inferior nasal conchae appear larger and more prominent than in the skeleton. Also the various apertures communicating with the meatuses are considerably narrowed. Structure of the mucous membrane. The epithelium covering the mucous membrane differs in its character according to the functions of the part of the nose in which it is found. In the respiratory region it is columnar and ciliated. Interspersed among the columnar cells are goblet or mucin cells, while between their bases are found similar pyramidal cells. Beneath the epithelium and its basement membrane is a fibrous layer infiltrated with lymph corpuscles, so as to form in many parts a diffuse adenoid tissue, and under this a nearly continuous layer of small and larger glands, some mucous and some serous, the ducts of which open upon the surface. In the olfactory region, the mucous membrane is yellowish in color, and the epithelial cells are columnar and non-ciliated. They are of two kinds, supporting cells and olfactory cells. The supporting cells contain oval nuclei, which are situated in the deeper parts of the cells and constitute the zone of oval nuclei. The superficial part of each cell is columnar and contains granules of yellow pigment, while its deep part is prolonged as a delicate process which ramifies and communicates with similar processes from neighboring cells, so as to form a network in the mucous membrane. Lying between the deep processes of the supporting cells are a number of bipolar nerve cells, the olfactory cells, each consisting of a small amount of granular protoplasm with a large spherical nucleus, and possessing two processes, a superficial one which runs between the columnar epithelial cells and projects on the surface of the mucous membrane as a fine hair-like process, the olfactory hair. The other or deep process runs inward, is frequently beaded, and is continued as the axon of an olfactory nerve fiber. Beneath the epithelium, and extending through the thickness of the mucous membrane, is a layer of tubular, often branched glands, the glands of Bowman, identical in structure with serous glands. The epithelial cells of the nose, fauces, and respiratory passages play an important part in the maintenance of an equable temperature by the moisture with which they keep the surface always slightly lubricated. Vessels and nerves. The arteries of the nasal cavities are the anterior and posterior ethmoidal branches of the ophthalmic, which supply the ethmoidal cells, frontal sinuses, and roof of the nose. The sphenopalatine branch of the inferior maxillary, which supplies the mucous membrane covering the conchae, the meatuses and septum. The septal branch of the superior labial of the external maxillary, the infraorbital and alveolar branches of the internal maxillary, which supply the lining membrane of the maxillary sinus, and the pharyngeal branch of the same artery, distributed to the sphenoidal sinus. The ramifications of these vessels form a close plexiform network beneath and in the substance of the mucous membrane. The veins form a close cavernous plexus beneath the mucous membrane. This plexus is especially well marked over the lower part of the septum and over the middle and inferior conchae. Some of the veins open into the sphenopalatine vein, others join the anterior facial vein, some accompany the ethmoidal arteries and end in the ophthalmic veins, and lastly, a few communicate with the veins on the orbital surface of the frontal lobe of the brain, through the foramina in the cribriform plate of the ethmoid bone. When the foramen cecum is patent, it transmits a vein to the superior sagittal sinus. The lymphatics have already been described, page 695. The nerves of ordinary sensation are the nasociliary branch of the ophthalmic, filaments from the anterior alveolar branch of the maxillary, the nerve of the pterygoid canal, the nasopalatine, the anterior palatine, and nasal branches of the sphenopalatine ganglion. The nasociliary branch of the ophthalmic distributes filaments to the forepart of the septum and lateral wall of the nasal cavity. Filaments from the anterior alveolar nerve supply the inferior meatus and inferior concha. The nerve of the pterygoid canal supplies the upper and back part of the septum and superior concha, and the upper nasal branches from the sphenopalatine ganglion have a similar distribution. The nasopalatine nerve supplies the middle of the septum. The anterior palatine nerve supplies the lower nasal branches to the middle and inferior conchae. The olfactory, the special nerve of the sense of smell, is distributed to the olfactory region. Its fibers arise from the bipolar olfactory cells and are destitute of medullary sheaths. They unite in fasciculi, which form a plexus beneath the mucous membrane and then ascend in grooves or canals in the ethmoid bone. They pass into the skull through the foramina in the cribriform plate of the ethmoid and enter the under surface of the olfactory bulb, in which they ramify and form synapses with the dendrites of the mitral cells. The accessory sinuses of the nose. Sinus paranasales. The accessory sinuses or air cells of the nose are the frontal, ethmoidal, sphenoidal, and maxillary. They vary in size and form in different individuals, and are lined by ciliated mucous membrane directly continuous with that of the nasal cavities. The frontal sinuses, sinus frontalis, situated behind the superciliary arches, are rarely symmetrical, and the septum between them frequently deviates to one or other side of the middle line. Their average measurements are as follows: height 3 cm, breadth 2.5 cm, depth from before backward 2.5 cm. Each opens into the anterior part of the corresponding middle meatus of the nose through the frontonasal duct, which traverses the anterior part of the labyrinth of the ethmoid. Absent at birth, they are generally fairly well developed between the 7th and 8th years, but only reach their full size after puberty. The ethmoidal air cells, cellulae ethmoidales, consist of numerous thin-walled cavities situated in the ethmoidal labyrinth and completed by the frontal, maxilla, lacrimal, sphenoidal, and palatine. They lie between the upper parts of the nasal cavities and the orbits, and are separated from these cavities by thin, bony laminae. On either side they are arranged in 3 groups, anterior, middle, and posterior. The anterior and middle groups open into the middle meatus of the nose, the former by way of the infundibulum, the latter on or above the bulla ethmoidalis. The posterior cells open into the superior meatus under cover of the superior nasal concha. Sometimes one or more opens into the sphenoidal sinus. The ethmoidal cells begin to develop during fetal life. The sphenoidal sinuses, sinus sphenoidalis, contained within the body of the sphenoid, vary in size and shape. Owing to the lateral displacement of the intervening septum, They are rarely symmetrical. The following are their average measurements: vertical height 2.2 centimeters, transverse breadth 2 centimeters, antero-posterior depth 2.2 centimeters. When exceptionally large, they may extend into the roots of the pterygoid processes or great wings and may invade the basilar part of the occipital bone. Each sinus communicates with the sphenoethmoidal recess by means of an aperture in the upper part of its anterior wall. They are present as minute cavities at birth, but their main development takes place after puberty. The maxillary sinus, sinus maxillaris, antrum of Highmore. The largest of the accessory sinuses of the nose is a pyramidal cavity in the body of the maxilla. Its base is formed by the lateral wall of the nasal cavity, and its apex extends into the zygomatic process. Its roof or orbital wall is frequently ridged by the infraorbital canal, while its floor is formed by the alveolar process, and is usually 1/2 to 10 millimeters below the level of the floor of the nose. Projecting into the floor are several conical elevations corresponding with the roots of the first and second molar teeth, and in some cases the floor is perforated by one or more of these roots. The size of the sinus varies in different skulls, and even on the two sides of the same skull. The adult capacity varies from 9.5 cubic centimeters to 20 cubic centimeters, average about 14.75 cubic centimeters. The following measurements are those of an average-sized sinus. Vertical height opposite the first molar tooth, 3.75 centimeters. Transverse breadth, 2.5 centimeters. Antero-posterior depth, 3 centimeters. In the antero-superior part of its base is an opening through which it communicates with the lower part of the hiatus semilunaris. A second orifice is frequently seen in or immediately behind the hiatus. The maxillary sinus appears as a shallow groove on the medial surface of the bone about the 4th month of fetal life, but does not reach its full size until after the second dentition. Footnote: the various measurements of the accessory sinuses of the nose are based on those given by Aldrin Turner in his accessory sinuses of the nose. End of footnote. At birth it measures about 7 millimeters in the dorso-ventral direction, and at 20 months about 20 millimeters. End of section 48.
Section 49 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Read by Laurie Anne Walden. Anatomy of the Human Body, Part 4, by Henry Gray. The Organ of Sight. Organon visus, the eye. The bulb of the eye, bulbus oculi, eyeball, or organ of sight, is contained in the cavity of the orbit, where it is protected from injury and moved by the ocular muscles. Associated with it are certain accessory structures. These are the muscles, fascia, eyebrows, eyelids, conjunctiva, and lacrimal apparatus. The bulb of the eye is embedded in the fat of the orbit, but is separated from it by a thin membranous sac, the fascia bulbi. It is composed of segments of 2 spheres of different sizes. The anterior segment is one of a small sphere. It is transparent and forms about 1/6 of the bulb. It is more prominent than the posterior segment, which is one of a larger sphere, and is opaque and forms about 5/6 of the bulb. The term anterior pole is applied to the central point of the anterior curvature of the bulb, and that of posterior pole to the central point of its posterior curvature. A line joining the 2 poles forms the optic axis. The axes of the 2 bulbs are nearly parallel, and therefore do not correspond to the axes of the orbits, which are directed forward and lateralward. The optic nerves follow the direction of the axes of the orbits, and are therefore not parallel. Each enters its eyeball 3 millimeters to the nasal side and a little below the level of the posterior pole. The bulb measures rather more in its transverse and antero-posterior diameters than in its vertical diameter, the former amounting to about 24 millimeters, the latter to about 23.5 millimeters. In the female, all 3 diameters are rather less than in the male. Its antero-posterior diameter at birth is about 17.5 millimeters, and at puberty from 20 to 21 millimeters. Development. The eyes begin to develop as a pair of diverticula from the lateral aspects of the forebrain. These diverticula make their appearance before the closure of the anterior end of the neural tube. After the closure of the tube they are known as the optic vesicles. They project toward the sides of the head, and the peripheral part of each expands to form a hollow bulb, while the proximal part remains narrow and constitutes the optic stalk. The ectoderm overlying the bulb becomes thickened, invaginated, and finally severed from the ectodermal covering of the head as a vesicle of cells, the lens vesicle, which constitutes the rudiment of the crystalline lens. The outer wall of the bulb becomes thickened and invaginated, and the bulb is thus converted into a cup, the optic cup, consisting of two strata of cells. These two strata are continuous with each other at the cup margin, which ultimately overlaps the front of the lens and reaches as far forward as the future aperture of the pupil. The invagination is not limited to the outer wall of the bulb, but involves also its postero-inferior surface and extends in the form of a groove for some distance along the optic stalk, so that, for a time, a gap or fissure, the choroidal fissure, exists in the lower part of the cup. Through the groove and fissure the mesoderm extends into the optic stalk and cup, and in this mesoderm a blood vessel is developed. During the 7th week the groove and fissure are closed, and the vessel forms the central artery of the retina. Sometimes the choroidal fissure persists, and when this occurs the choroid and iris in the region of the fissure remain undeveloped, giving rise to the condition known as coloboma of the choroid or iris. The retina is developed from the optic cup. The outer stratum of the cup persists as a single layer of cells which assume a columnar shape, acquire pigment, and form the pigmented layer of the retina. The pigment first appears in the cells near the edge of the cup. The cells of the inner stratum proliferate and form a layer of considerable thickness from which the nervous elements and the sustentacular fibers of the retina, together with a portion of the vitreous body, are developed. In that portion of the cup which overlaps the lens, the inner stratum is not differentiated into nervous elements, but forms a layer of columnar cells which is applied to the pigmented layer, and these two strata form the pars ciliaris and pars iridica retinae. The cells of the inner or retinal layer of the optic cup become differentiated into spongioblasts and germinal cells, and the latter, by their subdivisions, give rise to neuroblasts. From the spongioblasts, the sustentacular fibers of Müller, the outer and inner limiting membranes, together with the groundwork of the molecular layers of the retina, are formed. The neuroblasts become arranged to form the ganglionic and nuclear layers. The layer of rods and cones is first developed in the central part of the optic cup, and from there gradually extends toward the cup margin. All the layers of the retina are completed by the 8th month of fetal life. The optic stalk is converted into the optic nerve by the obliteration of its cavity and the growth of nerve fibers into it. Most of these fibers are centripetal and grow backward into the optic stalk from the nerve cells of the retina, but a few extend in the opposite direction and are derived from nerve cells in the brain. The fibers of the optic nerve receive their medullary sheaths about the 10th week after birth. The optic chiasma is formed by the meeting and partial decussation of the fibers of the two optic nerves. Behind the chiasma the fibers grow backward as the optic tracts to the thalami and midbrain. The crystalline lens is developed from the lens vesicle, which recedes within the margin of the cup and becomes separated from the overlying ectoderm by mesoderm. The cells forming the posterior wall of the vesicle lengthen and are converted into the lens fibers, which grow forward and fill up the cavity of the vesicle. The cells forming the anterior wall retain their cellular character and form the epithelium on the anterior surface of the adult lens. By the 2nd month the lens is invested by a vascular mesodermal capsule, the capsula vasculosa lentis. The blood vessels supplying the posterior part of this capsule are derived from the hyaloid artery; those for the anterior part from the anterior ciliary arteries. The portion of the capsule which covers the front of the lens is named the pupillary membrane. By the 6th month all the vessels of the capsule are atrophied except the hyaloid artery, which disappears during the 9th month. The position of this artery is indicated in the adult by the hyaloid canal, which reaches from the optic disc to the posterior surface of the lens. With the loss of its blood vessels, the capsula vasculosa lentis disappears, but sometimes the pupillary membrane persists at birth, giving rise to the condition termed congenital atresia of the pupil. The vitreous body is developed between the lens and the optic cup. The lens rudiment and the optic vesicles are at first in contact with each other, but after the closure of the lens vesicle and the formation of the optic cup, the former withdraws itself from the retinal layer of the cup. The two, however, remain connected by a network of delicate protoplasmic processes. This network, derived partly from the cells of the lens and partly from those of the retinal layer of the cup, constitutes the primitive vitreous body. At first these protoplasmic processes spring from the whole of the retinal layer of the cup, but later are limited to the ciliary region, where, by a process of condensation, they appear to form the zona ciliaris. The mesoderm, which enters the cup through the choroidal fissure and around the equator of the lens, becomes intimately united with this reticular tissue, and contributes to form the vitreous body, which is therefore derived partly from the ectoderm and partly from the mesoderm. The anterior chamber of the eye appears as a cleft in the mesoderm separating the lens from the overlying ectoderm. The layer of mesoderm in front of the cleft forms the substantia propria of the cornea, that behind the cleft the stroma of the iris and the pupillary membrane. The fibers of the ciliary muscle are derived from the mesoderm, but those of the sphincter and dilatator pupillae are of ectodermal origin, being developed from the cells of the pupillary part of the optic cup. The sclera and choroid are derived from the mesoderm surrounding the optic cup. The eyelids are formed as small cutaneous folds, which about the middle of the 3rd month come together and unite in front of the cornea. They remain united until about the end of the 6th month. The lacrimal sac and nasolacrimal duct result from a thickening of the ectoderm in the groove, naso-optic furrow, between the lateral nasal and maxillary processes. This thickening forms a solid cord of cells which sinks into the mesoderm. During the 3rd month the central cells of the cord break down, and a lumen, the nasolacrimal duct, is established. The lacrimal ducts arise as buds from the upper part of the cord of cells, and secondarily establish openings, puncta lacrimalia, on the margins of the lids. The epithelium of the cornea and conjunctiva, and that which lines the ducts and alveoli of the lacrimal gland, are of ectodermal origin, as are also the eyelashes and the lining cells of the glands which open on the lid margins. End of section 49.
Section 50 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. Tunics of the Eye, Part 1. From without inward, the 3 tunics are: 1. A fibrous tunic, consisting of the sclera behind and the cornea in front. 2. A vascular pigmented tunic, comprising, from behind forward, the choroid, ciliary body, and iris. And 3. A nervous tunic, the retina. The fibrous tunic, tunica fibrosa oculi. The sclera and cornea form the fibrous tunic of the bulb of the eye. The sclera is opaque, and constitutes the posterior 5/6 of the tunic. The cornea is transparent, and forms the anterior 1/6. The sclera. The sclera has received its name from its extreme density and hardness. It is a firm, unyielding membrane, serving to maintain the form of the bulb. It is much thicker behind than in front. The thickness of its posterior part is 1 mm. Its external surface is of white colour, and is in contact with the inner surface of the fascia of the bulb. It is quite smooth, except at the points where the recti and obliqui are inserted into it. Its anterior part is covered by the conjunctival membrane. Its inner surface is brown in colour and marked by grooves, in which the ciliary nerves and vessels are lodged. It is separated from the outer surface of the choroid by an extensive lymph space, spatium perichorioideal, which is traversed by an exceedingly fine cellular tissue, the lamina suprachoroidea. Behind it is pierced by the optic nerve, and is continuous through the fibrous sheath of this nerve with the dura mater. Where the optic nerve passes through the sclera, the latter forms a thin cribriform lamina, the lamina cribrosa sclerae. The minute orifices in this lamina serve for the transmission of the nervous filaments, and the fibrous septa dividing them from one another are continuous with the membranous processes which separate the bundles of nerve fibres. One of these openings, larger than the rest, occupies the centre of the lamina. It transmits the central artery and the vein of the retina. Around the entrance of the optic nerve are numerous small apertures for the transmission of the ciliary vessels and nerves, and about midway between this entrance and the sclerocorneal junction are 4 or 5 large apertures for the transmission of veins. Venae vorticosae. In front, the sclera is directly continuous with the cornea, the line of union being termed the sclerocorneal junction. In the inner part of the sclera close to this junction is a circular canal, the sinus venosus sclerae, canal of Schlemm. In a meridional section of this region, this sinus presents the appearance of a cleft, the outer wall of which consists of the firm tissue of the sclera, while its inner wall is formed by a triangular mass of trabecular tissue. The apex of the mass is directed forward, and is continuous with the posterior elastic lamina of the cornea. The sinus is lined by endothelium and communicates externally with the anterior ciliary veins. The aqueous humour drains into the scleral sinuses by passage through the pectinate villi, which are analogous in structure and function to the arachnoid villi of the cerebral meninges. Structure. The sclera is formed of white fibrous tissue intermixed with fine elastic fibres. Flattened connective tissue corpuscles, some of which are pigmented, are contained in cell spaces between the fibres. The fibres are aggregated into bundles, which are arranged chiefly in a longitudinal direction. Its vessels are not numerous, the capillaries being of small size, uniting at long and wide intervals. Its nerves are derived from the ciliary nerves, but their exact mode of ending is not known. The cornea. The cornea is the projecting, transparent part of the external tunic, and forms the anterior sixth of the surface of the bulb. It is almost circular in outline, occasionally a little broader in the transverse than in the vertical direction. It is convex anteriorly and projects like a dome in front of the sclera. Its degree of curvature varies in different individuals, and in the same individual at different periods of life, being more pronounced in youth than in advanced life. The cornea is dense and of uniform thickness throughout. Its posterior surface is perfectly circular in outline, and exceeds the anterior surface slightly in diameter. Immediately in front of the sclerocorneal junction the cornea bulges inward as a thickened rim, and behind this there is a distinct furrow between the attachment of the iris and the sclerocorneal junction. This furrow has been named by Arthur Thomson the sulcus circularis corneae. It is bounded externally by the trabecular tissue already described as forming the inner wall of the sinus venosus sclerae. Between this tissue and the anterior surface of the attached margin of the iris is an angular recess, named the iridial angle or filtration angle of the eye. Immediately outside the filtration angle is a projecting rim of scleral tissue which appears in a meridional section as a small triangular area, termed the scleral spur. Its base is continuous with the inner surface of the sclera immediately to the outer side of the filtration angle, and its apex is directed forward and inward. To the anterior sloping margin of this spur are attached the bundles of trabecular tissue just referred to. From its posterior margin the meridional fibres of the ciliaris muscle arise. Structure. The cornea consists from before backward of 4 layers, viz. 1. The corneal epithelium, continuous with that of the conjunctiva. 2. The substantia propria. 3. The posterior elastic lamina, and 4. The endothelium of the anterior chamber. The corneal epithelium, epithelium corneae anterior layer, covers the front of the cornea and consists of several layers of cells. The cells of the deepest layer are columnar, Then follow 2 or 3 layers of polyhedral cells, the majority of which are prickle cells similar to those found in the stratum mucosum of the cuticle. Lastly, there are 3 or 4 layers of squamous cells with flattened nuclei. The substantia propria is fibrous, tough, unyielding, and perfectly transparent. It is composed of about 60 flattened lamellae superimposed one on another. These lamellae are made up of bundles of modified connective tissue, the fibres of which are directly continuous with those of the sclera. The fibres of each lamella are for the most part parallel with one another, but at right angles to those of adjacent lamellae. Fibres, however, frequently pass from one lamella to the next. The lamellae are connected with each other by an interstitial cement substance, in which are spaces, the corneal spaces. These are stellate in shape, and communicate with one another by numerous offsets. Each contains a cell, the corneal corpuscle, resembling in form the space in which it is lodged, but not entirely filling it. The layer immediately beneath the corneal epithelium presents certain characteristics which have led some anatomists to regard it as a distinct membrane, and it has been named the anterior elastic lamina. Lamina elastica anterior limiting layer, Bowman's membrane. It differs, however, from the posterior elastic lamina in presenting evidence of fibrillar structure, and in not having the same tendency to curl inward or to undergo fracture, when detached from the other layers of the cornea. It consists of extremely closely interwoven fibrils, similar to those found in the substantia propria, but contains no corneal corpuscles. It may be regarded as a condensed part of the substantia propria. The posterior elastic lamina, lamina elastica posterior, membrane of Descemet, membrane of Demors, covers the posterior surface of the substantia propria, and is an elastic, transparent, homogeneous membrane of extreme thinness, which is not rendered opaque by either water, alcohol, or acids. When stripped from the substantia propria it curls up, or rolls upon itself with the attached surface innermost. At the margin of the cornea the posterior elastic lamina breaks up into fibres which form the trabecular tissue already described. The spaces between the trabeculi are termed the spaces of the angles of the iris, spaces of Fontana. They communicate with the sinus venosus sclerae and with the anterior chamber at the filtration angle. Some of the fibres of this trabecular tissue are continued into the substance of the iris, forming the pectinate ligament of the iris, while others are connected with the forepart of the sclera and choroid. The endothelium of the anterior chamber, endothelium camerae anterioris, posterior layer, corneal endothelium, covers the posterior surface of the elastic lamina, is reflected onto the front of the iris, and also lines the spaces of the angle of the iris. It consists of a single stratum of polygonal flattened nucleated cells. Vessels and nerves. The cornea is a non-vascular structure. The capillary vessels ending in loops at its circumference are derived from the anterior ciliary arteries. Lymphatic vessels have not yet been demonstrated in it, but are represented by the channels in which the bundles of nerves run. These channels are lined by an endothelium. The nerves are numerous and are derived from the ciliary nerves. Around the periphery of the cornea they form an annular plexus, from which fibres enter the substantia propria. They lose their medullary sheaths and ramify throughout its substance in a delicate network, and their terminal filaments form a firm and closer plexus on the surface of the cornea proper, beneath the epithelium. This is termed the subepithelial plexus, and from it fibrils are given off which ramify between the epithelial cells, forming an intraepithelial plexus. The vascular tunic, tunica vasculosa oculi. The vascular tunic of the eye is formed from behind forward by the choroid, the ciliary body, and the iris. The choroid invests the posterior 5/6 of the bulb, and extends as far forward as the ora serrata of the retina. The ciliary body connects the choroid to the circumference of the iris. The iris is a circular diaphragm behind the cornea, and presents near its centre a rounded aperture, the pupil. The choroid, choroidea. The choroid is a thin, highly vascular membrane of a dark brown or chocolate colour, investing the posterior 5/6 of the globe. It is pierced behind by the optic nerve, and in this situation is firmly adherent to the sclera. It is thicker behind than in front. Its outer surface is loosely connected by the lamina suprachoroidea with the sclera. Its inner surface is attached to the pigmented layer of the retina. Structure. The choroid consists mainly of a dense capillary plexus, and of small arteries and veins carrying blood to and returning it from this plexus. On its external surface is a thin membrane, the lamina suprachoroidea, composed of delicate non-vascular lamellae, each lamella consisting of a network of fine elastic fibers along which are branched pigment cells. The spaces between the lamellae are lined by endothelium and open freely into the perichoroidal lymph space, which in its turn communicates with the periscleral space by the perforations in the sclera through which the vessels and nerves are transmitted. Internal to this lamina is the choroid proper, consisting of two layers, an outer composed of small arteries and veins with pigment cells interspersed between them, and an inner consisting of a capillary plexus. The outer layer, lamina vasculosa, consists in part of the larger branches of the short ciliary arteries which run forward between the veins, before they bend inward to end in the capillaries, but is formed principally of veins, named, from their arrangement, the venae vorticosae. They converge to 4 or 5 equidistant trunks, which pierce the sclera about midway between the sclerocorneal junction and the entrance of the optic nerve. Interspersed between the vessels are dark, star-shaped pigment cells, the processes of which, communicating with those of neighbouring cells, form a delicate network or stroma, which toward the inner surface of the choroid loses its pigmentary character. The inner layer, lamina choriocapillaris, consists of an exceedingly fine capillary plexus, formed by the short ciliary vessels. The network is closer and finer in the posterior than in the anterior part of the choroid. About 1.25 cm behind the cornea its meshes become larger, and are continuous with those of the ciliary processes. These two laminae are connected by a stratum intermedium consisting of fine elastic fibres. On the inner surface of the lamina choriocapillaris is a very thin, structureless, or faintly fibrous membrane, called the lamina basalis. It is closely connected with the stroma of the choroid, and separates it from the pigmentary layer of the retina. One of the functions of the choroid is to provide nutrition for the retina, and to convey vessels and nerves to the ciliary body and iris. Tapetum. This name is applied to the outer and posterior part of the choroid, which in many animals presents an iridescent appearance. The ciliary body, corpus ciliari. The ciliary body comprises the orbiculus ciliaris, the ciliary processes, and the ciliaris muscle. The orbiculus ciliaris is a zone of about 4 mm in width, directly continuous with the anterior part of the choroid. It presents numerous ridges arranged in a radial manner. The ciliary processes, processus ciliaris, are formed by the inward folding of the various layers of the choroid, i.e. the choroid proper and the lamina basalis, and are received between corresponding foldings of the suspensory ligament of the lens. They are arranged in a circle and form a sort of frill behind the iris, around the margin of the lens. They vary from 60 to 80 in number, lie side by side, and may be divided into large and small. The former are about 2.5 mm in length, and the latter, consisting of about 1/3 of the entire number, are situated in spaces between them, but without regular arrangement. They are attached by their periphery to 3 or 4 of the ridges of the orbiculus ciliaris, and are continuous with the layers of the choroid. Their opposite extremities are free and rounded, and are directed toward the posterior chamber of the eyeball and circumference of the lens. In front they are continuous with the periphery of the iris. Their posterior surfaces are connected with the suspensory ligament of the lens. Structure. The ciliary processes are similar in structure to the choroid, but the vessels are larger and have chiefly a longitudinal direction. Their posterior surfaces are covered by a bilaminar layer of black pigment cells, which is continued forward from the retina, and is named the pars ciliaris retinae. In the stroma of the ciliary processes there are also stellate pigment cells, but these are not so numerous as in the choroid itself. According to Henderson, the aqueous humour is a secretion formed by the active intervention of the epithelial cells lining the apices of the ciliary processes. End of section 50. Section 51 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. Tunics of the Eye, Part 2. The ciliaris muscle, musculus ciliaris, Bowman's muscle, consists of unstriped fibres. It forms a greyish, semi-transparent circular band about 3 mm broad on the outer surface of the forepart of the choroid. It is thickest in front, and consists of 2 sets of fibres, meridional and circular. The meridional fibres, much the more numerous, arise from the posterior margin of the scleral spur. They run backward and are attached to the ciliary processes and orbiculus ciliaris. One bundle, according to Waldeyer, is inserted into the sclera. The circular fibres are internal to the meridional ones, and in a meridional section appear as a triangular zone behind the filtration angle and close to the circumference of the iris. They are well developed in hypermetropic, but are rudimentary or absent in myopic eyes. The ciliaris muscle is the chief agent in accommodation, i.e. in adjusting the eye to the vision of near objects. When it contracts it draws forward the ciliary processes, relaxes the suspensory ligament of the lens, and thus allows the lens to become more convex. The iris. The iris has received its name from its various colours in different individuals. It is a thin, circular, contractile disc, suspended in the aqueous humour between the cornea and the lens, and perforated a little to the nasal side of its centre by a circular aperture, the pupil. By its periphery it is continuous with the ciliary body, and is also connected with the posterior elastic lamina of the cornea by means of the pectinate ligament. Its surfaces are flattened, and look forward and backward, the anterior toward the cornea, the posterior toward the ciliary processes and lens. The iris divides the space between the lens and the cornea into an anterior and a posterior chamber. The anterior chamber of the eye is bounded in front by the posterior surface of the cornea, behind by the front of the iris and the central part of the lens. The posterior chamber is a narrow chink behind the peripheral part of the iris, and in front of the suspensory ligament of the lens and the ciliary processes. In the adult the 2 chambers communicate through the pupil, but in the fetus up to the 7th month they are separated by the membrana pupillaris. Structure. The iris is composed of the following structures. 1. In front is a layer of flattened endothelial cells placed on a delicate hyaline basement membrane. This layer is continuous with the endothelium covering the posterior elastic lamina of the cornea, and in individuals with dark-coloured irides the cells contain pigment granules. 2. The stroma iridis, of the iris, contains of fibres and cells. The former are made up of delicate bundles of fibrous tissue. A few fibres at the circumference of the iris have a circular direction, but the majority radiate toward the pupil, forming by their interlacement delicate meshes, in which the vessels and nerves are contained. Interspersed between the bundles of connective tissue are numerous branched cells with fine processes. In dark eyes, many of them contain pigment granules, but in blue eyes and the eyes of albinos they are unpigmented. 3. The muscular fibres are involuntary and consist of circular and radiating fibres. The circular fibres form the sphincter pupillae. They are arranged in a narrow band about 1 mm in width which surrounds the margin of the pupil toward the posterior surface of the iris. Those near the free margin are closely aggregated. Those near the periphery of the band are somewhat separated and form incomplete circles. The radiating fibres form the dilator pupillae. They converge from the circumference toward the centre, and blend with the circular fibres near the margin of the pupil. 4. The posterior surface of the iris is of a deep purple tint, being covered by 2 layers of pigmented columnar epithelium, continuous at the periphery of the iris with the pars ciliaris retinae. This pigmented epithelium is named the pars iridica retinae, or, from the resemblance of its colour to that of a ripe grape, the uvea. The colour of the iris is produced by the reflection of light from dark pigment cells underlying a translucent tissue, and is therefore determined by the amount of the pigment and its distribution throughout the texture of the iris. The number and situation of the pigment cells differ in different irides. The albino pigment is absent. In the various shades of the blue eyes, the pigment cells are confined to the posterior surface of the iris, whereas in grey, brown, and black eyes, pigment is found also in the cells of the stroma and in those of the endothelium on the front of the iris. The iris may be absent, either in part or altogether as a congenital condition, and in some instances the pupillary membrane may remain persistent, though it is rarely complete. Again, the iris may be the seat of a malformation, termed coloboma, which consists in a deficiency or cleft, clearly due in great number of cases to an arrest in development. In these cases the cleft is found at the lower aspect, extending directly downward from the pupil, and the gap frequently extends through the choroid to the porus opticus. In some rarer cases the gap is found in other parts of the iris, and is not then associated with any deficiency of the choroid. Vessels and nerves. The arteries of the iris are derived from the long and anterior ciliary arteries, and from the vessels of the ciliary processes. Each of the two long ciliary arteries, having reached the attached margin of the iris, divides into an upper and lower branch. These anastomose with corresponding branches from the opposite side, and thus encircle the iris. Into this vascular circle, circulus arteriosus major, the anterior ciliary arteries pour their blood, and from it vessels converge to the free margin of the iris, and there communicate and form a second circle, circulus arteriosus minor. The nerves of the choroid and iris are the long and short ciliary, the former being branches of the nasociliary nerve, the latter of the ciliary ganglion. They pierce the sclera around the entrance of the optic nerve, run forward in the perichoroidal space, and supply the blood vessels of the choroid. After reaching the iris they form a plexus around its attached margin. From this are derived non-medullated fibres which end in the sphincter and dilata pupillae. Their exact mode of termination has not been ascertained. Other fibres from the plexus end in a network on the anterior surface of the iris. The fibres derived through the motor route of the ciliary ganglion from the oculomotor nerve supply the sphincter, while those derived from the sympathetic supply the dilata. Membrana pupillaris. In the fetus, the pupil is closed by a delicate vascular membrane, the membrana pupillaris, which divides the space in which the iris is suspended into two distinct chambers. The vessels of this membrane are partly derived from those of the margin of the iris, and partly from those of the capsule of the lens. They have a looped arrangement, and converge towards each other without anastomosing. About the 6th month the membrane begins to disappear by absorption from the centre towards the circumference, and at birth only a few fragments are present. In exceptional cases it persists. The retina, tunica interna. The retina is a delicate nervous membrane upon which the images of external objects are received. Its outer surface is in contact with the choroid, its inner with the hyaloid membrane of the vitreous body. Behind it is continuous with the optic nerve. It gradually diminishes in thickness from behind forward, and extends nearly as far as the ciliary body, where it appears to end in a jagged margin, the ora serrata. Here the nervous tissues of the retina end, but a thin prolongation of the membrane extends forward over the back of the ciliary processes and iris, forming the pars ciliaris retinae and pars iridica retinae already referred to. This forward prolongation consists of the pigmentary layer of the retina together with a stratum of columnar epithelium. The retina is soft, semi-transparent, and of a purple tint in the fresh state, owing to the presence of a colouring material named rhodopsin, or visual purple, but it soon becomes clouded, opaque, and bleached when exposed to sunlight. Exactly in the centre of the posterior part of the retina, corresponding to the axis of the eye, and at a point in which the sense of vision is most perfect, is an oval yellowish area, the macula lutea. In the macula is a central depression, the fovea centralis. At the fovea centralis the retina is exceedingly thin, and the dark colour of the choroid is distinctly seen through it. About 3 mm to the nasal side of the macula lutea is the entrance of the optic nerve, optic disc, the circumference of which is slightly raised to form an eminence, colliculus nervi optici, The arteria centralis retinae pierces the centre of the disc. This is the only part of the surface of the retina which is insensitive to light, and it is termed the blind spot. Structure. The retina consists of an outer pigmented layer and an inner nervous stratum or retina proper. The pigmented layer consists of a single stratum of cells. When viewed from the outer surface, these cells are smooth and hexagonal in shape. When seen in section, each cell consists of an outer non-pigmented part containing a large oval nucleus and an inner pigmented portion which extends as a series of straight, thread-like processes between the rods, this being especially the case when the eye is exposed to light. In the eyes of albinos, the cells of this layer are destitute of pigment. Retina proper. The nervous structures of the retina proper are supported by a series of non-nervous or sustentacular fibres, and, when examined microscopically by means of sections made perpendicularly to the surface of the retina, are found to consist of 7 layers, named from within outward as follows: 1. Stratum opticum. 2. Ganglionic layer. 3. Inner plexiform layer. 4. Inner nuclear layer or layer of inner granules. 5. Outer plexiform layer. 6. Outer nuclear layer or layer of outer granules. 7. Layer of rods and cones. 1. The stratum opticum or layer of nerve fibres is formed by the expansion of the fibres of the optic nerve. It is thickest near the porus opticus, gradually diminishing toward the ora serrata. As the nerve fibres pass through the lamina cribrosa sclerae, they lose their medullary sheaths and are continued onward through the choroid and retina as simple axis cylinders. When they reach the internal surface of the retina, they radiate from their point of entrance over this surface grouped in bundles, and in many places arranged in plexuses. Most of the fibres are centripetal, and are the direct continuations of the axis cylinder processes of the cells of the ganglionic layer, but a few of them are centrifugal and ramify in the inner plexiform and inner nuclear layers, where they end in enlarged extremities. 2. The ganglionic layer consists of a single layer of large ganglion cells, except in the macula lutea, where there are several strata. The cells are somewhat flask-shaped, the rounded internal surface of each resting on the stratum opticum, and sending off an axon which is prolonged into it. From the opposite end numerous dendrites extend into the inner plexiform layer, where they branch and form flattened arborizations at different levels. The ganglion cells vary much in size, and the dendrites of the smaller ones as a rule arborize in the inner plexiform layer as soon as they enter it, while those of the larger cells ramify close to the inner nuclear layer. 3. The inner plexiform layer is made up of a dense reticulum of minute fibrils formed by the interlacement of the dendrites of the ganglion cells with those of the cells of the inner nuclear layer. Within this reticulum a few branched spongioblasts are sometimes embedded. 4. The inner nuclear layer, or layer of inner granules, is made up of a number of closely packed cells, of which there are 3 varieties, viz., bipolar cells, horizontal cells, and amacrine cells. The bipolar cells, by far the most numerous, are round or oval in shape, and each is prolonged into an inner and an outer process. They are divisible into rod bipolars and cone bipolars. The inner processes of the rod bipolars run through the inner plexiform layer and arborize around the bodies of the cells of the ganglionic layer. Their outer processes end in the outer plexiform layer in tufts of fibrils around the button-like ends of the inner processes of the rod granules. The inner processes of the cone bipolars ramify in the inner plexiform layer in contact with the dendrites of the ganglionic cells. The horizontal cells lie in the outer part of the inner nuclear layer and possess somewhat flattened cell bodies. Their dendrites divide into numerous branches in the outer plexiform layer, while their axons run horizontally for some distance and finally ramify in the same layer. The amacrine cells are placed in the inner part of the inner nuclear layer, and are so named because they have not yet been shown to possess axis cylinder processes. Their dendrites undergo extensive ramification in the inner plexiform layer. 5. The outer plexiform layer is much thinner than the inner, but like it, consists of a dense network of minute fibrils derived from the processes of the horizontal cells of the preceding layer, and the outer processes of the rod and cone bipolar granules, which ramify in it, forming arborizations around the enlarged ends of the rod fibers and with the branched foot plates of the cone fibers. 6. The outer nuclear layer or layer of outer granules, like the inner nuclear layer, consists of several strata of oval nuclear bodies. They are of two kinds, viz., rod and cone granules, so named on account of their being respectively connected with the rods and cones of the next layer. The rod granules are much the more numerous, and are placed at different levels throughout the layer. Their nuclei present a peculiar cross-striped appearance, and prolonged from either extremity of each cell is a fine process. The outer process is continuous with a single rod of the layer of rods and cones. The inner ends in the outer plexiform layer in an enlarged extremity, and is embedded in the tuft into which the outer processes of the rod bipolar cells break up. In its course it presents numerous varicosities. The cone granules, fewer in number than the rod granules, are placed close to the membrana limitans externa, through which they are continuous with the cones of the layer of rods and cones. They do not present any cross striation, but contain a piriform nucleus, which almost completely fills the cell. From the inner extremity of the granule a thick process passes into the outer plexiform layer, and there expands into a pyramidal enlargement or foot plate, from which are given off numerous fine fibrils that come in contact with the outer processes of the cone bipolars. 7. The layer of rods and cones, Jacob's membrane. The elements composing this layer are of two kinds, rods and cones, the former being much more numerous than the latter except in the macular lutea. The rods are cylindrical, of nearly uniform thickness, and are arranged perpendicularly to the surface. Each rod consists of two segments, an outer and inner, of about equal lengths. The segments differ from each other as regards refraction and in their behavior towards coloring reagents, but is colored yellowish-brown by osmic acid. The outer segment is marked by transverse striae, and tends to break up into a number of thin discs superimposed on one another. It also exhibits faint longitudinal markings. The deeper part of the inner segment is indistinctly granular. Its more superficial part presents a longitudinal striation, being composed of fine, bright, highly refracting fibrils. The visual purple or rhodopsin is found only in the outer segments. The cones are conical or flask-shaped, their broad ends resting upon the membrana limitans externa, the narrow pointed extremity being turned to the choroid. Like the rods, each is made up of two segments, outer and inner. The outer segment is a short conical process, which, like the outer segment of the rod, exhibits transverse striae. The inner segment resembles the inner segment of the rods in structure, presenting a superficial striated and deep granular part, but differs from it in size and shape, being bulged out laterally and flask-shaped. The chemical and optical characters of the two portions are identical with those of the rods. Supporting framework of the retina. The nervous layers of the retina are connected together by a supporting framework, formed by the sustentacular fibers of Müller. These fibers pass through all the nervous layers except that of the rods and cones. Each begins on the inner surface of the retina by an expanded, often forked base, which sometimes contains a spheroidal body staining deeply with hematoxylin, the edges of the bases of adjoining fibers being united to form the membrana limitans interna. As the fibers pass through the nerve fiber and ganglionic layers, they give off a few lateral branches. In the inner nuclear layer they give off numerous lateral processes for the support of the bipolar cells, while in the outer nuclear layer they form a network around the rod and cone fibrils, and unite to form the membrana limitans externa at the bases of the rods and cones. At the level of the inner nuclear layer, each sustentacular fiber contains a clear oval nucleus. Macular lutea and fovea centralis. In the macular lutea the nerve fibers are wanting as a continuous layer. The ganglionic layer consists of several strata of cells. There are no rods but only cones, which are longer and narrower than in other parts, and in the outer nuclear layer there are only cone granules, the processes of which are very long and arranged in curved lines. In the fovea centralis the only parts present are 1. The cones, 2. The outer nuclear layer, the cone fibers of which are almost horizontal in direction, 3. An exceedingly thin inner plexiform layer. The pigmented layer is thicker and its pigment more pronounced than elsewhere. the colour of the macula seems to imbue all the layers except that of the rods and cones. It is of a richer yellow, deepest toward the centre of the macula, and does not appear to be due to pigment cells, but simply to a staining of the constituent parts. At the ora serrata the nervous layers of the retina end abruptly, and the retina is continued onward as a single layer of columnar cells covered by the pigmented layer. This double layer is known as the pars ciliaris retinae, and can be traced forward from the ciliary processes onto the back of the iris, where it is termed the pars iridica retinae, or uvea. The arteria centralis retinae and its accompanying vein pierce the optic nerve and enter the bulb of the eye through the porus opticus. The artery immediately bifurcates into an upper and a lower branch, and each of these again divides into a medial or nasal and a lateral or temporal branch, which at first run between the hyaloid membrane and the nervous layer, but they soon enter the latter and pass forward, dividing dichotomously. From these branches a minute capillary plexus is given off, which does not extend beyond the inner nuclear layer. The macula receives two small branches, superior and inferior macular arteries, from the temporal branches and small twigs directly from the central artery. These do not, however, reach as far as the fovea centralis, which has no blood vessels. The branches of the arteria centralis retinae do not anastomose with each other. In other words, they are terminal arteries. In the fetus, a small vessel, the arteria hyaloidea, passes forward as a continuation of the arteria centralis retinae through the vitreous humour to the posterior surface of the capsule of the lens. End of section 51.
Section 52 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Anatomy of the Human Body, Part 4, by Henry Gray. The refracting media. The refracting media are three, viz. Aqueous humour, vitreous body, crystalline lens. The aqueous humour, humour aqueous. The aqueous humour fills the anterior and posterior chambers of the eyeball. It is small in quantity, has an alkaline reaction, and consists mainly of water, less than 1/50 of its weight being solid matter, chiefly chloride of sodium. The vitreous body, corpus vitreum. The vitreous body forms about 4/5 of the bulb of the eye. It fills the concavity of the retina and is hollowed in front, forming a deep concavity, the hyaloid fossa, for the reception of the lens. It is transparent, of the consistence of thin jelly, and is composed of an albuminous fluid enclosed in a delicate transparent membrane, the hyaloid membrane. It has been supposed by Hanover that from its surface numerous thin lamellae are prolonged inward in a radiating matter, forming spaces in which the fluid is contained. In the adult, these lamellae cannot be detected even after careful microscopic examinations in the fresh state, but in preparations hardened in weak chromic acid it is possible to make out a distinct lamellation at the periphery of the body. In the centre of the vitreous body, running from the entrance of the optic nerve to the posterior surface of the lens, is a canal, the hyaloid canal, filled with lymph and lined by a prolongation of the hyaloid membrane. This canal, in the embryonic vitreous body, conveyed the arterial hyaloidae from the central artery of the retina to the back of the lens. The fluid from the vitreous body is nearly pure water. It contains, however, some salts and a little albumin. The hyaloid membrane envelops the vitreous body. The portion in front of the ora serrata is thickened by the accession of radial fibres, and is termed the zonula ciliaris, zonule of Zinn. Here it presents a series of radially arranged furrows, in which the ciliary processes are accommodated and to which they adhere, as is shown by the fact that when they are removed some of their pigment remains attached to the zonula. The zonula ciliaris splits into two layers, one of which is thin and lines the hyaloid fossa, The other is named the suspensory ligament of the lens. It is thicker and passes over the ciliary body to be attached to the capsule of the lens a short distance in front of its equator. Scattered and delicate fibres are also attached to the region of the equator itself. This ligament retains the lens in position and is relaxed by the contraction of the meridional fibres of the ciliaris muscle, so that the lens is allowed to become more convex. Behind the suspensory ligament there is a sacculated canal, the spatio-zonularis canal of Petit, which encircles the equator of the lens. It can be easily inflated through a fine blowpipe inserted under the suspensory ligament. No blood vessels penetrate the vitreous body, so that its nutrition must be carried on by vessels of the retina and the ciliary processes, situated upon its exterior. The crystalline lens, lens crystallina, the crystalline lens enclosed in its capsule, is situated immediately behind the iris, in front of the vitreous body, and encircled by the ciliary processes, which slightly overlap its margin. The capsule of the lens, capsula lentis, is a transparent structureless membrane which closely surrounds the lens and is thicker in front than behind. It is brittle but highly elastic, and when ruptured the edges roll up with the outer surface innermost. It rests behind in the hyaloid fossa in the forepart of the vitreous body. In front it is in contact with the free border of the iris, but recedes from it at the circumference, thus forming the posterior chamber of the eye. It is retained in its position chiefly by the suspensory ligament of the lens, already described. The lens is a transparent biconvex body, the convexity of its anterior being less than that of its posterior surface. The central points of these surfaces are termed respectively the anterior and posterior poles. A line connecting the poles constitutes the axis of the lens, while the marginal circumference is termed the equator. Structure. The lens is made up of soft cortical substance and a firm central part, the nucleus. Faint lines, radii lentis, radiate from the poles to the equator. In the adult there may be 6 or more of these lines, but in the fetus they are only 3 in number and diverge from each other at angles of 120 degrees. On the anterior surface one line ascends vertically and the other 2 diverge downward. On the posterior surface one ray descends vertically and the other 2 diverge upwards. They correspond with the free edges of an equal number of septa composed of an amorphous substance which dip into the substance of the lens. When the lens has been hardened it is seen to consist of a series of concentrically arranged laminae, each of which is interrupted at the septa referred to. Each lamina is built up of a number of hexagonal ribbon-like lens fibres, the edges of which are more or less serrated, the serrations fitting between those of neighbouring fibres, while the ends of the fibres come into apposition at the septa. The fibres run in a curved manner from the septa on the anterior surface to those on the posterior surface. No fibres pass from pole to pole. They are arranged in such a way that those which begin near the pole on one surface of the lens end near the peripheral extremity of the plane on the other, and vice versa. The fibres of the outer layers of the lens are nucleated, and together form a nuclear layer, most distinct towards the equator. The anterior surface of the lens is covered by a layer of transparent columnar nucleated epithelium. At the equator the cells become elongated, and their gradual transition into lens fibres can be traced. In the fetus the lens is nearly spherical, and has a slightly reddish tint. It is soft and breaks down readily on the slightest pressure. A small branch from the arteria centralis retina runs forward, as already mentioned, through the vitreous body to the posterior part of the capsule of the lens, where its branches radiate and form a plexiform network, which covers the posterior surface of the capsule, and they are continuous around the margin of the capsule with the vessels of the pupillary membrane and with those of the iris. In the adult, the lens is colourless, transparent, firm in texture, and devoid of vessels. In old age it becomes flattened on both surfaces, slightly opaque, of an amber tint, and increased in density. Vessels and nerves. The arteries of the bulb of the eye are the long, short, and anterior ciliary arteries, and the arteria centralis retina. They have already been described. The ciliary veins are seen on the outer surface of the choroid, and are named, from their arrangement, the vena vorticosi. They converge to 4 or 5 equidistant trunks, which pierce the sclera midway between the sclerocorneal junction and the porus opticus. Another set of veins accompanies the anterior ciliary arteries. All of these veins open into the ophthalmic veins. The ciliary nerves are derived from the nasociliary nerve and from the ciliary ganglion. End of section 52.
Section 53 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by Leanne Howlett. Anatomy of the Human Body, Part 4, by Henry Gray. Accessory Organs of the Eye, Part 1. 1C3. The accessory organs of the eye. Organa oculi accessoria. The accessory organs of the eye include the ocular muscles, the fasciae, the eyebrows, the eyelids, the conjunctiva, and the lacrimal apparatus. The ocular muscles, musculi oculi. The ocular muscles are the levator palpebri superioris, rectus medialis, rectus superior, rectus lateralis, rectus inferior, obliquus superior, obliquus inferior. The levator palpebri superioris is thin, flat, and triangular in shape. It arises from the under surface of the small wing of the sphenoid, above and in front of the optic foramen, from which it is separated by the origin of the rectus superior. At its origin it is narrow and tendinous, but soon becomes broad and fleshy, and ends anteriorly in a wide aponeurosis which splits into 3 lamellae. The superficial lamella blends with the upper part of the orbital septum, and is prolonged forward above the superior tarsus to the palpable part of the orbicularis oculi, and to the deep surface of the skin of the upper eyelid. The middle lamella, largely made up of non-striped muscular fibers, is inserted into the upper margin of the superior tarsus, while the deepest lamella blends with an expansion from the sheath of the rectus superior, and with it is attached to the superior fornix of the conjunctiva. Whitnell has pointed out that the upper part of the sheath of the levator palpebri becomes thickened in front and forms, above the anterior part of the muscle, a transverse ligamentous band which is attached to the sides of the orbital cavity. On the medial side it is mainly fixed to the pulley of the obliquus superior, but some fibers are attached to the bone behind the pulley, and a slip passes forward and bridges over the supraorbital notch. On the lateral side it is fixed to the capsule of a lacrimal gland and to the frontal bone. In front of the transverse ligamentous band the sheath is continued over the aponeurosis of the levator palpebri as a thin connective tissue layer, which is fixed to the upper orbital margin immediately behind the attachment of the orbital septum. When the levator palpebri contracts, the lateral and medial parts of the ligamentous band are stretched and check the action of the muscle. The retraction of the upper eyelid is checked also by the orbital septum coming into contact with the transverse part of the ligamentous band. The four recti arise from a fibrous ring, annulus tendinus communis, which surrounds the upper, medial, and lower margins of the optic foramen and encircles the optic nerve. The ring is completed by a tendinous bridge prolonged over the lower and medial part of the superior orbital fissure and attached to a tubercle on the margin of the great wing of the sphenoid, bounding the fissure. Two specialized parts of this fibrous ring may be made out: a lower, the ligament or tendon of Zinn, which gives origin to the rectus inferior, part of the rectus internus, and the lower head of origin of the rectus lateralis; and an upper, which gives origin to the rectus superior, the rest of the rectus medialis, and the upper head of the rectus lateralis. This upper band is sometimes termed the superior tendon of Lockwood. Each muscle passes forward in the position implied by its name, to be inserted by a tendinous expansion into the sclera about 6 millimeters from the margin of the cornea. Between the two heads of the rectus lateralis is a narrow interval, through which pass the two divisions of the oculomotor nerve, the nasociliary nerve, the abducent nerve, and the ophthalmic vein. Although these muscles present a common origin and are inserted in a similar manner into the sclera, there are certain differences to be observed in them as regards their length and breadth. The rectus medialis is the broadest, the rectus lateralis the longest, and the rectus superior the thinnest and narrowest. The obliquus oculi superior, superior oblique, is a fusiform muscle placed at the upper and medial side of the orbit. It arises immediately above the margin of the optic foramen, above and medial to the origin of the rectus superior, and passing forward, ends in a rounded tendon, which plays in a fibro-cartilaginous ring or pulley attached to the trochlear fovea of the frontal bone. The contiguous surfaces of the tendon and ring are lined by a delicate mucous sheath, and enclosed in a thin fibrous investment. The tendon is reflected backward, lateralward, and downward beneath the rectus superior to the lateral part of the bulb of the eye, and is inserted into the sclera behind the equator of the eyeball, the insertion of the muscle lying between the rectus superior and rectus lateralis. The obliquus oculi inferior, inferior oblique, is a thin, narrow muscle, placed near the anterior margin of the floor of the orbit. It arises from the orbital surface of the maxilla, lateral to the lacrimal groove. Passing lateralward, backward, and upward, at first between the rectus inferior and the floor of the orbit, and then between the bulb of the eye and the rectus lateralis, it is inserted into the lateral part of the sclera, between the rectus superior and rectus lateralis, near to, but somewhat behind the insertion of the obliquus superior. Nerves. The levator palpebri superioris, obliquus inferior, and the recti superior, inferior, and medialis are supplied by the oculomotor nerve, the obliquus superior by the trochlear nerve, the rectus lateralis by the abducent nerve. Actions. The levator palpebri raises the upper eyelid, and is the direct antagonist of the orbicularis oculi. The four recti are attached to the bulb of the eye in such a manner that, acting singly, they will turn its corneal surface either upward, downward, medialward, or lateralward, as expressed by their names. The movement produced by the rectus superior or rectus inferior is not quite a simple one, for inasmuch as each passes obliquely lateralward and forward to the bulb of the eye, the elevation or depression of the cornea is accompanied by a certain deviation medialward, with a slight amount of rotation. These latter movements are corrected by the obliqui, the obliquus inferior correcting the medial deviation caused by the rectus superior, and the obliquus superior that caused by the rectus inferior. The contraction of the rectus lateralis or rectus medialis, on the other hand, produces a purely horizontal movement. If any two neighboring recti of one eye act together, they carry the globe of the eye in the diagonal of these directions, viz. upward and medialward, upward and lateralward, downward and medialward, or downward and lateralward. Sometimes the corresponding recti of the two eyes act in unison, and at other times the opposite recti act together. Thus, in turning the eyes to the right, the rectus lateralis of the right eye will act in unison with the rectus medialis of the left eye. But if both eyes are directed to an object in the middle line at a short distance, the two recti medialis will act in unison. The movement of circumduction, as in looking around a room, is performed by the successive actions of the four recti. The obliqui rotate the eyeball on its antero-posterior axis, the superior directing the cornea downward and lateralward, and the inferior directing it upward and lateralward. These movements are required for the correct viewing of an object when the head is moved laterally, as from shoulder to shoulder, in order that the picture may fall in all respects on the same part of the retina of either eye. A layer of non-striped muscle, the orbitalis muscle of H. Müller, may be seen bridging across the inferior orbital fissure. The fascia bulb, capsule of Tenon, is a thin membrane which envelops the bulb of the eye from the optic nerve to the ciliary region, separating it from the orbital fat, and forming a socket in which it plays. Its inner surface is smooth, and is separated from the outer surface of the sclera by the periscleral lymph space. This lymph space is continuous with the subdural and subarachnoid cavities, and is traversed by delicate bands of connective tissue which extend between the fascia and the sclera. The fascia is perforated behind the ciliary vessels and nerves, and fuses with the sheath of the optic nerve and with the sclera around the entrance of the optic nerve. In front it blends with the ocular conjunctiva, and with it is attached to the ciliary region of the eyeball. It is perforated by the tendons of the ocular muscles, and is reflected backward on each as a tubular sheath. The sheath of the obliquus superior is carried as far as the fibrous pulley of that muscle. That on the obliquus inferior reaches as far as the floor of the orbit, to which it gives off a slip. The sheaths on the recti are gradually lost in the perimysium, but they give off important expansions. The expansion from the rectus superior blends with the tendon of the levator palpebri. That of the rectus inferior is attached to the inferior tarsus. The expansions from the sheaths of the recti lateralis and medialis are strong, especially that from the latter muscle, and are attached to the lacrimal and zygomatic bones respectively. As they probably check the actions of these two recti, they have been named the medial and lateral check ligaments. Lockwood has described a thickening of the lower part of the fascia bulbi, which he has named the suspensory ligament of the eye. It is slung like a hammock below the eyeball, being expanded in the center, and narrow at its extremities, which are attached to the zygomatic and lacrimal bones respectively. The orbital fascia forms the periosteum of the orbit. It is loosely connected to the bones and can be readily separated from them. Behind, it is united with the dura mater by processes which pass through the optic foramen and superior orbital fissure, and with the sheath of the optic nerve. In front it is connected with the periosteum at the margin of the orbit, and sends off a process which assists in forming the orbital septum. From it two processes are given off, one to enclose the lacrimal gland, the other to hold the pulley of the obliquus superior in position. The eyebrows, supercilia, are two arched eminences of integument, which surmount the upper circumference of the orbits and support numerous short, thick hairs directed obliquely on the surface. The eyebrows consist of thickened integument connected beneath with the orbicularis oculi, corrugator, and frontalis muscles. The eyelids, palpebri, are two thin movable folds placed in front of the eye, protecting it from injury by their closure. The upper eyelid is the larger and the more movable of the two, and is furnished with an elevator muscle, the levator palpebri superioris. When the eyelids are open, an elliptical space, the palpebral fissure, rima palpebrarum, the angles of which correspond to the junctions of the upper and lower eyelids, and are called the palpebral commissures or canthi. The lateral palpebral commissure, commissura palpebrarum lateralis, external canthus, is more acute than the medial, and the eyelids here lie in close contact with the bulb of the eye, but the medial palpebral commissure, commissura palpebrarum medialis, internal canthus, is prolonged for a short distance toward the nose, and the two eyelids are separated by a triangular space, the lacus lachrymalis. At the basal angles of the lacus lachrymalis, on the margin of each eyelid, is a small conical elevation, the lachrymal papilla, the apex of which is pierced by a small orifice, the punctum lacrymale, the commencement of the lachrymal duct. The eyelashes, cilia, are attached to the free edges of the eyelid. They are short, thick, curved hairs, arranged in a double or triple row. Those of the upper eyelid, more numerous and longer than those of the lower, curve upward. Those of the lower eyelid curve downward, so that they do not interlace in closing the lids. Near the attachment of the eyelashes are the openings of a number of glands. The ciliary glands, arranged in several rows close to the free margin of the lid. They are regarded as enlarged and modified sudoriferous glands. End of section 53. Recording by Leanne Howlett. Section 54 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by Leanne Howlett. Anatomy of the Human Body, Part 4, by Henry Gray. Accessory Organs of the Eye, Part 2. Structure of the eyelids. The eyelids are composed of the following structures taken in their order, from without inward: integument, areolar tissue, fibers of the orbicularis oculi, tarsus, orbital septum, tarsal glands, and conjunctiva. The upper eyelid has, in addition, the aponeurosis of the levator palpebri superioris. The integument is extremely thin and continuous at the margins of the eyelids with the conjunctiva. The subcutaneous areolar tissue is very lax and delicate, and seldom contains any fat. The palpebral fibers of the orbicularis oculi are thin, pale in color, and possess an involuntary action. The tarsi, tarsal plates, are two thin, elongated plates of dense connective tissue, about 2.5 centimeters in length. One is placed in each eyelid and contributes to its form and support. The superior tarsus, tarsus superior, superior tarsal plate, the larger, is of a semi-lunar form, about 10 millimeters in breadth at the center, and gradually narrowing toward its extremities. To the anterior surface of this plate, the aponeurosis of the levator palpebri superioris is attached. The inferior tarsus, tarsus inferior, inferior tarsal plate, the smaller, is thin, elliptical in form, and has a vertical diameter of about 5 millimeters. The free or ciliary margins of these plates are thick and straight. The attached or orbital margins are connected to the circumference of the orbit by the orbital septum. The lateral angles are attached to the zygomatic bone by the lateral palpebral raphe. The medial angles of the two plates end at the lacus lachrymalis and are attached to the frontal process of the maxilla by the medial palpebral ligament. The orbital septum, septum orbital palpebral ligament, is a membranous sheet attached to the edge of the orbit, where it is continuous with the periosteum. In the upper eyelid it blends by its peripheral circumference with the tendon of the levator palpebri superioris and the superior tarsus, and the lower eyelid with the inferior tarsus. Medially it is thin, and becoming separated from the medial palpebral ligament, is fixed to the lacrimal bone immediately behind the lacrimal sac. The septum is perforated by the vessels and nerves which pass from the orbital cavity to the face and scalp. The eyelids are richly supplied with blood. The tarsal glands, glandulae tarsalis, meibomi, meibomian glands. The tarsal glands are situated upon the inner surfaces of the eyelids, between the tarsi and conjunctiva, and may be distinctly seen through the latter on everting the eyelids, presenting an appearance like parallel strings of pearls. There are about 30 in the upper eyelid and somewhat fewer in the lower. They are embedded in grooves in the inner surfaces of the tarsi, and correspond in length with the breadth of these plates. They are consequently longer in the upper than in the lower eyelid. Their ducts open on the free margins of the lids by minute foramina. Structure. The tarsal glands are modified sebaceous glands, each consisting of a single straight tube or follicle with numerous small lateral diverticula. The tubes are supported by a basement membrane, and are lined at their mouths by stratified epithelium. The deeper parts of the tubes and the lateral offshoots are lined by a layer of polyhedral cells. The conjunctiva is the mucous membrane of the eye. It lines the inner surfaces of the eyelids or palpebrae, and is reflected over the forepart of the sclera and cornea. The palpebral portion, tunica conjunctiva palpebrarum, is thick, opaque, highly vascular, and covered with numerous papillae, its deeper part presenting a considerable amount of lymphoid tissue. At the margins of the lids it becomes continuous with the lining membrane of the ducts of the tarsal glands, and through the lacrimal ducts with the lining membrane of the lacrimal sac and nasolacrimal duct. At the lateral angle of the upper eyelid, the ducts of the lacrimal gland open on its free surface, and at the medial angle it forms a semilunar fold, the plica semilunaris. The line of reflection of the conjunctiva from the upper eyelid onto the bulb of the eye is named the superior fornix, and that from the lower lid the inferior fornix. The bulbar portion, tunica conjunctiva bulbi. Upon the sclera the conjunctiva is loosely connected to the bulb of the eye. It is thin, transparent, destitute of papillae, and only slightly vascular. Upon the cornea the conjunctiva consists only of epithelium, constituting the epithelium of the cornea already described. Lymphatics arise in the conjunctiva in a delicate zone around the cornea and run to the ocular conjunctiva. In and near the fornices, but more plentiful in the upper than in the lower eyelid, a number of convoluted tubular glands open on the surface of the conjunctiva. Other glands, analogous to lymphoid follicles, and called by Henle trachoma glands, are found in the conjunctiva, and, according to Strohmeyer, are chiefly situated near the medial palpebral commissure. They were first described by Brush, in his description of Peyer's patches of the small intestine, as identical structures existing in the under eyelid of the ox. The caruncula lachrymalis is a small, reddish, conical-shaped body situated at the medial palpebral commissure and filling up the lacus lachrymalis. It consists of a small island of skin, containing sebaceous and sudoriferous glands, and is a source of the whitish secretion which constantly collects in this region. A few slender hairs are attached to its surface. Lateral to the caruncula is a slight semilunar fold of conjunctiva, the concavity of which is directed toward the cornea. It is called the plica semilunaris. Müller found smooth muscular fibers in this fold. In some of the domesticated animals it contains a thin plate of cartilage. The nerves in the conjunctiva are numerous and form rich plexuses. According to Krauss, they terminate in a peculiar form of tactile corpuscle, which he terms terminal bulb. The lacrimal apparatus, apparatus lachrymalis, consists of A, the lacrimal gland, which secretes the tears, and its excretory ducts, which convey the fluid to the surface of the eye; b. the lacrimal ducts, the lacrimal sac, and the naso-lacrimal duct, by which the fluid is conveyed into the cavity of the nose. The lacrimal gland, glandula lacrimalis. The lacrimal gland is lodged in the lacrimal fossa, on the medial side of the zygomatic process of the frontal bone. It is of an oval form, about the size and shape of an almond, and consists of two portions, described as the superior and inferior lacrimal glands. The superior lacrimal gland is connected to the periosteum of the orbit by a few fibrous bands, and rests upon the tendons of the recti superioris and lateralis, which separate it from the bulb of the eye. The inferior lacrimal gland is separated from the superior by a fibrous septum, and projects into the back part of the upper eyelid, where its deep surface is related to the conjunctiva. The ducts of the glands, from 6 to 12 in number, run obliquely beneath the conjunctiva for a short distance, and open along the upper and lateral half of the superior conjunctival fornix. Structures of the lacrimal gland. In structure and general appearance, the lacrimal resembles the serous salivary glands. In the recent state the cells are so crowded with granules that their limits can hardly be defined. They contain oval nuclei, and the cell protoplasm is finely fibrillated. The lacrimal ducts, ductus lacrimalis, lacrimal canals. The lacrimal ducts, one in each eyelid, commence at minute orifices, termed puncta lacrimalia, on the summits of the pupillae lacrimales, seen on the margins of the lids at the lateral extremity of the lacus lacrimalis. The superior duct, the smaller and shorter of the two, at first ascends, and then bends at an acute angle, and passes medialward and downward to the lacrimal sac. The inferior duct at first descends, and then runs almost horizontally to the lacrimal sac. At the angles they are dilated into ampullae, their walls are dense in structure, and their mucous lining is covered by stratified squamous epithelium placed on a basement membrane. Outside the latter is a layer of striped muscle, continuous with the lacrimal part of the orbicularis oculi. At the base of each lacrimal papilla, the muscular fibers are circularly arranged and form a kind of sphincter. The lacrimal sac, saccus lacrimalis. The lacrimal sac is the upper dilated end of the naso-lacrimal duct, and is lodged in a deep groove formed by the lacrimal bone and frontal process of the maxilla. It is oval in form, and measures from 12 to 15 millimeters in length. Its upper end is closed and rounded, its lower is continued into the naso-lacrimal duct. Its superficial surface is covered by a fibrous expansion derived from the medial palpebral ligament, and its deep surface is crossed by the lacrimal part of the orbicularis oculi, which is attached to the crest on the lacrimal bone. Structure. The lacrimal sac consists of a fibrous elastic coat, lined internally by mucous membrane. The latter is continuous, through the lacrimal ducts, with the conjunctiva, and through the naso-lacrimal duct, with the mucous membrane of the nasal cavity. The naso-lacrimal duct, ductus naso-lacrimalis, nasal duct. The naso-lacrimal duct is a membranous canal, about 18 millimeters in length, which extends from the lower part of the lacrimal sac to the inferior meatus of the nose, where it ends by a somewhat expanded orifice, provided with an imperfect valve, the plica lacrimalis Hasneri, formed by a fold of the mucous membrane. It is contained in an osseous canal, formed by the maxilla, the lacrimal bone, and the inferior nasal concha. It is narrower in the middle than at either end, and is directed downward, backward, and a little lateralward. The mucous lining of the lacrimal sac and naso-lacrimal duct is covered with columnar epithelium, which in places is ciliated. End of section 54. Recording by Laurie Anne Walden.
Section 55 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by David Lawrence. Anatomy of the Human Body, Part 4, by Henry Gray. 1D. The Organ of Hearing. Organon auditus, the ear. The ear, or organ of hearing, is divisible into three parts: the external ear, the middle ear, or tympanic cavity, and the internal ear, or labyrinth. The development of the ear. The first rudiment of the internal ear appears shortly after that of the eye, in the form of a patch of thickened ectoderm, the auditory plate, over the region of the hindbrain. The auditory plate becomes depressed and converted into the auditory pit. The mouth of the pit is then closed, and thus a shut sac, the auditory vesicle, is formed. From it the epithelial lining of the membranous labyrinth is derived. The vesicle becomes pear-shaped, and the neck of the flask is obliterated. From the vesicle certain diverticula are given off which form the various parts of the membranous labyrinth. One from the middle part forms the ductus and sactus endolymphaticus. Another from the anterior end gradually elongates and, forming a tube coiled on itself, becomes a cochlear duct, the vestibular extremity of which is subsequently constricted to form the canalus reunions. Three others appear as disc-like evaginations on the surface of the vesicle. The central parts of the walls of the discs coalesce and disappear, while the peripheral portions persist to form the semicircular ducts. Of these, the superior is the first, and the lateral the last to be completed. The central part of the vesicle represents the membranous vestibule, and is subdivided by a constriction into a smaller ventral part, the saccule, and a large dorsal and posterior part, the utricle. This subdivision is effected by a fold which extends deeply into the proximal part of the ductus endolymphaticus, with the result that the utricle and saccule ultimately communicate with each other by means of a Y-shaped canal. The saccule opens into the cochlear duct through the canalus reunions, and the semicircular ducts communicate with the utricle. The mesodermal tissue surrounding the various parts of the epithelial labyrinth is converted into a cartilaginous ear capsule, and this is finally ossified to form the bony labyrinth. Between the cartilaginous capsule and the epithelial structures is a stratum of mesodermal tissue which is differentiated into three layers, viz., an outer, forming the periosteal lining of the bony labyrinth, an inner, in direct contact with the epithelial structures, and an intermediate, consisting of gelatinous tissue. By the absorption of this latter tissue, the periolymphatic spaces are developed. The modulus and osseous spiral lamina of the cochlea are not preformed in cartilage, but are ossified directly from connective tissue. The middle ear and auditory tube are developed from the first pharyngeal pouch. The entodermal lining of the dorsal end of this pouch is in contact with the ectoderm of the corresponding pharyngeal groove. By the extension of the mesoderm between these two layers, the tympanic membrane is formed. During the 6th or 7th month, the tympanic antrum appears as an upward and backward expansion of the tympanic cavity. With regard to the exact mode of development of the ossicles of the middle ear, there is some difference of opinion. The view generally held is that the malleus is developed from the proximal end of the mandibular (Menkel's) cartilage, the incus in the proximal end of the mandibular arch, and that the stapes is formed from the proximal end of the hyoid arch. The malleus, with the exception of its anterior process, is ossified from a single center which appears near the neck of the bone. The anterior process is ossified separately in membrane, and joins the main part of the bone about the 6th month of fetal life. The incus is ossified from one center, which appears in the upper part of its long crus, and ultimately extends into its lenticular process. The stapes first appears as a ring, annulus stapedius, encircling a small vessel, the stapedial artery, which subsequently undergoes atrophy. It is ossified from a single center which appears in its base. The external acoustic meatus is developed from the first bronchial groove. The lower part of this groove extends inward as a funnel-shaped tube, primary meatus, from which the cartilaginous portion and a small part of the roof of the osseous portion of the meatus are developed. From the lower part of the funnel-shaped tube, an epithelial lamina extends downward and inward along the inferior wall of the primitive tympanic cavity. By the splitting of this lamina, the inner part of the meatus, secondary meatus, is produced, while the inner portion of the lamina forms the cutaneous stratum of the tympanic membrane. The auricula, or pinna, is developed by the gradual differentiation of tubercles, which appear around the margin of the first bronchial groove. The rudiment of the acoustic nerve appears about the end of the third week as a group of ganglion cells closely applied to the cephalic edge of the auditory vesicle. Whether these cells are derived from the ectoderm adjoining the auditory vesicle, or have migrated from the wall of the neural tube, is as yet uncertain. The ganglion gradually split into two parts, the vestibular ganglion and the spiral ganglion. The peripheral branches of the vestibular ganglion pass in two divisions, the pars superior giving rami to the superior ampulla of the superior semicircular duct, to the lateral ampulla and to the utricle, and the pars inferior giving rami to the saccule and to the posterior ampulla. The proximal fibers of the vestibular ganglion form the vestibular nerve. The proximal fibers of the spiral ganglion form the cochlear nerve. End of section 55. Recorded by David Lawrence in Brampton, Ontario, September 2009.
Section 56 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by Veronica Jenkins. Anatomy of the Human Body, Part 4, by Henry Gray. The External Ear. The external ear consists of the expanded portion named the auricula or pinna and the external acoustic meatus. The former projects from the side of the head and serves to collect the vibrations of the air by which sound is produced. The latter leads inward from the bottom of the auricula and conducts the vibrations to the tympanic cavity. The auricula or pinna is of an ovoid form, with its larger end directed upward. Its lateral surface is irregularly concave, directed slightly forward, and presents numerous eminences and depressions to which names have been assigned. The prominent rim of the auricula is called the helix. Where the helix turned downward behind a small tubercle, the auricular tubercle of Darwin, is frequently seen. This tubercle is very evident about the 6th month of fetal life, when the whole auricula has a close resemblance to that of some of the adult monkeys. Another curved prominence parallel with and in front of the helix is called the antihelix. This divides above into two crura, between which is a triangular depression, the fossa triangularis. The narrow curved depression between the helix and the antihelix is called the scapha. The antihelix describes a curve around a deep capacious cavity, the concha, which is partially divided into two parts by the crus, or commencement of the helix. The upper part is termed the sympa conchae, the lower part the cavum conchae. In front of the concha and projecting backward over the meatus is a small pointed eminence, the tragus, so called from its being generally covered on its under surface with a tuft of hair resembling a goat's beard.
Opposite the tragus, and separated from it by the intertragic notch, is a small tubercle, the antitragus. Below this is the lobule, composed of tough aureliar and adipose tissues, and wanting the firmness and elasticity of the rest of the auricula. The cranial surface of the auricula presents elevations which correspond to the depressions on its lateral surface and after which they are named. Example: eminentia conchi, eminentia triangularis, etc. Structure: the auricula is composed of a thin plate of yellow fibrocartilage covered with integument and connected to the surrounding parts by ligaments and muscles, and to the commencement of the external acoustic meatus by fibrous tissue. The skin is thin, closely adherent to the cartilage, and covered with fine hairs furnished with sebaceous glands, which are most numerous in the concha and scaphoid fossa. On the tragus and antitragus the hairs are strong and numerous. The skin of the auricula is continuous with that lining the external acoustic meatus. The cartilage of the auricula, cartilago auriculae, cartilage of the pinna, consists of a single piece. It gives form to this part of the ear, and upon its surface are found the eminences and depressions above described. It is absent from the lobule. It is deficient also between the tragus and beginning of the helix, the gap being filled up by dense fibrous tissue. At the front part of the auricula, where the helix bends upward, is a small projection of cartilage called the spina helicus, while in the lower part of the helix the cartilage is prolonged downward as a tail-like process, the cauda helicus. This is separated from the antihelix by a fissure, the fissura antitragohelicana. The cranial aspect of the cartilage exhibits a transverse furrow, the sulcus antihelicus transversus, which corresponds with the inferior crus of the antihelix and separates the eminentia conchi from the eminentia triangularis. The eminentia conchi is crossed by a vertical ridge, ponticulus, which gives attachment to the auricularis posterior muscle. In the cartilage of the auricula are two fissures, one behind the crus helicus and another in the tragus. The ligaments of the auricula, ligamenti auricularia, valsalva, ligaments of the pinna, consists of two sets: 1. Extrinsic, connecting it to the side of the head; 2. Intrinsic, connecting various parts of its cartilage together. The extrinsic ligaments are two in number, anterior and posterior. The anterior ligament extends from the tragus and spina helicus to the root of the zygomatic process of the temporal bone. The posterior ligament passes from the posterior surface of the concha to the outer surface of the mastoid process. The chief intrinsic ligaments are: a strong fibrous band stretching from the tragus to the commencement of the helix, completing the meatus in front and partly encircling the boundary of the concha; and b, a band between the antihelix and the cauda helicus. Other less important bands are found on the cranial surface of the pinna. The muscles of the auricula consist of two sets: 1. The extrinsic, which connect it with the skull and scalp and move the auricula as a whole; and 2. The intrinsic, which extend from one part of the auricle to another. The extrinsic muscles are the auricularies anterior, superior, and posterior. The auricularis anterior, attrahens aurum, the smallest of the three, is thin, fan-shaped, and its fibers are pale and indistinct. It arises from the lateral edge of the gallia aponeurotica, and its fibers converge to be inserted into a projection on the front of the helix. The auricularis superior, attalens aurum, the largest of the three, is thin and fan-shaped. Its fibers arise from the gallia aponeurotica and converge to be inserted by a thin, flattened tendon into the upper part of the cranial surface of the auricula. The auricularis posterior, retrahens aurum, consists of 2 or 3 fleshy fasciculi which arise from the mastoid portion of the temporal bone by short aponeurotic fibers. They are inserted into the lower part of the cranial surface of the concha. Actions. In man, these muscles possess very little action. The auricularis anterior draws the auricula forward and upward. The auricularis superior slightly raises it, and the auricularis posterior draws it backward. The intrinsic muscles are the helix major, helix minor, tragus, antetragus, transversus auriculi, obliquus auriculi. The helix major is a narrow vertical band situated upon the anterior margin of the helix. It arises below from the spina helicus and is inserted into the anterior border of the helix just where it is about to curve backward. The helix minor is an oblique fasciculus covering the crus helicus. The tragus is a short, flattened vertical band on the lateral surface of the tragus. The antetragus arises from the outer part of the antetragus and is inserted into the cauda helicus and antehelix. The transversus auriculi is placed on the cranial surface of the pinna. It consists of scattered fibers, partly tendinous and partly muscular, extending from the eminentia conchae to the prominence corresponding with the scapha. The obliquus auriculi, also on the cranial surface, consists of a few fibers extending from the upper and back part of the concha to the convexity immediately above it. Nerves. The auricularies anterior and superior and the intrinsic muscles on the lateral surface are supplied by the temporal branch of the facial nerve, the auricularis posterior, and the intrinsic muscles on the cranial surface by the posterior auricular branch of the same nerve. The arteries of the auricula are the posterior auricular from the external carotid, the anterior auricular from the superficial temporal, and a branch from the occipital artery. The veins accompany the corresponding arteries. The sensory nerves are the great auricular from the cervical plexus, the auricular branch of the vagus, the auriculotemporal branch of the mandibular nerve, and the lesser occipital from the cervical plexus. The external acoustic meatus, meatus acousticus externus, external auditory canal or meatus, extends from the bottom of the concha to the tympanic membrane. It is about 4 centimeters in length if measured from the tragus. From the bottom of the concha its length is about 2.5 centimeters. It forms an S-shaped curve and is directed at first inward, forward, and slightly upward, pars externa. It then passes inward and backward, pars media, and lastly is carried inward, forward, and slightly downward, pars interna. It is an oval cylindrical canal, the greatest diameter being directed downward and backward at the external orifice, but nearly horizontally at the inner end. It presents 2 constrictions, one near the inner end of the cartilaginous portion, and another, the isthmus, in the osseous portion, about 2 centimeters from the bottom of the concha. The tympanic membrane, which closes the inner end of the meatus, is obliquely directed. In consequence of this, the floor and anterior wall of the meatus are longer than the roof and posterior wall. The external acoustic meatus is formed partly by cartilage and membrane and partly by bone, and is lined by skin. The cartilaginous portion, meatus acousticus externus cartilagineus, is about 8 millimeters in length. It is continuous with the cartilage of the auricula and firmly attached to the circumference of the auditory process of the temporal bone. The cartilage is deficient at the upper and back part of the meatus, its place being supplied by fibrous membrane. 2 or 3 deep fissures are present in the anterior part of the cartilage. The osseous portion, meatus acousticus externus osseus, is about 16 millimeters in length and is narrower than the cartilaginous portion. It is directed inward and a little forward, forming in its course a slight curve, the convexity of which is upward and backward. Its inner end is smaller than the outer and sloped, the anterior wall projecting beyond the posterior for about 4 millimeters. It is marked except at its upper part by a narrow groove, the tympanic sulcus, in which the circumference of the tympanic membrane is attached. Its outer end is dilated and rough in the greater part of its circumference, for the attachment of the cartilage of the auricula. The front and lower parts of the osseous portion are formed by a curved plate of bone, the tympanic part of the temporal, which in the fetus exists as a separate ring, annulus tympanicus, incomplete at its upper part. The skin lining the meatus is very thin, adheres closely to the cartilaginous and osseous portions of the tube, and covers the outer surface of the tympanic membrane. After maceration, the thin pouch of epidermis, when withdrawn, preserves the form of the meatus. In the thick subcutaneous tissue of the cartilaginous part of the meatus are numerous ceruminous glands, which secrete the earwax. Their structure resembles that of the sudoriferous glands. Relations of the meatus. In front of the osseous part is the condyle of the mandible, which, however, is frequently separated from the cartilaginous part by a portion of the parotid gland. The movements of the jaw influence to some extent the lumen of this latter portion. Behind the osseous part are the mastoid air cells, separated from the meatus by a thin layer of bone. The arteries supplying the meatus are branches from the posterior auricular, internal maxillary, and temporal. The nerves are chiefly derived from the auriculotemporal branch of the mandibular nerve and the auricular branch of the vagus. End of section 56. Recording by Veronica Jenkins, Ottawa, Illinois.
Section 57 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by Anna Simon. Anatomy of the Human Body, Part 4 by Henry Gray. 1D.2. The middle ear, or tympanic cavity. Cavum tympani, drum, tympanum. The middle ear, or tympanic cavity, is an irregular, laterally compressed space within the temporal bone. It is filled with air, which is conveyed to it from the nasal part of the pharynx through the auditory tube. It contains a chain of movable bones, which connect its lateral to its medial wall, and serve to convey the vibrations communicated to the tympanic membrane across the cavity to the internal ear. The tympanic cavity consists of two parts, the tympanic cavity proper, opposite the tympanic membrane, and the attic, or epitympanic recess, above the level of the membrane. The latter contains the upper half of the malleus and the greater part of the incus. Including the attic, the vertical and anteroposterior diameters of the cavity are each about 15 mm. The transverse diameter measures about 6 mm above and 4 mm below. Opposite the center of the tympanic membrane it is only about 2 mm. The tympanic cavity is bounded laterally by the tympanic membrane, medially by the lateral wall of the internal ear. It communicates behind with the tympanic antrum, and through it with the mastoid air cells, and in front with the auditory tube. The tegmental wall or roof, parius tegmentalis, is formed by a thin plate of bone, the tegmen tympani, which separates the cranial and tympanic cavities. It is situated on the anterior surface of the petrous portion of the temporal bone, close to its angle of junction with the squama temporalis. It is prolonged backward so as to roof in the tympanic antrum, and forward to cover in the semicanal for the tensor tympani muscle. Its lateral edge corresponds with the remains of the petrosquamous suture. The jugular wall or floor (pares jugularis) is narrow and consists of a thin plate of bone (fundus tympani) which separates the tympanic cavity from the jugular fossa. It presents, near the labyrinthic wall, a small aperture for the passage of the tympanic branch of the glossopharyngeal nerve. The membranous or lateral wall (pares membranacea, outer wall) is formed mainly by the tympanic membrane, partly by the ring of bone into which this membrane is inserted. This ring of bone is incomplete at its upper part, forming a notch of Rivenus, close to which are three small apertures, the iter chordi posterius, the petrotympanic fissure, and the iter chordi anterius. The iter chordi posterius, apertura tympanica canaliculi chordi, is situated in the angle of junction between the mastoid and membranous wall of the tympanic cavity, immediately behind the tympanic membrane, and on a level with the upper end of the manubrium of the malleus. It leads into a minute canal, which descends in front of the canal for the facial nerve, and ends in that canal near the stylomastoid foramen. Through it the chorda tympani nerve enters the tympanic cavity. The petrotympanic fissure (Fissura petrotympanica, Glaserian fissure) opens just above and in front of the ring of bone into which the tympanic membrane is inserted. In this situation it is a mere slit about 2 mm in length. It lodges the anterior process and anterior ligament of the malleus, and gives passage to the anterior tympanic branch of the internal maxillary artery. The iter chordi anterius, canal of Huguier, is placed at the medial end of the petrotympanic fissure. Through it the chorda tympani nerve leaves the tympanic cavity. The tympanic membrane, membrana tympani, separates the tympanic cavity from the bottom of the external acoustic meatus. It is a thin, semi-transparent membrane, nearly oval in form, somewhat broader above than below, and directed very obliquely downward and inward, so as to form an angle of about 55 degrees with the floor of the meatus. Its longest diameter is downward and forward, and measures from 9 to 10 mm. Its shortest diameter measures from 8 to 9 mm. The greater part of its circumference is thickened, and forms a fibrocartilaginous ring, which is fixed in the tympanic sulcus at the inner end of the meatus. This sulcus is deficient superiorly at the notch of Rivenus, and from the ends of this notch two bands, the anterior and posterior malleolar folds, are prolonged to the lateral process of the malleus. The small, somewhat triangular part of the membrane situated above these folds is lax and thin, and is named the pars flaccida. In it a small orifice is sometimes seen. The manubrium of the malleus is firmly attached to the medial surface of the membrane as far as its centre, which it draws toward the tympanic cavity. The lateral surface of the membrane is thus concave, and the most depressed part of this concavity is named the umbo. Structure. The tympanic membrane is composed of three strata: a lateral, cutaneous, an intermediate, fibrous, and a medial, mucous. The cutaneous stratum is derived from the integument lining the meatus. The fibrous stratum consists of two layers: a radiate stratum, the fibers of which diverge from the manubrium of the malleus, and a circular stratum, the fibers of which are plentiful around the circumference, but sparse and scattered near the centre of the membrane. Branched or dendritic fibers, as pointed out by Gruber, are also present, especially in the posterior half of the membrane. Vessels and nerves. The arteries of the tympanic membrane are derived from the deep auricular branch of the internal maxillary, which ramifies beneath the cutaneous stratum, and from the stylomastoid branch of the posterior auricular and tympanic branch of the internal maxillary, which are distributed on the mucous surface. The superficial veins open into the external jugular, Those on the deep surface drain partly into the transverse sinus and veins of the dura mater, and partly into a plexus on the auditory tube. The membrane receives its chief nerve supply from the auriculo-temporal branch of the mandibular. The auricular branch of the vagus and the tympanic branch of the glossopharyngeal also supply it. The labyrinthic or medial wall, Parius labyrinthica, inner wall, is vertical in direction, and presents for examination the fenestri vestibuli and cochleae, the promontory, and the prominence of the facial canal. The fenestra vestibuli, fenestra ovalis, is a reniform opening leading from the tympanic cavity into the vestibule of the internal ear. Its long diameter is horizontal, and its convex border is upward. In the recent state it is occupied by the base of the stapes, the circumference of which is fixed by the annular ligament to the margin of the foramen. The fenestra cochleae, fenestra rotunda, is situated below and a little behind the fenestra vestibuli, from which it is separated by a rounded elevation, the promontory. It is placed at the bottom of a funnel-shaped depression, and, in the macerated bone, leads into the cochlea of the internal ear. In the fresh state it is closed by a membrane, the secondary tympanic membrane, which is concave towards the tympanic cavity, convex towards the cochlea. This membrane consists of 3 layers, an external, or mucus, derived from the mucous lining of the tympanic cavity, an internal, from the lining membrane of the cochlea, and an intermediate or fibrous layer. The promontory, promontorium, is a rounded hollow prominence formed by the projection outward of the first turn of the cochlea. It is placed between the fenestri, and it is furrowed on its surface by small grooves for the lodgment of branches of the tympanic plexus. A minute spicule of bone frequently connects the promontory to the pyramidal eminence. The prominence of the facial canal, prominentia canalis facialis, prominence of aqueduct of Fallopius, indicates the position of the bony canal in which the facial nerve is contained. This canal traverses the labyrinthic wall of the tympanic cavity above the fenestra vestibuli, and behind that opening curves nearly vertically downward along the mastoid wall. The mastoid or posterior wall, Parius mastoidea, is wider above than below, and presents for examination the entrance to the tympanic antrum, the pyramidal eminence, and the fossa incutis. The entrance to the antrum is a large irregular aperture, which leads backward from the epitympanic recess into a considerable air space, named the tympanic or mastoid antrum. The antrum communicates behind and below with the mastoid air cells, which vary considerably in number, size, and form. The antrum and mastoid air cells are lined by mucous membrane, continuous with that lining the tympanic cavity. On the medial wall of the entrance to the antrum is a rounded eminence, situated above and behind the prominence of the facial canal. It corresponds with the position of the ampulated ends of the superior and lateral semicircular canals. The pyramidal eminence, eminentia pyramidalis, pyramid, is situated immediately behind the fenestra vestibuli, and in front of the vertical portion of the facial canal. It is hollow and contains the stapedius muscle. Its summit projects forward toward the fenestra vestibuli, and is pierced by a small aperture which transmits the tendon of the muscle. The cavity in the pyramidal eminence is prolonged downward and backward in front of the facial canal, and communicates with it by a minute aperture which transmits a twig from the facial nerve to the stapedius muscle. The fossa incutis is a small depression in the lower and back part of the epitympanic recess. It lodges the short crus of the incus. The carotid or anterior wall, Parius carotica, is wider above than below. It corresponds with the carotid canal, from which it is separated by a thin plate of bone perforated by the tympanic branch of the internal carotid artery, and by the deep petrosal nerve which connects the sympathetic plexus on the internal carotid artery with the tympanic plexus on the promontory. At the upper part of the anterior wall are the orifice of the semicanal for the tensor tympani muscle and the tympanic orifice of the auditory tube, separated from each other by a thin horizontal plate of bone, the septum canalus musculotuberi. These canals run from the tympanic cavity forward and downward to the retiring angle between the squama and the petrous portion of the temporal bone. The semicanal for the tensor tympani, semicanalus and tensoris tympani, is the superior and the smaller of the two. It is cylindrical and lies beneath the tegmen tympani. It extends on to the labyrinthic wall of the tympanic cavity and ends immediately above the fenestra vestibuli. The septum canalis musculotuberi, processus cochleariformis, passes backward below this semicanal, forming its lateral wall and floor. It expands above the anterior end of the fenestra vestibuli and terminates there by curving laterally so as to form a pulley over which the tendon of the muscle passes. The auditory tube, tuba auditiva, Eustachian tube, is a channel through which the tympanic cavity communicates with the nasal part of the pharynx. Its length is about 36 mm, and its direction is downward, forward, and medialward, forming an angle of about 45 degrees with the sagittal plane and one from 30 to 40 degrees with the horizontal plane. It is formed partly of bone, partly of cartilage and fibrous tissue. The osseous portion, pars osseo tubi auditivi, is about 12 mm in length. It begins in the carotid wall of the tympanic cavity, below the septum canalis musculotuberi, and gradually narrowing ends at the angle of junction of the squama and the petrous portion of the temporal bone, its extremity presenting a jagged margin which serves for the attachment of the cartilaginous portion. The cartilaginous portion, pars cartilaginea tubi auditivi, about 24 mm in length, is formed of a triangular plate of elastic fibre cartilage, the apex of which is attached to the margin of the medial end of the osseous portion of the tube, while its base lies directly under the mucous membrane of the nasal part of the pharynx, where it forms an elevation, the torus tubarius or cushion, behind the pharyngeal orifice of the tube. The upper edge of the cartilage is curled upon itself, being bent laterally so as to present on transverse section the appearance of a hook. A groove or furrow is thus produced, which is open below and laterally, and this part of the canal is completed by a fibrous membrane. The cartilage lies in a groove between the petrous part of the temporal and the great wing of the sphenoid. This groove ends opposite the middle of the medial pterygoid plate. The cartilaginous and bony portions of the tube are not in the same plane, the former inclining downward a little more than the latter. The diameter of the tube is not uniform throughout, being greatest at the pharyngeal orifice, least at the junction of the bony and cartilaginous portions, and again increased towards the tympanic cavity. The narrowest part of the tube is termed the isthmus. The position and relations of the pharyngeal orifice are described with the nasal part of the pharynx. The mucous membrane of the tube is continuous in front with that of the nasal part of the pharynx, and behind with that of the tympanic cavity. It is covered with ciliated epithelium, and is thin in the osseous portion, while in the cartilaginous portion it contains many mucous glands, and near the pharyngeal orifice a considerable amount of adenoid tissue, which has been named by Gerlach the tube tonsil. The tube is opened during deglutition by the salpingopharyngeus and dilatator tubi. The latter arises from the hook of the cartilage and from the membranous part of the tube, and blends below with the tensor villi palatini. End of section 57.
Section 58 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Read by Laurie Anne Walden. Anatomy of the Human Body, Part 4, by Henry Gray. The Auditory Ossicles, Ossicula Auditus. The tympanic cavity contains a chain of 3 movable ossicles, the malleus, incus, and stapes. The first is attached to the tympanic membrane, the last to the circumference of the fenestra vestibuli, the incus being placed between and connected to both by delicate articulations. The malleus, so named from its fancied resemblance to a hammer, consists of a head, neck, and 3 processes. These are the manubrium, the anterior and lateral processes. The head, capitulum mallei, is the large upper extremity of the bone. It is oval in shape, and articulates posteriorly with the incus, being free in the rest of its extent. The facet for articulation with the incus is constricted near the middle, and consists of an upper, larger, and lower, smaller part, which form nearly a right angle with each other. Opposite the constriction, the lower margin of the facet projects in the form of a process, the cog tooth or spur of the malleus. The neck, column mallei, is the narrow contracted part just beneath the head. Below it is a prominence, to which the various processes are attached. The manubrium mallei, handle, is connected by its lateral margin with the tympanic membrane. It is directed downward, medialward, and backward. It decreases in size toward its free end, which is curved slightly forward and flattened transversely. On its medial side, near its upper end, is a slight projection, into which the tendon of the tensor tympani is inserted. The anterior process, processus anterior, folii, processus gracilis, is a delicate spicule which springs from the eminence below the neck and is directed forward to the petrotympanic fissure, to which it is connected by ligamentous fibers. In the fetus this is the longest process of the malleus, and is in direct continuity with the cartilage of Meckel. The lateral process, processus lateralis, processus brevis, is a slight conical projection which springs from the root of the manubrium. It is directed laterally, and is attached to the upper part of the tympanic membrane, and, by means of the anterior and posterior malleolar folds, to the extremities of the notch of Rivinus. The incus has received its name from its supposed resemblance to an anvil, but it is more like a premolar tooth with 2 roots, which differ in length, and are widely separated from each other. It consists of a body and 2 crura. The body, corpus incutus, is somewhat cubical, but compressed transversely. On its anterior surface is a deeply concavo-convex facet, which articulates with the head of the malleus. The 2 crura diverge from one another nearly at right angles. The short crus breve, short process, somewhat conical in shape, projects almost horizontally backward, and is attached to the fossa incutus and the lower and back part of the epitympanic recess. The long crus longum, long process, descends nearly vertically behind and parallel to the manubrium of the malleus, and bending medialward ends in a rounded projection, the lenticular process, which is tipped with cartilage and articulates with the head of the stapes. The stapes, so called from its resemblance to a stirrup, consists of a head, neck, 2 crura, and a base. The head, capitulum stapetus, presents a depression, which is covered by cartilage and articulates with the lenticular process of the incus. The neck, the constricted part of the bone succeeding the head, gives insertion to the tendon of the stapedius muscle. The 2 crura, crus anterius and crus posterius, diverge from the neck and are connected at their ends by a flattened oval plate, the base, basis stapedis, which forms the footplate of the stirrup, and is fixed to the margin of the fenestra vestibuli by a ring of ligamentous fibers. Of the 2 crura, the anterior is shorter and less curved than the posterior. Articulations of the auditory ossicles, articulationes ossiculorum auditus. The incudo-malleolar joint is a saddle-shaped diarthrosis. It is surrounded by an articular capsule, and the joint cavity is incompletely divided into 2 by a wedge-shaped articular disc or meniscus. The incudostapedial joint is an inarthrosis, surrounded by an articular capsule. Some observers have described an articular disc or meniscus in this joint. Others regard the joint as a syndesmosis. Ligaments of the ossicles, Ligamenta ossiculorum auditus. The ossicles are connected with the walls of the tympanic cavity by ligaments, 3 for the malleus, and 1 each for the incus and stapes. The anterior ligament of the malleus, Ligamentum mallei anterius, is attached by one end to the neck of the malleus, just above the anterior process, and by the other to the anterior wall of the tympanic cavity, close to the petrotympanic fissure, some of its fibers being prolonged through the fissure to reach the spina angularis of the sphenoid. The superior ligament of the malleus, Ligamentum mallei superius, is a delicate, round bundle which descends from the roof of the epitympanic recess to the head of the malleus. The lateral ligament of the malleus, Ligamentum mallei laterali, external ligament of the malleus, is a triangular band passing from the posterior part of the notch of Rivenus to the head of the malleus. Helmholtz described the anterior ligament and the posterior part of the lateral ligament as forming together the axis ligament around which the malleus rotates. The posterior ligament of the incus, Ligamentum incutus posterius, is a short, thick band connecting the end of the short crus of the incus to the fossa incutus. A superior ligament of the incus, Ligamentum incutus superius, has been described, but it is little more than a fold of mucous membrane. The vestibular surface and the circumference of the base of the stapes are covered with hyaline cartilage. That encircling the base is attached to the margin of the fenestra vestibuli by a fibrous ring, the annular ligament of the base of the stapes, Ligamentum annulari baseos stapedis. The muscles of the tympanic cavity, musculi ossiculorum auditus, are the tensor tympani and stapedius. The tensor tympani, the larger, is contained in the bony canal above the osseous portion of the auditory tube, from which it is separated by the septum canalis musculotubarii. It arises from the cartilaginous portion of the auditory tube and the adjoining part of the great wing of the sphenoid, as well as from the osseous canal in which it is contained. Passing backward through the canal, it ends in a slender tendon which enters the tympanic cavity, makes a sharp bend around the extremity of the septum, and is inserted into the manubrium of the malleus, near its root. It is supplied by a branch of the mandibular nerve through the otic ganglion. The stapedius arises from the wall of a conical cavity, hollowed out of the interior of the pyramidal eminence. Its tendon emerges from the orifice at the apex of the eminence, and, passing forward, is inserted into the posterior surface of the neck of the stapes. It is supplied by a branch of the facial nerve. Actions. The tensor tympani draws the tympanic membrane medialward, and thus increases its tension. The stapedius pulls the head of the stapes backward, and thus causes the base of the bone to rotate on a vertical axis drawn through its own center. The back part of the base is pressed inward toward the vestibule, while the fore part is withdrawn from it. By the action of the muscle the tension of the fluid within the internal ear is probably increased. The mucous membrane of the tympanic cavity is continuous with that of the pharynx through the auditory tube. It invests the auditory ossicles, and the muscles and nerves contained in the tympanic cavity, forms the medial layer of the tympanic membrane, and the lateral layer of the secondary tympanic membrane, and is reflected into the tympanic antrum and mastoid cells, which it lines throughout. It forms several vascular folds, which extend from the walls of the tympanic cavity of the ossicles. Of these, one descends from the root of the cavity to the head of the malleus and upper margin of the body of the incus. A second invests the stapedius muscle. Other folds invest the chorda tympani nerve and the tensor tympani muscle. These folds separate off pouch-like cavities and give the interior of the tympanum a somewhat honeycombed appearance. One of these pouches, the pouch of Prasac, is well marked and lies between the neck of the malleus and the membrana flaccida. Two other recesses may be mentioned. They are formed by the mucous membrane which envelops the chorda tympani nerve, and are situated, one in front of, and the other behind, the manubrium of the malleus. They are named the anterior and posterior recesses of Troeltsch. In the tympanic cavity this membrane is pale, thin, slightly vascular, and covered, for the most part, with columnar ciliated epithelium, but over the pyramidal eminence, ossicles, and tympanic membrane it possesses a flattened, non-ciliated epithelium. In the tympanic antrum and mastoid cells its epithelium is also non-ciliated. In the osseous portion of the auditory tube the membrane is thin, but in the cartilaginous portion it is very thick, highly vascular, and provided with numerous mucous glands. The epithelium which lines the tube is columnar and ciliated. Vessels and nerves. The arteries are 6 in number. 2 of them are larger than the others. These are the tympanic branch of the internal maxillary, which supplies the tympanic membrane, and the stylomastoid branch of the posterior auricular, which supplies the back part of the tympanic cavity and mastoid cells. The smaller arteries are the petrosal branch of the middle meningeal, which enters through the hiatus of the facial canal, a branch from the ascending pharyngeal, and another from the artery of the pterygoid canal, which accompany the auditory tube, and the tympanic branch from the internal carotid, given off in the carotid canal and perforating the thin anterior wall of the tympanic cavity. The veins terminate in the pterygoid plexus and the superior petrosal sinus. The nerves constitute the tympanic plexus, which ramifies upon the surface of the promontory. The plexus is formed by 1. The tympanic branch of the glossopharyngeal, 2. The carotico-tympanic nerves, 3. The smaller superficial petrosal nerve, and 4. A branch which joins the greater superficial petrosal. The tympanic branch of the glossopharyngeal, Jacobson's nerve, enters the tympanic cavity by an aperture in its floor close to the labyrinthic wall, and divides into branches which ramify on the promontory and enter into the formation of the tympanic plexus. The superior and inferior carotico-tympanic nerves from the carotid plexus of the sympathetic pass through the wall of the carotid canal, and join the branches of the tympanic branch of the glossopharyngeal. The branch to the greater superficial petrosal passes through an opening on the labyrinthic wall in front of the fenestra vestibuli. The smaller superficial petrosal nerve, from the otic ganglion, passes backward through a foramen in the middle fossil of the base of the skull, sometimes through the foramen ovale, and enters the anterior surface of the petrous part of the temporal bone through a small aperture, situated lateral to the hiatus of the facial canal. It courses downward through the bone, past the genicular ganglion of the facial nerve, receiving a connecting filament from it, and enters the tympanic cavity where it communicates with the tympanic branch of the glossopharyngeal and assists in forming the tympanic plexus. The branches of distribution of the tympanic plexus are supplied to the mucous membrane of the tympanic cavity. A branch passes to the fenestra vestibuli, another to the fenestra cochleae, and a third to the auditory tube. The smaller superficial petrosal may be looked upon as the continuation of the tympanic branch of the glossopharyngeal through the plexus to the otic ganglion. In addition to the tympanic plexus there are the nerves supplying the muscles. The tensor tympani is supplied by a branch from the mandibular through the otic ganglion, and the stapedius by a branch from the facial. The chorda tympani nerve crosses the tympanic cavity. It is given off from the sensory part of the facial, about 6 mm before the nerve emerges from the stylomastoid foramen. It runs from below upward and forward in a canal, and enters the tympanic cavity through the iter chordae posterius, and becomes invested with mucous membrane. It traverses the tympanic cavity, crossing medial to the tympanic membrane and over the upper part of the manubrium of the malleus to the carotid wall, where it emerges through the iter chordae anterius, canal of Eugaea. End of section 58.
Section 59 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. The Internal Ear or Labyrinth, Part 1. 1d4. The internal ear or labyrinth. Oris interna. The internal ear is the essential part of the organ of hearing, receiving the ultimate distribution of the auditory nerve. It is called the labyrinth from the complexity of its shape, and consists of two parts: the osseous labyrinth, a series of cavities within the petrous part of the temporal bone, and the membranous labyrinth, a series of communicating membranous sacs and ducts contained within the bony cavities. The osseous labyrinth, Labyrinthus osseus. The osseous labyrinth consists of three parts: the vestibule, semicircular canals, and cochlea. These are cavities hollowed out of the substance of the bone and lined by periosteum. They contain a clear fluid, the perilymph, in which the membranous labyrinth is situated. The vestibule, vestibulum. The vestibule is the central part of the osseous labyrinth, and is situated medial to the tympanic cavity, behind the cochlea, and in front of the semicircular canals. It is somewhat ovoid in shape, but flattened transversely. It measures about 5 mm from before backward, and the same from above downward, and about 3 mm across. In its lateral or tympanic wall is the fenestra vestibuli, closed in the fresh state by the base of the stapes and annular ligament. On the medial wall, at the forepart, is a small circular depression, the recessus sphericus, which is perforated, at its anterior and inferior part, by several minute holes, macula cribrosa media, for the passage of filaments of the acoustic nerve to the saccule, and behind this depression is an oblique ridge, the crista vestibuli, the anterior end of which is named the pyramid of the vestibule. This ridge bifurcates below to enclose a small depression, the fossa cochlearis, which is perforated by a number of holes for the passage of filaments of the acoustic nerve which supply the vestibular end of the ductus cochlearis. At the hinder part of the medial wall is the orifice of the aqueductus vestibuli, which extends to the posterior surface of the petrous portion of the temporal bone. It transmits a small vein, and contains a tubular prolongation of the membranous labyrinth, the ductus endolymphaticus, which ends in a cul-de-sac between the layers of the dura mater within the cranial cavity. On the upper wall or roof is a transversely oval depression, the recessus ellipticus, separated from the recessus sphericus by the crista vestibuli already mentioned. The pyramid and adjoining part of the recessus ellipticus are perforated by a number of holes, macula cribrosa superior. The apertures in the pyramid transmit the nerves to the utricle, those in the recessus ellipticus the nerves to the ampullae of the superior and lateral semicircular ducts. Behind are the 5 orifices of the semicircular canals. In front is an elliptical opening, which communicates with the scala vestibuli of the cochlea. The bony semicircular canals, canales semicircularis ossei. The bony semicircular canals are 3 in number, superior, posterior, and lateral, and are situated above and behind the vestibule. They are unequal in length, compressed from side to side, and each describes the greater part of a circle. Each measures about 0.8 mm in diameter, and presents a dilation at one end, called the ampulla, which measures more than twice the diameter of the tube. They open into the vestibule by 5 orifices, one of the apertures being common to 2 of the canals. The superior semicircular canal, canalis semicircularis superior, 15 to 20 mm in length, is vertical in direction, and is placed transversely to the long axis of the petrous portion of the temporal bone, on the anterior surface of which its arch forms a round projection. It describes about 2/3 of a circle. Its lateral extremity is ampullated, and opens into the upper part of the vestibule. The opposite end joins with the upper part of the posterior canal to form the crus commune, which opens into the upper and medial part of the vestibule. The posterior semicircular canal, canalis semicircularis posterior, also vertical, is directed backward, nearly parallel to the posterior surface of the petrous bone. It is the longest of the 3, measuring from 18 to 22 mm. Its lower or ampullated end opens into the lower and back part of the vestibule, its upper into the crus commune already mentioned. The lateral or horizontal canal, canalis semicircularis lateralis, external semicircular canal, is the shortest of the 3. It measures from 12 to 15 mm, and its arches directed horizontally backward and lateralward. Thus each semicircular canal stands at right angles to the other two. Its ampullated end corresponds to the upper and lateral angle of the vestibule, just above the fenestra vestibuli, where it opens close to the ampullated end of the superior canal. Its opposite end opens at the upper and back part of the vestibule. The lateral canal of one ear is very nearly in the same plane as that of the other, while the superior canal of one ear is nearly parallel to the posterior canal of the other. The cochlea. The cochlea bears some resemblance to a common snail shell. It forms the anterior part of the labyrinth, is conical in form, and placed almost horizontally in front of the vestibule. Its apex, cupula, is directed forward and lateralward, with a slight inclination downward, toward the upper and front part of the labyrinthic wall of the tympanic cavity. Its base corresponds with the bottom of the internal acoustic meatus, and is perforated by numerous apertures for the passage of the cochlear division of the acoustic nerve. It measures about 5 mm from base to apex, and its breadth across the base is about 9 mm. It consists of a conical-shaped central axis, the modiolus, of a canal, the inner wall of which is formed by the central axis, wound spirally around it for 2 turns and 3/4. From the base to the apex, and of a delicate lamina, the osseous spiral lamina, which projects from the modiolus, and, following the windings of the canal, partially subdivides it into two. In the recent state a membrane, the basilar membrane, stretches from the free border of this lamina to the outer wall of the bony cochlea and completely separates the canal into 2 passages, which however communicate with each other at the apex of the modiolus by a small opening named the helicotrema. The modiolus is the conical central axis or pillar of the cochlea. Its base is broad and appears at the bottom of the internal acoustic meatus, where it corresponds with the area cochleae. It is perforated by numerous orifices which transmit filaments of the cochlear division of the acoustic nerve. The nerves for the first tone and a half pass through the foramina of the tractus spiralis foraminosus, those for the apical tone through the foramen centrale. The canals of the tractus spiralis foraminosus pass up through the modiolus and successively bend outward to reach the attached margin of the lamina spiralis ossea. Here they become enlarged, and by their apposition form the spiral canal of the modiolus, which follows the course of the attached margin of the osseous spiral lamina and lodges the spiral ganglion of Corti. The foramen centrale is continued into a canal which runs up the middle of the modiolus to its apex. The modiolus diminishes rapidly in size in the second and succeeding coil. The bony canal of the cochlea takes 2 turns and 3/4 around the modiolus. It is about 30 mm in length, and diminishes gradually in diameter from the base to the summit, where it terminates in the cupula, which forms the apex of the cochlea. The beginning of this canal is about 3 mm in diameter. It diverges from the modiolus toward the tympanic cavity and vestibule, and presents 3 openings. 1. The fenestra cochleae communicates with the tympanic cavity. In the fresh state this aperture is closed by the secondary tympanic membrane. Another, of an elliptical form, opens into the vestibule. The third is the aperture of the aqueductus cochleae, leading to a minute funnel-shaped canal, which opens on the inferior surface of the petrous part of the temporal bone and transmits a small vein, and also forms a communication between the subarachnoid cavity and the scala tympani. The osseous spiral lamina, lamina spiralis ossea, is a bony shelf or ledge which projects from the modiolus into the interior of the canal, and, like the canal, takes 2 3/4 turns around the modiolus. It reaches about halfway toward the outer wall of the tube, and partially divides its cavity into 2 passages or scalae, of which the upper is named the scala vestibuli, while the lower is termed the scala tympani. Near the summit of the cochlea the lamina ends in a hook-shaped process, the hamulus laminae spiralis. This assists in forming the boundary of the small opening, the helicotrema, through which the 2 scalae communicate with each other. From the spiral canal of the modiolus, numerous canals pass outward through the osseous spiral lamina as far as its free edge. In the lower part of the first tone a second bony lamina, the secondary spiral lamina, projects inward from the outer wall of the bony tube. It does not, however, reach the primary osseous spiral lamina, so that if viewed from the vestibule, a narrow fissure, the vestibule fissure, is seen between them. The osseous labyrinth is lined by an exceedingly thin fibro-serous membrane. Its attached surface is rough and fibrous, and closely adherent to the bone. Its free surface is smooth and pale, covered with a layer of epithelium, and secretes a thin, limpid fluid, the perilymph. A delicate tubular process of this membrane is prolonged along the aqueduct of the cochlea to the inner surface of the dura mater. The membranous labyrinth. Labyrinthus membranaceus. The membranous labyrinth is lodged within the bony cavities just described, and has the same general form as these. It is, however, considerably smaller, and is partly separated from the bony walls by a quantity of fluid, the perilymph. In certain places it is fixed to the walls of the cavity. The membranous labyrinth contains fluid, the endolymph, and on its walls the ramifications of the acoustic nerve are distributed. Within the osseous vestibule the membranous labyrinth does not quite preserve the form of the bony cavity, but consists of two membranous sacs, the utricle and the saccule. The utricle, utriculus. The utricle, the larger of the two, is of an oblong form, compressed transversely, and occupies the upper and back part of the vestibule, lying in contact with the recessus ellipticus and the part below it. That portion which is lodged in the recess forms a sort of pouch or cul-de-sac, the floor and anterior wall of which are thickened, and form the macula acoustica utriculi, which receives the utricular filaments of the acoustic nerve. The cavity of the utricle communicates behind with the semicircular ducts by 5 orifices. From its anterior wall is given off the ductus utriculo-saccularis, which opens into the ductus endolymphaticus. The saccule, sacculus. The saccule is the smaller of the two vestibular sacs. It is globular in form and lies in the recessus sphericus near the opening of the scala vestibuli of the cochlea. Its anterior part exhibits an oval thickening, the macula acoustica sacculi, to which are distributed the saccular filaments of the acoustic nerve. Its cavity does not directly communicate with that of the utricle. From the posterior wall a canal, the ductus endolymphaticus, is given off. This duct is joined by the ductus utriculo-saccularis, and then passes along the aqueductus vestibuli and ends in a blind pouch, saccus endolymphaticus, on the posterior surface of the petrous portion of the temporal bone, where it is in contact with the dura mater. From the lower part of the saccule a short tube, the canalus reuniens of Hensen, passes downward and opens into the ductus cochlearis near its vestibular extremity. The semicircular ducts. Ductus semicircularis, membranous semicircular canals. The semicircular ducts are about 1/4 of the diameter of the osseous canals, but in number, shape, and general form they are precisely similar, and each presents at one end an ampulla. They open by 5 orifices into the utricle, one opening being common to the medial end of the superior and the upper end of the posterior duct. In the ampullae the wall is thickened and projects into the cavity as a fiddle-shaped, transversely placed elevation, the septum transversum, in which the nerves end. The utricle, saccule, and semicircular ducts are held in position by numerous fibrous bands which stretch across the space between them and the bony walls. Structure. The walls of the utricle, saccule, and semicircular ducts consist of 3 layers. The outer layer is a loose and flocculent structure, apparently composed of ordinary fibrous tissue containing blood vessels and some pigment cells. The middle layer, thicker and more transparent, forms a homogeneous membrana propria, and presents on its internal surface, especially in the semicircular ducts, numerous papilliform projections, which, on the addition of acetic acid, exhibit an appearance of longitudinal fibrillation. The inner layer is formed of polygonal nucleated epithelial cells. In the maculae of the utricle and saccule, and in the transverse septa of the ampullae of the semicircular ducts, the middle coat is thickened, and the epithelium is columnar, and consists of supporting cells and hair cells. The former are fusiform, and their deep ends are attached to the membrana propria, while their free extremities are united to form a thin cuticle. The hair cells are flask-shaped, and their deep, rounded ends do not reach the membrana propria, but lie between the supporting cells. The deep part of each contains a large nucleus, while its more superficial part is granular and pigmented. The free end is surmounted by a long, tapering, hair-like filament which projects into the cavity. The filaments of the acoustic nerve enter these parts, and having pierced the outer and middle layers, they lose their medullary sheaths, and their axis cylinders ramify between the hair cells. Two rounded bodies, termed otoconia, each consisting of a mass of minute crystalline grains of carbonate of lime, held together in a mesh of gelatinous tissue, are suspended in the endolymph in contact with the free ends of the hairs projecting from the maculae. According to Bowman, a calcareous material is also sparingly scattered in the cells lining the ampullae of the semicircular ducts. End of section 59. Section 60 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. The Internal Ear or Labyrinth, Part 2. The ductus cochlearis, membranous cochlea, scala media. The ductus cochlearis consists of a spirally arranged tube enclosed in the bony canal of the cochlea and lying along its outer wall. As already stated, the osseous spiral lamina extends only part of the distance between the modiolus and the outer wall of the cochlea, while the basilar membrane stretches from its free edge to the outer wall of the cochlea and completes the roof of the scala tympani. A second and more delicate membrane, the vestibular membrane, res neri, extends from the thickened periosteum covering the osseous spiral lamina to the outer wall of the cochlea, where it is attached at some little distance above the outer edge of the basilar membrane. A canal is thus shut off between the scala tympani below and the scala vestibuli above. This is the ductus cochlearis, or scala media. It is triangular on transverse section, its roof being formed by the vestibular membrane, its outer wall by the periosteum lining the bony canal, and its floor by the membrana basilaris and the outer part of the lamina spiralis ossea. Its extremities are closed. The upper is termed the lagina and is attached to the cupula at the upper part of the helicotrema. The lower is lodged in the recessus cochlearis of the vestibule. Near the lower end the ductus cochlearis is brought into continuity with the saccule by a narrow short canal, the canalis reuniens of Hensen. On the membrana basilaris is situated the spiral organ of Corti. The vestibular membrane is thin and homogeneous, and is covered on its upper and under surfaces by a layer of epithelium. The periosteum, forming the outer wall of the ductus cochlearis, is greatly thickened and altered in character, and is called the spiral ligament. It projects inward below as a triangular prominence, the basilar crest, which gives attachment to the outer edge of the basilar membrane. Immediately above the crest is a concavity, the sulcus spiralis externus. The upper portion of the spiral ligament contains numerous capillary loops and small blood vessels, and is termed the stria vascularis. The osseous spiral lamina consists of two plates of bone, and between these are the canals for the transmission of the filaments of the acoustic nerve. On the upper plate of that part of the lamina which is outside the vestibular membrane, the periosteum is thickened to form the limbus laminae spiralis. This ends externally in a concavity, the sulcus spiralis internus, which represents, on section, the form of the letter C. The upper part, formed by the overhanging extremity of the limbus, is named the vestibular lip. The lower part, prolonged and tapering, is called the tympanic lip, and is perforated by numerous foramina for the passage of the cochlear nerves. The upper surface of the vestibular lip is intersected at right angles by a number of furrows, between which are numerous elevations. These present the appearance of teeth along the free surface and margin of the lip, and have been named by Huschler the auditory teeth. The limbus is covered by a layer of what appears to be squamous epithelium, but the deeper parts of the cells with their contained nuclei occupy the intervals between the elevations and between the auditory teeth. This layer of epithelium is continuous on the one hand with that lining the sulcus spiralis internus, and on the other with that covering the undersurface of the vestibular membrane. Basilar membrane. The basilar membrane stretches from the tympanic lip of the osseous spiral lamina to the basilar crest, and consists of two parts, an inner and an outer. The inner is thin, and is named the zona arcuata. It supports the spiral organ of Corti. The outer is thicker and striated, and is termed the zona pectinata. The under surface of the membrane is covered by a layer of vascular connective tissue. One of the vessels in this tissue is somewhat larger than the rest, and is named the vas spirale. It lies below Corti's tunnel. The spiral organ of Corti, organon spirale, Corti, organ of Corti, is composed of a series of epithelial structures placed upon the inner part of the basilar membrane. The more central of these structures are two rows of rod-like bodies, the inner and outer rods or pillars of Corti. The bases of the rods are supported on the basilar membrane, those of the inner row at some distance from those of the outer, the two rows inclined toward each other and, coming into contact above, enclose between them and the basilar membrane a triangular tunnel, the tunnel of Corti. On the inner side of the inner rods is a single row of hair cells, and on the outer side of the outer rods 3 or 4 rows of similar cells, together with certain supporting cells termed the cells of Dietz and Hensen. The free ends of the outer hair cells occupy a series of apertures in a net-like membrane, the reticular membrane, and the entire organ is covered by the tectorial membrane. Rods of Corti. Each of these consists of a base or footplate, and elongated part or body, and an upper end or head. The body of each rod is finely striated, but in the head there is an oval, non-striated portion which stains deeply with carmine. Occupying the angles between the rods and the basilar membrane are nucleated cells which partly envelop the rods and extend onto the floor of Corti's tunnel. These may be looked upon as the undifferentiated parts of the cells from which the rods have been formed. The inner rods number nearly 6,000, and their bases rest on the basilar membrane close to the tympanic lip of the sulcus spiralis internus. The shaft or body of each is sinuously curved and forms an angle of about 60 degrees with the basilar membrane. The head resembles the proximal end of the ulna, and presents a deep concavity which accommodates a convexity on the head of the outer rod. The head plate or portion overhanging the concavity overlaps the head plate of the outer rod. The outer rods, nearly 4,000 in number, are longer and more obliquely set than the inner, forming with the basilar membrane an angle of about 40 degrees. Their heads are convex internally. They fit into the concavities on the heads of the inner rods and are continued outward as thin flattened plates, termed phalangeal processes, which unite with the phalangeal processes of Dietz cells to form the reticular membrane. Hair cells. The hair cells are short columnar cells. Their free ends are on a level with the heads of Corti's rods, and each is surmounted by about 20 hair-like processes, arranged in the form of a crescent with its concavity directed inward. The deep ends of the cells reach about halfway along Corti's rods, and each contains a large nucleus. In contact with the deep ends of the hair cells are the terminal filaments of the cochlear division of the acoustic nerve. The inner hair cells are arranged in a single row on the medial side of the inner rods, and their diameters being greater than those of the rods, it follows that each hair cell is supported by more than one rod. The free ends of the inner hair cells are encircled by a cuticular membrane which is fixed to the heads of the inner rods. Adjoining the inner hair cells are 1 or 2 rows of columnar supporting cells, which, in turn, are continuous with the cubical cells lining the sulcus spiralis internus. The outer hair cells number about 12,000, and are nearly twice as long as the inner. In the basal coil of the cochlea they are arranged in 3 regular rows, in the apical coil in 4 somewhat irregular rows. Between the rows of the outer hair cells are rows of supporting cells, called the cells of Dietz. Their expanded bases are planted on the basilar membrane, while the opposite end of each presents a clubbed extremity or phalangeal process. Immediately to the outer side of Dietz cells are 5 or 6 rows of columnar cells, the supporting cells of Hensen. Their bases are narrow, while their upper parts are expanded and form a rounded elevation on the floor of the ductus cochlearis. The columnar cells lying outside Henson cells are termed the cells of Claudius. A space exists between the outer rods of Corti and the adjacent hair cells. This is called the space of Newell. The rectangular lamina is a delicate framework perforated by rounded holes, which are occupied by the free ends of the outer hair cells. It extends from the heads of the outer rods of Corti to the external row of the outer hair cells, and is formed by several rows of minute fiddle-shaped cuticular structures, called phalanges, between which are circular apertures containing the free ends of the hair cells. The innermost row of phalanges consists of the phalangeal processes of the outer rods of Corti. The outer rows are formed by the modified free ends of Dieter's cells. Covering the sulcus spiralis internus and the spiral organ of Corti is the tectorial membrane, which is attached to the limbus laminae spiralis close to the inner edge of the vestibular membrane. Its inner part is thin and overlies the auditory teeth of Huschka. Its outer part is thick, and along its lower surface, opposite the inner hair cells, is a clear band, named Henson's stripe, due to the intercrossing of its fibres. The lateral margin of the membrane is much thinner. Hardesty considers the tectorial membrane as the vibrating mechanism in the cochlea. It is inconceivably delicate and flexible, far more sensitively flexible in the transverse than in the longitudinal direction, and the readiness with which it bends when touched is beyond description. It is ectodermal in origin. It consists of fine, colourless fibres embedded in a transparent matrix. The matrix may be a variety of soft keratin, of a soft collagenous, semi-solid character with marked adhesiveness. The general transverse direction of the fibres inclines from the radius of the cochlea toward the apex. The acoustic nerve, nervus acousticus, auditory nerve or nerve of hearing, divides near the bottom of the internal acoustic meatus into an anterior or cochlear and a posterior or vestibular branch. The vestibular nerve, nervus vestibularis, supplies the utricle, the saccule, and the ampullae of the semicircular ducts. On the trunk of the nerve, within the internal acoustic meatus, is a ganglion, the vestibular ganglion, ganglion of Scarpa. The fibres of the nerve arise from the cells of this ganglion. On the distal side of the ganglion the nerve splits into a superior, an inferior, and a posterior branch. The filaments of the superior branch are transmitted through the foramina in the area vestibularis superior, and end in the macula of the utricle and in the ampullae of the superior and lateral semicircular ducts. Those of the inferior branch traverse the foramina in the area vestibularis inferior, and end in the macula of the saccule. The posterior branch runs through the foramen singulare at the postero-inferior part of the bottom of the meatus, and divides into filaments for the supply of the ampulla of the posterior semicircular duct. The cochlear nerve, nervus cochlearis, divides into numerous filaments at the base of the modiolus. Those for the basal and middle coils pass through the foramina in the tractus spiralis foraminosus. Those for the apical coil through the canalis centralis, and the nerves bend outward to pass between the lamellae of the osseous spiral lamina. Occupying the spiral canal of the modiolus is the spiral ganglion of the cochlea, ganglion of Corti, consisting of bipolar nerve cells, which constitute the cells of origin of this nerve. Reaching the outer edge of the osseous spiral lamina, the fibres of the nerve pass through the foramina in the tympanic lip. Some end by arborizing around the bases of the inner hair cells, while others pass between Corti's rods and across the tunnel, to end in a similar manner in relation to the outer hair cells. The cochlear nerve gives off a vestibular branch to supply the vestibular end of the ductus cochlearis. The filaments of this branch pass through the foramina in the fossa cochlearis. Vessels. The arteries of the labyrinth are the internal auditory, from the basilar, and the stylomastoid, from the posterior auricula. The internal auditory artery divides at the bottom of the internal acoustic meatus into two branches, cochlear and vestibular. The cochlear branch subdivides into 12 or 14 twigs, which traverse the canals in the modiolus, and are distributed, in the form of a capillary network, in the lamina spiralis and basilar membrane. The vestibular branches are distributed to the utricle, saccule, and semicircular ducts. The veins of the vestibule and semicircular canals accompany the arteries and, receiving those of the cochlea at the base of the modiolus, unite to form the internal auditory veins, which end in the posterior part of the superior petrosal sinus, or in the transverse sinus. End of section 60.
Section 61 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by David Lawrence. Anatomy of the Human Body, Part 4, by Henry Gray. 1E. Peripheral terminations of nerves of general sensations. The peripheral terminations of the nerves associated with general sensations, i.e., the muscular sense and the senses of heat, cold, pain, and pressure, are widely distributed throughout the body. These nerves may end free among the tissue elements, or in special end organs, where the terminal nerve filaments are enclosed in capsules. Free nerve endings occur chiefly in the epidermis and in the epithelium covering certain mucous membranes. They are well seen also in the stratified squamous epithelium of the corona, and are also found in the root sheaths and papillae of the hairs, and around the bodies of the sudoriferous glands. When the nerve fiber approaches its termination, the medullary sheath suddenly disappears, leaving only the axis cylinder surrounded by the neurolemma. After a time, the fiber loses its neurolemma and consists only of an axis cylinder, which can be seen in preparation stained with chloride of gold, to be made up of fine varicose fibrillae. Finally, the axis cylinder breaks up into its constituent fibrillae, which often present regular varicosities and anastomose with one another, and end in small knobs or discs between the epithelial cells. Under this heading may be classed the tactile discs described by Merkel as occurring in the epidermis of the pig's snout, where the fibrillae of the axis cylinder end in cup-shaped discs in apposition with large epithelial cells. The special end organs exhibit great variety in size and shape, but have one feature in common, viz., the terminal nerve fibrillae are enveloped by a capsule. Included in this group are the end bulbs of Krauss, the corpuscles of Grandry, of Pacini, of Golgi and Mazzoni, of Wagner and Meissner, and the neurotendinous and neuromuscular spindles. The end bulbs of Krauss are minute cylindrical or oval bodies, consisting of a capsule formed by the expansion of the connective tissue sheath of a medullated fiber, and containing a soft semifluid core in which the axis cylinder terminates either in a bulbous extremity or in a coiled up plexiform mass. End bulbs are found in the conjunctiva of the eye, where they are spheroidal in shape in man, but cylindrical in most other animals. In the mucous membrane of the lips and tongue, and in the epineurium of nerve trunks. They are also found in the penis and the clitoris, and have received the name of genital corpuscles. In these situations they have a mulberry-like appearance, being constricted by connective tissue septa into from 2 to 6 knob-like masses. In the synovial membranes of certain joints, e.g., those of the fingers, rounded or oval end bulbs occur, and are designated articular end bulbs. The tactile corpuscles of Grandi occur in the papillae of the beak and tongue of birds. Each consists of a capsule composed of a very delicate nucleated membrane, and contains 2 or more granular, somewhat flattened cells. Between these cells the axis cylinder ends in flattened discs. The Pacinian corpuscles are found in the subcutaneous tissue on the nerves of the palm of the hand and sole of the foot, and in the genital organs of both sexes. They also occur in connection with the nerves of the joints, and in some other situations, as in the mesentery and pancreas of the cat, and along the tibia of the rabbit. Each of these corpuscles is attached to and encloses the termination of a single nerve fiber. The corpuscle, which is perfectly visible to the naked eye, and which can be most easily demonstrated in the mesentery of a cat, consists of a number of lamella or capsules arranged more or less concentrically around a central clear space in which the nerve fiber is contained. Each lamella is composed of bundles of fine connective tissue fibers, and is lined on its inner surface by a single layer of flattened epithelioid cells. The center clear space, which is elongated or cylindrical in shape, is filled with a transparent core, in the middle of which the axis cylinder transverses the space to near its distal extremity, where it ends in one or more small knobs. Todd and Bowman have described minute arteries as entering by the sides of the nerves, and forming capillary loops in the intercapsular spaces, and even penetrating into the central space. Herbst has described a nerve ending somewhat similar to the Pacinian corpuscle in the mucous membrane of the tongue of the duck, and in some other situations. It differs, however, from the Pacinian corpuscle in being smaller, in its capsules being more closely approximated, and especially in the act that the axis cylinder in the central clear space is coated with a continuous row of nuclei. These bodies are known as the corpuscles of Herbst. The corpuscles of Golgi and Mazzoni are found in the subcutaneous tissue of the pulp of the fingers. They differ from Pacinian corpuscles in that their capsules are thinner, their contained cores thicker, and in the latter the axis cylinders ramify more extensively and end in flat expansions. The tactile corpuscles of Wagner and Meissner are oval-shaped bodies. Each is enveloped by a connective tissue capsule, and imperfect membranous septa derived from this penetrate the interior. The axis cylinder passes through the capsule, and after making several spiral turns around the body of the corpuscle, ends in small globular or pyriform enlargements. These tactile corpuscles occur in the papillae of the corium of the hand and foot, the front of the forearm, the skin of the lips, the mucous membrane of the tip of the tongue, the palpebral conjunctiva, and the skin of the mammary papilla. Corpuscles of Ruffini. Ruffini described a special variety of nerve endings in the subcutaneous tissue of the human finger. They are principally situated at the junction of the corium with the subcutaneous tissue. They are oval in shape and consist of strong connective tissue sheaths, inside which the nerve fibers divide into numerous branches, which show varicosities and end in small free knobs. The neurotendinous spindles, organs of Golgi, are chiefly found near the junctions of tendons and muscles. Each is enclosed in a capsule which contains a number of enlarged tendon fasciculi, intrafusal fasciculi. One or more nerve fibers perforate the side of the capsule and lose their medullary sheaths. The axis cylinders subdivide and end between the tendon fibers in irregular discs or varicosities. The neuromuscular spindles are present in the majority of voluntary muscles, and consist of small bundles of particular muscular fibers, intrafusal fibers, embryonic in type, invested by capsules, within which nerve fibers, experimentally shown to be sensory in origin, terminate. These neuromuscular spindles vary in length from 0.8 mm to 5 mm, and have a distinctly fusiform appearance. The large medullated nerve fibers passing to the end organ are from 1 to 3 or 4 in number. Entering the fibrous capsule, they divide several times and, losing their medullary sheaths, ultimately end in naked axis cylinders encircling the intrafusal fibers by flattened expansions, or irregular ovoid or rounded discs. Neuromuscular spindles have not yet been demonstrated in the tongue muscles, and only a few exist in the ocular muscles. End of section 61. Recording by David Lawrence in Brampton, Ontario, September 2009.
Section 62 of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recorded by Laurie Anne Walden. Anatomy of the Human Body, Part 4, by Henry Gray. The Common Integument, Part 1. Integumentum commune, skin. The integument covers the body and protects the deeper tissues from injury, from drying, and from invasion by foreign organisms. It contains the peripheral endings of many of the sensory nerves. It plays an important part in the regulation of the body temperature, and has also limited excretory and absorbing powers. It consists principally of a layer of vascular connective tissue named the corium or cutis vera, and an external covering of epithelium termed the epidermis or cuticle. On the surface of the former layer are sensitive and vascular papillae. Within or beneath it are certain organs with special functions, namely the sudoriferous and sebaceous glands and the hair follicles. The epidermis, cuticle, or scarf skin is non-vascular and consists of stratified epithelium, and is accurately molded on the papillary layer of the corium. It varies in thickness in different parts. In some situations, as in the palms of the hands and soles of the feet, it is thick, hard, and horny in texture. This may be in a measure due to the fact that these parts are exposed to intermittent pressure, but that this is not the only cause is proved by the fact that the condition exists to a very considerable extent at birth. The more superficial layers of cells, called the horny layer, stratum corneum, may be separated by maceration from a deeper stratum, which is called the stratum mucosum, and which consists of several layers of differently shaped cells. The free surface of the epidermis is marked by a network of linear furrows of variable size, dividing the surface into a number of polygonal or lozenge-shaped areas. Some of these furrows are large, as opposite the flexures of the joints, and correspond to the folds in the corium produced by movements. In other situations, as upon the back of the hand, they are exceedingly fine, and intersect one another at various angles. Upon the palmar surfaces of the hands and fingers, and upon the soles of the feet, the epidermal ridges are very distinct, and are disposed in curves. They depend upon the large size and peculiar arrangements of the papillae upon which the epidermis is placed. The function of these ridges is primarily to increase resistance between contact surfaces for the purpose of preventing slipping, whether in walking or prehension. The direction of the ridges is at right angles with the force that tends to produce slipping, or to the resultant of such forces, when these forces vary in direction. Footnote: Professor Arthur Thomson of Oxford suggests that the contraction of these muscles on follicles which contain weak, flat hairs will tend to produce a permanent curve in the follicle, and this curve will be impressed on the hair which is molded within it, so that the hair, on emerging through the skin, will be curled. Curved hair follicles are characteristic of the scalp of the Bushman. End footnote. In each individual the lines on the tips of the fingers and thumbs form distinct patterns unlike those of any other person. A method of determining the identity of a criminal is based on this fact, impressions, fingerprints, of these lines being made on paper covered with soot, or on white paper after first covering the fingers with ink. The deep surface of the epidermis is accurately molded upon the papillary layer of the corium, the papillae being covered by a basement membrane, so that when the epidermis is removed by maceration, it presents on its undersurface a number of pits or depressions corresponding to the papillae, and ridges corresponding to the intervals between them. Fine tubular prolongations are continued from this layer into the ducts of the sudoriferous and sebaceous glands. The epidermis consists of stratified epithelium which is arranged in 4 layers from within outward as follows: A. Stratum mucosum, B. Stratum granulosum, C. Stratum lucidum, and D. Stratum corneum. The stratum mucosum, mucus layer, is composed of several layers of cells. Those of the deepest layer are columnar in shape, and placed perpendicularly on the surface of the basement membrane, to which they are attached by toothed extremities. This deepest layer is sometimes termed the stratum germinativum. The succeeding strata consist of cells of a more rounded or polyhedral form, the contents of which are soft, opaque, granular, and soluble in acetic acid. These are known as prickle cells, because of the bridges by which they are connected to one another. They contain fine fibrils which are continuous across the connecting processes with corresponding fibrils in adjacent cells. Between the bridges are fine intercellular clefts serving for the passage of lymph, and in these lymph corpuscles or pigment granules may be found. The stratum granulosum comprises 2 or 3 layers of flattened cells which contain granules of alidin, a substance readily stained by hematoxylin or carmine, and probably an intermediate substance in the formation of keratin. They are supposed to be cells in a transitional stage between the protoplasmic cells of the stratum mucosum and the horny cells of the superficial layers. The stratum lucidum appears in section as a homogeneous or dimly striated membrane, composed of closely packed cells in which traces of flattened nuclei may be found, and in which minute granules of a substance named keratohyalin are present. The stratum corneum, horny layer, consists of several layers of horny epithelial scales in which no nuclei are discernible, and which are unaffected by acetic acid, the protoplasm having become changed into horny material, or keratin. According to Ranvier, they contain granules of a material which has the characteristics of beeswax. The black color of the skin in the negro, and the tawny color among some of the white races, is due to the presence of pigment in the cells of the epidermis. This pigment is more especially distinct in the cells of the stratum mucosum, and is similar to that found in the cells of the pigmentary layer of the retina. As the cells approach the surface and desiccate, the color becomes partially lost. The disappearance of the pigment from the superficial layers of the epidermis is, however, difficult to explain. The pigment, melanin, consists of dark brown or black granules of very small size, closely packed together within the cells, but not involving the nucleus. The main purpose served by the epidermis is that of protection; as the surface is worn away, new cells are supplied, and thus the true skin, the vessels and nerves which it contains, are defended from damage. The corium, cutis vera, dermis, or true skin, is tough, flexible, and highly elastic. It varies in thickness in different parts of the body. Thus it is very thick in the palms of the hand and soles of the feet, thicker on the posterior aspect of the body than on the front, and on the lateral than on the medial sides of the limbs. In eyelids, scrotum, and penis it is exceedingly thin and delicate. It consists of felted connective tissue with a varying amount of elastic fibers and numerous blood vessels, lymphatics, and nerves. The connective tissue is arranged in 2 layers, a deeper or reticular, and a superficial or papillary. Unstriped muscular fibers are found in the superficial layers of the corium, wherever hairs are present, and in the subcutaneous areolar tissue of the scrotum, penis, labia majora, and nipples. In the nipples the fibers are disposed in bands, closely reticulated and arranged in superimposed laminae. The reticular layer, stratum reticulare, deep layer, consists of strong interlacing bands, composed chiefly of white fibrous tissue, but containing some fibers of yellow elastic tissue, which vary in number in different parts, and connective tissue corpuscles, which are often to be found flattened against the white fibrous tissue bundles. Toward the attached surface the fasciculi are large and coarse, and the areolae left by their interlacement are large, and occupied by adipose tissue and sweat glands. Below the reticular layer is the subcutaneous areolar tissue, which, except in a few situations, contains fat. The papillary layer, stratum papillare, superficial layer, corpus papillare of the corium, consists of numerous small, highly sensitive, and vascular eminences, the papillae, which rise perpendicularly from its surface. The papillae are minute conical eminences, having rounded or blunted extremities, occasionally divided into 2 or more parts, and are received into corresponding pits on the undersurface of the cuticle. On the general surface of the body, more especially in parts endowed with slight sensibility, they are few in number and exceedingly minute. But in some situations, as upon the palmar surfaces of the hands and fingers, and upon the plantar surfaces of the feet and toes, they are long, of large size, closely aggregated together, and arranged in parallel curved lines, forming the elevated ridges seen on the free surface of the epidermis. Each ridge contains 2 rows of papillae, between which the ducts of the sudoriferous glands pass outward to open on the summit of the ridge. Each papilla consists of very small and closely interlacing bundles of finely fibrillated tissue, with a few elastic fibers. Within this tissue is a capillary loop, and in some papillae, especially in the palms of the hands and the fingers, there are tactile corpuscles. Development. The epidermis and its appendages, consisting of the hairs, nails, sebaceous and sweat glands, are developed from the ectoderm, while the corium, or true skin, is of mesodermal origin. About the 5th week the epidermis consists of 2 layers of cells, the deeper one corresponding to the rete mucosum. The subcutaneous fat appears about the 4th month, and the papillae of the true skin about the 6th. A considerable desquamation of epidermis takes place during fetal life, and this desquamated epidermis, mixed with sebaceous secretion, constitutes the vernix caseosa with which the skin is smeared during the last 3 months of fetal life. The nails are formed at the 3rd month, and begin to project from the epidermis about the 6th. The hairs appear between the 3rd and 4th months, in the form of solid downgrowths of the deeper layer of the epidermis, the growing extremities of which become inverted by papillary projections from the corium. The central cells of the solid downgrowths undergo alteration to form the hair, while the peripheral cells are retained to form the lining cells of the hair follicle. About the 5th month the fetal hairs, lanugo, appear, first on the head and then on the other parts. They drop off after birth and give place to the permanent hairs. The cellular structures of the sudoriferous and sebaceous glands are formed from the ectoderm, while the connective tissue and blood vessels are derived from the mesoderm. All the sweat glands are fully formed at birth. They begin to develop as early as the 4th month. The arteries supplying the skin form a network in the subcutaneous tissue, and from this network branches are given off to supply the sudoriferous glands, the hair follicles, and the fat. Other branches unite in a plexus immediately beneath the corium. From this plexus fine capillary vessels pass into the papillae, forming, in the smaller ones, a single capillary loop, but in the larger, a more or less convoluted vessel. The lymphatic vessels of the skin form 2 networks, superficial and deep, which communicate with each other and with those of the subcutaneous tissue by oblique branches. The nerves of the skin terminate partly in the epidermis and partly in the corium. Their different modes of ending are described on pages 1059 to 1061. End of section 62. Section 63 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recorded by Laurie Anne Walden. Anatomy of the Human Body, Part 4, by Henry Gray. The Common Integument, Part 2. The appendages of the skin. The appendages of the skin are the nails, the hairs, and the sudoriferous and sebaceous glands with their ducts. The nails, ungues, are flattened elastic structures of a horny texture, placed upon the dorsal surfaces of the terminal phalanges of the fingers and toes. Each nail is convex on its outer surface, concave within, and is implanted by a portion, called the root, into a groove in the skin. The exposed portion is called the body, and the distal extremity the free edge. The nail is firmly adherent to the corium, being accurately molded upon its surface. The part beneath the body and root of the nail is called the nail matrix, because from it the nail is produced. Under the greater part of the body of the nail, the matrix is thick and raised into a series of longitudinal ridges which are very vascular, and the color is seen through the transparent tissue. Near the root of the nail the papillae are smaller, less vascular, and have no regular arrangement, and here the tissue of the nail is not firmly adherent to the connective tissue stratum, but only in contact with it. Hence this portion is of a whiter color, and is called the lunula on account of its shape. The cuticle, as it passes forward on the dorsal surface of the finger or toe, is attached to the surface of the nail a little in advance of its root. At the extremity of the finger it is connected with the under surface of the nail a little behind its free edge. The cuticle and the horny substance of the nail, both epidermic structures, are thus directly continuous with each other. The superficial horny part of the nail consists of a greatly thickened stratum lucidum, the stratum corneum forming merely the thin cuticular fold, eponychium, which overlaps the lunula. The deeper part consists of the stratum mucosum. The cells in contact with the papillae of the matrix are columnar in form and arranged perpendicularly to the surface. Those which succeed them are of a rounded or polygonal form, the more superficial ones becoming broad, thin, and flattened, and so closely packed as to make the limits of the cells very indistinct. The nails grow in length by the proliferation of the cells of the stratum mucosum at the root of the nail, and in thickness from that part of the stratum mucosum which underlies the lunula. Hairs, pilli, are found on nearly every part of the surface of the body, but are absent from the palms of the hands, the soles of the feet, the dorsal surfaces of the terminal phalanges, the glans penis, the inner surface of the prepuce, and the inner surfaces of the labia. They vary much in length, thickness, and color in different parts of the body, and in different races of mankind. In some parts, as in the skin of the eyelids, they are so short as not to project beyond the follicles containing them. In others, as upon the scalp, they are of considerable length. Again, in other parts, as the eyelashes, the hairs of the pubic region, and the whiskers and beard, they are remarkable for their thickness. Straight hairs are stronger than curly hairs, and present on transverse section a cylindrical or oval outline. Curly hairs, on the other hand, are flattened. A hair consists of a root, the part implanted in the skin, and a shaft or scapus, the portion projecting from the surface. The root of the hair, radix pili, ends in an enlargement, the hair bulb, which is whiter in color and softer in texture than the shaft, and is lodged in a follicular involution of the epidermis called the hair follicle. When the hair is of considerable length, the follicle extends into the subcutaneous cellular tissue. The hair follicle commences on the surface of the skin with a funnel-shaped opening, and passes inward in an oblique or curved direction, the latter in curly hairs, to become dilated at its deep extremity, where it corresponds with the hair bulb. Opening into the follicle, near its free extremity, are the ducts of one or more sebaceous glands. At the bottom of each hair follicle is a small, conical, vascular eminence or papilla, similar in every respect to those found upon the surface of the skin. It is continuous with the dermic layer of the follicle, and is supplied with nerve fibrils. The hair follicle consists of two coats, an outer or dermic, and an inner or epidermic. The outer or dermic coat is formed mainly of fibrous tissue. It is continuous with the corium, is highly vascular, and supplied by numerous minute nervous filaments. It consists of 3 layers. The most internal is a hyaline basement membrane, which is well marked in the larger hair follicles, but is not very distinct in the follicles of minute hairs. It is limited to the deeper part of the follicle. Outside this is a compact layer of fibers and spindle-shaped cells arranged circularly around the follicle. This layer extends from the bottom of the follicle as high as the entrance of the ducts of the sebaceous glands. Externally is a thick layer of connective tissue arranged in longitudinal bundles, forming a more open texture and corresponding to the reticular part of the corium. In this are contained the blood vessels and nerves. The inner or epidermic coat is closely adherent to the root of the hair, and consists of 2 strata named respectively the outer and inner root sheaths. The former of these corresponds with the stratum mucosum of the epidermis, and resembles it in the rounded form and soft character of its cells. At the bottom of the hair follicle these cells become continuous with those of the root of the hair. The inner root sheath consists of 1. A delicate cuticle next the hair, composed of a single layer of imbricated scales with atrophied nuclei. 2. 1 or 2 layers of horny, flattened, nucleated cells, known as Huxley's layer. And 3. A single layer of cubical cells with clear flattened nuclei, called Henle's layer. The hair bulb is molded over the papilla and composed of polyhedral epithelial cells, which as they pass upward into the root of the hair become elongated and spindle-shaped, except some in the center which remain polyhedral. Some of these latter cells contain pigment granules which give rise to the color of the hair. It occasionally happens that these pigment granules completely fill the cells in the center of the bulb. This gives rise to the dark tract of pigment often found, of greater or less length, in the axis of the hair. The shaft of the hair, scapus pili, consists, from within outward, of three parts, the medulla, the cortex, and the cuticle. The medulla is usually wanting in the fine hairs covering the surface of the body, and commonly in those of the head. It is more opaque and deeper colored than the cortex when viewed by transmitted light, but when viewed by reflected light it is white. It is composed of rows of polyhedral cells containing granules of alidin and frequently air spaces. The cortex constitutes the chief part of the shaft. Its cells are elongated and united to form flattened fusiform fibers, which contain pigment granules in dark hair and air in white hair. The cuticle consists of a single layer of flat scales which overlap one another from below upward. Connected with the hair follicles are minute bundles of involuntary muscular fibers, termed the arrectores pilorum. They arise from the superficial layer of the corium, and are inserted into the hair follicle below the entrance of the duct of the sebaceous gland. They are placed on the side toward which the hair slopes, and by their action diminish the obliquity of the follicle and elevate the hair. The sebaceous gland is situated in the angle which the erector muscle forms with the superficial portion of the hair follicle, and contraction of the muscle thus tends to squeeze the sebaceous secretion out from the duct of the gland. The sebaceous glands, glandulae sebaceae, are small, sacculated, glandular organs, lodged in the substance of the corium. They are found in most parts of the skin, but are especially abundant in the scalp and face. They are also very numerous around the apertures of the anus, nose, mouth, and external ear, but are wanting in the palms of the hands and soles of the feet. Each gland consists of a single duct, more or less capacious, which emerges from a cluster of oval or flask-shaped alveoli, which vary from 2 to 5 in number, but in some instances there may be as many as 20. Each alveolus is composed of a transparent basement membrane, enclosing a number of epithelial cells. The outer or marginal cells are small and polyhedral, and are continuous with the cells lining the duct. The remainder of the alveolus is filled with larger cells containing fat, except in the center, where the cells have become broken up, leaving a cavity filled with their debris and a mass of fatty matter, which constitutes the sebum cutaneum. The ducts open most frequently into the hair follicles, but occasionally upon the general surface, as in the labia minora and the free margin of the lips. On the nose and face the glands are of large size, distinctly lobulated, and often become much enlarged from the accumulation of pent-up secretion. The tarsal glands of the eyelids are elongated sebaceous glands with numerous lateral diverticula. The sudoriferous or sweat glands, glandulae sudoriferae, are found in almost every part of the skin, and are situated in small pits on the under surface of the corium, or, more frequently, in the subcutaneous areolar tissue, surrounded by a quantity of adipose tissue. Each consists of a single tube, the deep part of which is rolled into an oval or spherical ball, named the body of the gland, while the superficial part, or duct, traverses the corium and cuticle and opens on the surface of the skin by a funnel-shaped aperture. In the superficial layers of the corium the duct is straight, but in the deeper layers it is convoluted or even twisted. Where the epidermis is thick, as in the palms of the hands and soles of the feet, the part of the duct which passes through it is spirally coiled. The size of the glands varies. They are especially large in those regions where the amount of perspiration is great, as in the axilli, where they form a thin, mammillated layer of a reddish color, which corresponds exactly to the situation of the hair in this region. They are large also in the groin. Their number varies. They are very plentiful on the palms of the hands and on the soles of the feet, where the orifices of the ducts are exceedingly regular, and open on the curved ridges. They are least numerous in the neck and back. On the palm there are about 370 per square centimeter, on the back of the hand about 200, forehead 175, breast, abdomen, and forearm 155, and on the leg and back from 60 to 80 per square centimeter. Krause estimates the total number at about 2,000,000. The average number of sweat glands per square centimeter of skin area in various races as shown by the fingers is as follows: American, white, 558.2; American, negro, 597.2; Filipino, 653.6; Moro, 684.4; Negrito, adult, 709.2; Hindu, 738.2; Negrito, youth, 950. They are absent in the deeper portion of the external auditory meatus, the prepuce, and the glans penis. The tube, both in the body of the gland and in the duct, consists of two layers, an outer, of fine areolar tissue, and an inner, of epithelium. The outer layer is thin and is continuous with the superficial stratum of the corium. In the body of the gland the epithelium consists of a single layer of cubical cells, between the deep ends of which and the basement membrane is a layer of longitudinally or obliquely arranged non-striped muscular fibers. The ducts are destitute of muscular fibers and are composed of a basement membrane lined by 2 or 3 layers of polyhedral cells. The lumen of the duct is coated by a thin cuticle. When the cuticle is carefully removed from the surface of the corium, the ducts may be drawn out in the form of short thread-like processes on its under surface. The ceruminous glands of the external acoustic meatus and the ciliary glands at the margin of the eyelids are modified sudoriferous glands. End of Section 63. End of Anatomy of the Human Body, Part 4, by Henry Gray.